Well, good morning, Minister. Good morning, members, everyone in attendance. It's good to have you here. Before we start, I'll just lay out a few ground rules. If everyone in the auditorium can please be respectful of proceedings and keep it orderly. I've let the opposition leader member know that we will be doing what we do in the House effectively, 1 primary and 3 supplementaries, and then we'll open it up to other folks. That doesn't preclude you from coming in with additional questions as you so wish. I will endeavour to give around 2/3 of the questioning to the opposition members.
Mr. Chair, just a clarification on the supplementaries rule.
Yes.
I'm assuming that's flexible. If our members developing a particular line that's going somewhere, you won't be cutting them off at 3 as a matter of course.
I'll use my discretion on that, Dr. Webb.
Yeah, just it's about that.
Free flowing questioning. Yeah, I do appreciate that, but I also acknowledge that we have an hour and members from a number of opposition parties and from the government. Well, but I do take your point. All right, let's keep it clean and have fun. Minister, have you in here for an hour? That gives you 3 minutes to make some introductory remarks, and then we'll open up for questions.
Well, thank you, Mr. Chair and members of the committee. I'd like to begin by acknowledging the thousands of health professionals working across our health system every day. Doctors, nurses, midwives, allied health professionals, healthcare assistants, support staff who are the backbone of our health system. Their dedication and professionalism make an enormous difference to the lives of New Zealanders, and I thank them for the work they do. Here with Audrey Sonnerson, Director General of Health, and with Dr. Dale Bramley, Chief Executive of Health New Zealand, and other officials who are available to answer questions. This government's focus is to ensure New Zealanders have access to timely, quality care they deserve. After years of New Zealanders experiencing growing waiting lists and declining performance, we're turning the system around by fixing the basics and building the future of a system that delivers for the people who rely on it. Progress is being made in a number of key areas. We're on track for a record number of elective surgeries to be delivered this year. Childhood immunisation rates continue to increase for 2-year-olds, with the largest increases in Māori and Pacific communities. Patients are spending less time waiting in EDs. More patients are receiving cancer treatments they otherwise wouldn't have had access to. And across the system, there's a renewed focus on performance, delivery and outcomes. However, there is still more work to do, and Budget 26 builds on this progress. This year's budget delivered a record level of investment in health. Total core Crown health spending will reach $34.2 billion in 26-27, an increase of more than 6% on the previous year. Total vote health funding will exceed $33 billion. Budget 26 provides more than $5.8 billion in new operating funding for vote health across the forecast period. Importantly, alongside funding to support frontline delivery, Budget 26 invests in targeted initiatives that will improve outcomes for patients and families. Lowering the eligibility of the National Bulk Bowel Screening Program to 56, the next step in our plan to match our screening age with Australia. Strengthening road ambulance services, additional funding for Pharmac to respond to growing demand and improve access to medicines, additional support for mothers and babies, enabling longer post-birth stays in hospitals and primary maternity units, establishing a nationally coordinated specialist paediatric palliative care service, providing compassionate support for children and families facing some of life's most difficult circumstances, as well as investment in cybersecurity to better support the health system and investment to modernise Health New Zealand's digital systems. Budget 26 also invests more than $680 million into strengthening hospital infrastructure, such as a new 158-bed ward tower at Whangarei Hospital, planning enabling works for major redevelopments at Tauranga, Hawke's Bay and Palmerston North hospitals, acquisition of land for a future hospital in South Auckland, infrastructure upgrades at Auckland's Mason Clinic. The budget also supports the continued construction of the new Dunedin Hospital inpatient building and the establishment costs for the new medical school at the University of Waikato. Mr. Chair, the government has set a clear direction for our health system. The government is restoring a culture of performance and accountability. We're investing in frontline services. We're rebuilding health infrastructure, growing the workforce, and maintaining a relentless focus on delivering results for patients. With that, happy to answer questions.
Thank you, Minister. Dr. Verrill.
Thank you, Mr. Chair. Thank you, Minister. Your commitment to a 3-day postnatal stay is included in this budget. How did you cost the entitlement for the first 2 years, where $1.6 million is allocated each year for that commitment?
Yeah, so the Ministry provided advice to me as the Minister in relation to the implementation of this policy. And as members of this committee will know, having sat on the committee which considered the bill, the implementation has been part of the conversation around how this would be delivered. On budget day, we announced that the government, or the day after budget, we announced the government intends to phase the bill's implementation to ensure the system is ready to deliver the entitlement safely. Health New Zealand will begin by using existing capacity and will then work closely with maternity providers to meet local community needs. The funding will be rolled out through a staged implementation over 3 years, allowing time to grow both workforce and bed capacity. First-time mothers will be prioritised in the first 2 years where capacity already exists, with full access for all women by the end of year 3. This approach gives Health New Zealand time to plan carefully and build capacity while still moving quickly to improve care and support for babies and families. Health New Zealand will prepare annual implementation plans and report progress and uptake to the government, including a formal review after the first 18 months. And so the answer to that question is that we will be phasing the implementation over a period of time. And as I said, the first step will be to make sure that the entitlement is for first mothers in areas where there is capacity, whilst then working with community providers to grow that capacity so that at the end of 3 years, that entitlement is for all mothers.
How many new mothers are there each year, and how many will be able to use this entitlement, given that only $1.6 million is budgeted each year?
So the work is now underway around the implementation plan. So that was what I just said in the last point there. Health New Zealand prepare annual implementation plans and report progress and uptake to the government, including a formal review after the first 18 months. And so the select committee report was very clear that there needs to be a clear implementation timeframe. What we said is that this would be implemented over a period of time. It's not being done overnight because the workforce needs to grow. We need to make sure the capacity exists through community providers. And so there are some districts where that capacity will exist, and the implementation plan will then highlight that. And from that point, once that has been, once that's put together, then there'll be the opportunity to announce which districts that entitlement will be provided. But the reality is we are doing this over a period of time to make sure that we can successfully implement this policy, as I highlighted in my opening remarks there.
Well, Minister, given you're not willing to share numbers with us, my estimate is that only 2,500 bed nights can be purchased with that $1.6 million. So can you guarantee how many women will have this entitlement that you're going to put into law in the first 2 years?
So there will be additional bed nights that will be able to be increased by providing additional staffing or increasing capacity at community providers. Health New Zealand will also be looking
you need to pay the community providers, presumably more than $1.6 million.
Health New Zealand will also be looking at where that capacity already exists. And in some districts, I'm advised there will be existing capacity where that entitlement can be provided. So the number will be a lot greater than what you've suggested, but that's why we will be having an implementation plan, which will be, so the law has to go through Parliament, so that's the next step. There will be, as I said, the government will be phasing the bill's implementation. So there will be an amendment paper to phase the implementation plan as announced as part of the budget. And that will then determine the staging of this entitlement. Within 3 years of the bill passing, the entitlement will be available for all mothers. And so the issue here is that, as was highlighted as part of the select committee process, this was something which received support from across the House. But of course, there were concerns raised around the ability to implement this. And we want to do this in a way that is implementable over a period of time. And within 3 years of the law passing, it will be fully implemented.
Supplementary, I note that when the policy is fully implemented in the final year of the forecast period, the amount funded is half what the ministry estimated in its original advice to this committee. Why are you only funding half the entitlement that your officials thought was necessary? So there's modelling that the officials have provided to me around what the expected uptake will be. And so that uptake is expected. So the entitlement will be there for all mothers. The expected uptake is not all mothers will necessarily choose to take up that uptake. And so the funding has been allocated. Of course, if the uptake is higher, that will be something which Health New Zealand will need to address. But
the point is we've had modelling which is provided to us, which assumes that not all mothers necessarily will take up the
So
uptake,
what's
but
the point of your law that you're passing saying all mothers can get it?
well, all mothers will be able to get it.
Unless half the other mothers choose to take it.
No, all mothers will be entitled to it.
This is a fantasy.
No,
Hold
it's
on,
not.
hold on. The minister's trying to
the-
answer. Please don't interject.
The answer to your question is we are funding the implementation of the legislation, and we
Jenny,
have received modelling from the Ministry of Health in relation to what percentage of mothers are likely to take up the entitlement, but the entitlement will exist for all mothers.
oh, no,
And that is something which,
sorry, actually,
you know, for
come
many,
back to
for many government initiatives, there is modelling taken into account when making decisions around how it is to be implemented.
Jenny Marcroft has a sup. I'll come back to you.
Thank you, Minister. And as you noted, the committee looked at the piece of legislation, which was a member's bill. It's now become a government piece of work, noting also that it's part of the National New Zealand First Coalition
Correct.
agreement to proceed this piece of work. When is your expected timeline for that legislation to be passed? Is it prior to the House rising?
It is prior to the House rising, correct?
Okay.
Yes, it's a priority within the coalition agreement, and it is a priority to get it passed before Parliament concludes at the end of September.
Thank you. Dr. Vera.
My question is to the Director General. Director General, the ministry
Sorry, is
advised.
this a primary? Or
No, it's the same. It's the same question,
Supplementary.
supplementary
Yep.
question. The ministry advised me when I was minister that this policy couldn't be implemented. It then advised the committee that the cost would be twice budgeted. Can you assure the committee that the costings in the budget are sufficient to deliver the policy that is in the bill?
So the implementation is that this will be phased, and so for the first couple of years, it only applies to first-time mothers. First-time mothers already have a length of stay around 2.5 days. So in terms of the modelling that we have done, it tests a number of different assumptions of uptake. Some mothers, particularly second and third, are not as likely to take it up. But we will want to be monitoring what that uptake looks like.
So
Yep.
to be clear then, the reason your advice has changed is because you're assuming, firstly, that first-time mums in the first 2 years already stay nearly 3 days, and secondly, that uptake will not be the 100% that was in your advice to the committee when the bill was before the committee.
Yes, that's correct. The average length of stay for first-time mothers is around 2.5 days. So obviously some are less than that and some are more.
Two
yes.
further questions. Can you assure the committee that the ministry won't change its position on this again after the election?
Sorry.
Well, what risks do you see to being able to deliver the entitlement that is in the bill?
So we have, as the Minister outlined, there's some capacity in the system already. I think we'll be wanting to monitor uptake to ensure that the capacity meets the uptake that we start to see as it rolls through, and that's one of the things we'll be monitoring. And Health New Zealand will be keeping an eye on that, and we will update ministers if we see things moving away from our assumptions in the modelling, which we always use for modelling. I'm sure as Minister, different scenarios, and we will be wanting to.
The issue is the bill is an entitlement. The second point is that is any of this existing capacity in the health system other women's health services that, for example, is delivering elective gynecology services that would mean women would miss out once this entitlement is in place?
No, the capacity we've looked at is what Health New Zealand tells us it has available, and then community capacity.
Hamish Campbell.
Excellent, brilliant. Minister, what is the government doing to strengthen primary care services across New Zealand?
Well, that's it. Thank you for the question. There's a range of things that the government is doing to strengthen primary care services. As you are aware, part of the uplift in funding to Health New Zealand is for hospital specialist services. Part of it is for primary and community care services. And a big focus of our government is to improve access to primary care, make it easier for people to be able to see a doctor. The number one concern for patients is the ability to be able to get a timely access to a doctor's appointment. And so that's been a big focus. Last year's budget, of course, included the primary care tactical action plan, which had a range of initiatives in that which are currently being implemented. We've seen in the last 12 months full significant reduction in the number of practices which have closed books, which is good to see. We're seeing more patients get access to urgent and after hours care with clinics opening, for example, in Lower Hutt in South Auckland, now got a 24/7 urgent after hours care clinic. Our online GP service is providing another option for patients who can't get an appointment in a timely manner with their own GP. And of course, we're also strengthening the workforce with our focus on supporting NZREX doctors to be able to start their careers in primary care, the upskilling of our nurses to become nurse practitioners and nurse prescribers, and the Waikato Medical School is now under construction, which is, I think, a big step forward to provide a long-term pipeline of GPs, particularly in regional and rural New Zealand. So we're seeing progress, which is good to see. There's a lot more work to do. There's no single silver bullet to making it easier for people to be able to get access to a GP appointment. But there are many initiatives that we need to continue to do, and that's what we continue to focus on.
Excellent. You talk about improving access to a GP. How will recent investments help that situation?
So the number of investments, obviously last year's budget included a big uplift in funding for primary care. There's current negotiations now underway around this year's uplift in funding for primary care. And that's very much focused around how to continue to improve access to primary care and improve access to GPs in the community. As I said, the number one issue for patients is the ability to get a timely appointment. That's their number one concern. And our focus is making sure that we can increase the workforce, strengthen the workforce, and also increase access, such as the investment around urgent and after hours care clinics, which is said making a big difference in some of those communities where access to primary care has been a big challenge.
So you touched on briefly there the access to urgent after hours healthcare services. What action are you taking to improve access there?
Well, so the urgent after hours care framework is now being rolled out across the country. And so there's been a number of clinics, I think, which have been opened. In Dunedin, there's a new 24/7 urgent after hours care clinic, which is now open. South Auckland, there's a new urgent after hours care clinic, which is open. And in Hutt South, there's now a new daytime urgent after hours care clinic, which is now open for patients to be able to access. And negotiations are underway now for the next tranche of those clinics across the country to continue to make access to those clinics available. Same time, there's a range of other initiatives as part of that primary care tactical action plan, which are being rolled out to improve access to primary care for patients. And I think that's it's making a difference for New Zealanders. But as I said, there's no single solution to solving that problem. There is a large number of things that need to be done, and we're working on all of those.
Yes, thank you.
All right, I've got subs from Jenny, Huhana and Carlos. Jenny.
Thank you. Changes for funding for GPs, noting that there was an increase in funding the last budget and changes now. Can you talk through changes to the capitation model, which is what we hear often from our GPs? And so also what then does the GP funding look like into the coming year?
Yeah, that's a good question. So we're currently working, Health New Zealand is currently negotiating with primary care around the reweighting of capitation. Particularly as part of that is rurality being one of the criteria which is being included. The capitation formula hasn't been changed, I think, since the early 2000s, been based on age and sex. We're including a number of other factors as part of that to ensure that GPs are funded based on the needs of the patients in front of them. And that, I think, is going to make a big difference for clinics up and down the country. And so that negotiation is currently underway. But as I say, the sector's been calling for that for a very long time. And I think it really does, it will focus the funding based on the needs of the patients, which I think is a really important way forward.
Quick
Thank
little
you.
so when does that piece of work expected to?
Well,
be finished?
the new financial year starts on the 1st of July, and so the negotiations are currently underway with anticipation to have that in place for the new financial year.
Thank you.
Okay, supplementary, Hannah.
Yeah,
Come to
as we're on primary
Carlos and then
care,
Aisha.
wanting to examine with the minister around immunisation and particularly tamariki order. So previously there was about $30 million offered to primary care GP to increase immunisation rates for tamariki. Is that funding still available or has it completely ceased?
Yes, so that's the Immunising Our Tamariki program that is funded through the Hawera Māori appropriation and continues to do so. As I said in my opening remarks, we are seeing significant improvements in immunisation rates within our Māori and our Pacifica communities, which is positive to see.
But there's
still a gap.
There's a signal within the budget that there's going to be a decrease in terms of funding towards immunising our tamariki. So
No, there won't be a decrease in funding towards immunising our tamariki. It's a priority as part of our 5 health targets.
And so who are the providers, and give us an example of the rates that we're seeing in terms of increasing Māori access to immunisation services?
Well, as I said, we in my opening remarks, Māori and Pacific communities are seeing some of the biggest increases in our most recent in the immunising our for 2-year-old target, and so that is good to see. But I acknowledge that unfortunately we saw a significant reduction in immunisation rates under the previous government, and we are now having to work back to increase those rates from quite significantly low rates. And so that improvement will take time, but the improvement is underway.
Carlos, you've got a supplementary.
Thank you, Mr. Minister. There's always an argument between whether the funding should be given to the primary care or the hospital care. So by investing in primary care now, what benefit will the hospital care will benefit, including the emergency department or elective procedures?
Well, I think you're 100% right. Obviously, we need to invest in both in the budget, invest in both primary care and also into our hospitals to ensure that we deliver the services that New Zealanders need. But of course, if we can make investments in primary care, which can reduce pressure in our hospitals, that's a good thing. Just this morning, we announced, Minister Casey Costello and I announced the uplift in funding for aged care for the coming financial year. And that's a 4% increase in funding for aged care across the country. Part of that agreement is to support aged care to take patients who are discharged on the weekend, who are typically not being discharged on the weekends. And I think that's a big step forward. And that'll make a big difference, particularly for our busy hospitals, who, if they can't discharge someone who is clinically safe to discharge on the weekend, they're still there on Monday morning, and that clogs up the hospital and makes it more challenging, and that can have an impact on elective surgeries and acute lists as well if there aren't beds available. So it's really important that when the investments that we're making in both primary care and in hospitals are really focused around the targets. That's why we've brought the targets back, so that we can improve access, reduce wait times, reduce wait lists, and get progress towards our health targets, which is what we're doing as a government.
Okay, Dr. Verrill, you had a supplementary.
On the capitation funding offer, which you have had to revise because it threatened the sustainability of some rural practices, why can you guarantee now that practices won't be worse off and in a position where they have to cut services?
So that's part of a negotiation between Health New Zealand and primary care. And so the negotiation is active. My focus is making sure that there is improved access across the country, particularly in rural communities. I've made that expectation clear to Health New Zealand. They're working through the feedback they've received from primary care clinics to make sure they get it right. I think one of the things that's happening is there's both the capitation the capitation funding conversation. There's also another conversation happening around a smaller rural funding stream and discussion around the allocation of that. And both of those have been happening as part and parcel of the same conversation. And so Health New Zealand's working through that to make sure that obviously we improve access to primary care, both across our country and in rural communities. And that negotiation is ongoing.
Will you rule out, or will you guarantee that there won't be increases to general practice fees for patients as a result of these negotiations?
Well, one of the points in the negotiation is to make sure that patient fees stay stable over the coming financial year. And so that is part of the negotiation that's currently underway.
Doesn't stable fees just lock in the problem of inaccessible general practice in a country where there's a cost of living crisis and 650,000 people can't afford to go to the doctor?
Well, look, I mean, if you're trying to suggest that people earning around $300,000 like myself and Chris Hipkins should get free GP visits, I think that is an untargeted policy.
Yeah, we're not making policy for the 1%.
And that is an untargeted policy, even if you do, that is an untargeted policy, and that was simply by having untargeted policies clog up the access to GPs. The number one issue for patients right now is accessing a doctor, being able to get an appointment. And so what we're focused on doing is targeting resource to where it makes the most difference to get the best difference for patients. And of course, in New Zealand, we have a number of schemes which provide support to those on lower incomes, those in very low cost access areas, and also to those for children under the age of 14. So we have, we focus on targeted support, not clogging up the system, which is the alternative being proposed.
Supplementary.
We'll go to Aisha for one more, and then I'll come to Hamish.
Is it your position then, because of your concern about a handful of high income earners, you're prepared to let 650,000 New Zealanders be unable to access care, as is currently the case?
What our focus is on doing is making it easier to see a doctor in New Zealand, not clogging up the system, which is what you are proposing. So our focus is on making it easier to see a doctor and targeting resource to those who need it the most. And that is, I think, and if you look at what we've achieved, we're seeing more practices with their books open. We're seeing more opportunities for people to be able to see a doctor. We're targeting support to those who need it the most. And we're currently in negotiations around keeping fees stable in this coming financial year.
Dr. Campbell, so
Just following on for that line of questioning, isn't one of the problems that actually we haven't been training enough doctors over the last decade to get GPs out into rural areas? What do you see? What are you doing to increase the number of GPs available to kind of actually have more capacity?
Yeah, well, if there's no single silver bullet to solving this challenge, which some people think there is no single simple solution. If there was, it would have been found by now. There is a requirement to do many things in order to make a difference for patients, and that's what we're doing. So yes, training more doctors is part and parcel of what we need to do. Reweighting capitation to ensure that rural practices are recognised for their higher cost structures is something that we need to do. Making sure we have a third medical school, which I note the opposition opposed, is something that we need to invest in. That's what we're delivering as a government. And so it's not one single simple solution. It is many things that need to be done to improve access for patients. And that is what I, as the minister, am focused on doing, improving access for patients up and down our country.
all right, we've got three primaries, Huhana, then Carlos, and then Aisha.
Kia ora.
Huhana, no different primary.
Thank you, Minister.
Then Carlos.
How does the government give effect to Te Tiriti o Waitangi in the current health system, considering the disestablishment of Te Ako Whaiora and the relegation of iwi Māori partnership boards in the system?
Well, we are focused on making sure that all New Zealanders have access to timely, quality access to healthcare. That's why we've reinstated the health targets, because we want to make sure that the system is focused on patients, focused on improving access for all New Zealanders, regardless of their ethnicity.
And so
that's what we as a government have done. We've implemented the health targets. We're now focusing resource to where it makes the biggest difference. And an example of that is our immunising our tamariki program, which is something which is put in place by this government, which is working with Hauora Māori providers who work with their communities to improve immunisation rates, which we're now seeing good progress.
And so does the Minister believe that Māori have equal health outcomes to non-Māori?
If you look at just immunising our immunisation rates for our 2-year-olds, it's very clear from the evidence that Māori populations have a lower immunisation rate than non-Māori populations, which means we have work to do. And that's why we are improving, and we're investing in Hauora Māori partners who work with Māori communities, who know their communities, and who we're seeing some good results from. So there's a number of things that we're doing to make sure that we improve access and improve outcomes across the board for all New Zealanders.
So Hauora Māori appropriation is about some 2% of overall vote health. How do you think that that budget really compares to the health inequities that Māori experience in the health system?
Well, the health system treats people regardless of whether they are Māori or non-Māori, and the health budget is there for all New Zealanders. So 100% of the health budget is there for all New Zealanders, and it's there to ensure that we get better outcomes for all New Zealanders.
And so, Minister, we've seen a cut in this budget to Hauora Māori overall, some $11 million. Where will we see those cuts, and how is the Hauora Māori appropriation being spent to improve health outcomes for Tiwi Māori?
I'll ask Audrey to speak to the changes in that appropriation.
So last year's appropriation had a one-off in principle expense transfer from the year before of 47.2 million. We expect that there will be underspend in last year, and when the finalised numbers, we would expect to transfer some of that into next year, and so we'd not expect that in the final supplementaries you'll see a decrease overall.
So the Hauora Māori appropriation is quite broad, and it's very hard to understand what is being funded and for what outcomes. Can we get a description as to what is going to be funded in the Hauora Māori appropriation and what services are being cut?
Well, we're investing in improved access for patients. I'm happy to come back to the committee with particular details of specifics around it, but I mean, immunising tamariki is a key initiative within that. A large part of it is towards primary care providers and providers of services in the community. So it is all about investing in better services in our community, but overall, our health budget there is to improve outcomes for all New Zealanders.
Primary.
Thank you, Minister. One thing you've been emphasising in Budget 2026 is the additional $5.5 billion allocated to the frontline health service. What is the intent purpose for this additional funding?
So there's a number of key purposes of that funding. So part of that is to provide uplift in funding to hospital and specialist services, and that includes support for all of the services that our hospitals provide. We've put our 5 health targets in place, which very much are around focusing and supporting improved access, reduced wait times, reduced wait lists. As I said, this year we're expecting a record number of elective surgeries to have been delivered. We're on target for what we said we'd deliver, which was a record number. And that's about reducing wait times for elective surgeries after they increased significantly under the previous government. The other big major allocation is primary community care. So we talked earlier about the investment into GP clinics, but also aged care, pharmacy, other key services that people rely on in the community. So aged care, we've announced earlier today the negotiation of the uplift, 4% uplift in funding for aged care provision. And as I said, that's going to make a difference for particularly patients being able to be discharged on weekends through aged care providers. And that's a big step forward to support earlier discharge and to ensure those hospital beds are able to be there for the next patient who needs them. So, and there's a range of other initiatives that are being funded as well as initiatives on top of the cost pressure funding, which includes the initiatives around bowel screening, includes initiatives around the postnatal stays. It includes the initiative on paediatric palliative care, which I think is a big step forward to make sure that we have a service available for parents and their families where children unfortunately pass away or have life-limiting conditions. Having that nationwide service, I think, is going to be a big step forward for our country and something that's been called for a very long time.
So my question also is, I think a lot of healthcare workers also mentioned that, will this additional funding be sufficient to address the underinvestment in frontline health service over the past 10 years?
So this is about improving access and improving funding. And so it is a significant uplift. And it's about strengthening the workforce as part of that as well. We've put in place our health targets, and that's about saying, as a system, we want Health New Zealand focused on patients and on those health targets. We've set annual milestones for those targets. We're seeing year-on-year improvement against those targets, which is good to see. But I acknowledge it's a long way to go, a lot more work to do. And that's my expectation very clearly of Health New Zealand, that they should keep delivering against those expectations.
Thank you.
Okay. Primary, Dr. Vera.
Thank you, Mr. Chair. You published a health infrastructure plan in last April. Official advice priced that at $20 billion over 10 years. The health capital envelope has been increased by 600 million, nowhere near the amount estimated by the Infrastructure Commission, or even just by looking at the track to get to 20 billion needed to fund that plan. How are you going to make up the difference?
Yeah, so there's a number of key investments in capital infrastructure in this year's budget. The Whangarei Water Tower, which is brings the funding package for that project together, and that's critical to ensure that the Whangarei redevelopment.
Excuse me, Minister, my question was about the difference
done.
between what you're funded and what's set out in the plan.
Yeah, and I know in 2023, when you were the minister, $0 was allocated towards capital expenditure when you were the Minister of Health. So we added over $1 billion last year, over 600 million this year. Health New Zealand also has its own capital budget, which it allocates within its own budget capital plans. And the focus is very much on getting business cases delivered and getting planning work done so that we can continue to make those investments. So 3 of the next major hospital rebuilds are now being funded for the planning work that needs to be done. I expect those business cases will come for budget in the next term of Parliament for quite large sums of investment that will be required for those builds. The planning work is now underway for both for Tauranga, Palmerston North, Hawke's Bay, and that's critically important that we get the work done so that we can then allocate what will be really sizable chunks of money to make those big investments in those 3 hospitals. And so we need to get the work done properly. And if you look at the infrastructure report that was released yesterday by the Minister for Infrastructure, many of those recommendations were around making sure that we get the phasing done in the appropriate manner so that we make the right decisions and then we can then make those sizable investments that are needed. But we've got a $7.5 billion of capital in the health capital investment, funded capital currently in the health capital investment plan right now. So there's $7.5 billion of capital currently there for Health New Zealand, and there's a lot being delivered across the country.
Supplementary, Minister, why won't you release information on which projects in the health infrastructure plan are not able to continue under the trajectory that you're currently on?
Well, all of those projects are at various stages. And so, for instance, in this year's budget, we're funding the planning work on 3 major hospital rebuilds that are going to cost billions of dollars in terms of cumulative amounts of money. In terms of doing that work, it's going to cost a lot of money to deliver those rebuilds. The work now is around planning and early works, which is really important to get those early works done so that when we do allocate, when those business cases come up, asking for the full cost of the rebuilds, we are able to then get moving as quickly as possible on delivering the infrastructure that's needed. And so there's a number of steps that need to be done to get it right. We're doing that, and that's all part of delivering the health infrastructure plan.
Yeah. Minister, your officials advised you that the health infrastructure plan significantly exceeds previous appropriations, quote, may prove unaffordable, quote, no, not clearly factored into the forecasts.
Was that from Treasury?
It's health officials. So can you please explain?
Oh, look, some people are unambitious.
Minister,
I was doing stuff first.
Minister,
Coming over to.
Thank you.
you referenced yesterday's infrastructure plan, which I think members of Parliament agree is a excellent effort to achieve bipartisanship on these long-term issues. Why can't you be open with colleagues in Parliament around the feasibility of the health infrastructure plan and whether we can ever fund the items in it?
We are delivering. So the next steps of those three major hospital rebuilds.
The question was
has
about
been
sharing
funded.
information,
Minister's
not
answer.
what you're doing.
Those
Well, if there's
doctors.
specific questions that you wish to ask, I'm happy for you to put that in writing.
Well,
Ask
I
me.
have, and I've appealed it to the
And-
Ombudsman because you're not giving out information on this infrastructure plan.
And the answer to your question around those three hospital rebuilds is the next stages have been funded.
I asked
Get
about the
those done.
infrastructure plan, not about 3 hospitals.
Carlos.
Mr. Chair, yesterday I was in the infrastructure committee. So we talk about how we manage our assets. We currently, the way we do it is fourth to the last in, I think of OECD on the region. With the new release assets management work plan, how this will change the way we manage or maintain and renew our assets in the health sector?
So I think, as I said, we need to move to a more staged approach to how we do these investments. And that is one of the ways which I think the infrastructure plan has highlighted the need to do so, and to work to deliver, good planning, good business cases, early works packages, which get projects into a place where we understand the cost, we know what's needed to be delivered, we can then get on and get things delivered as quickly as possible. And so I think that's a really important change which Health New Zealand is progressing, but also more standardised designs is, I think, another thing which we've been clear as a government we want to see across government is more standardised designs to ensure that we can get more efficient builds, faster builds, but also more cost effective to maintain and more efficient to build as well, more timely to build. So there's a number of things across government that we are working on to make sure that when it comes to infrastructure, we have a much more sensible approach to doing it, rather than it being different ways of doing things across different agencies or across different parts of the country, and that I think standardization is something which many parts of the industry have also been calling for, because it means they can then get better pipeline of work, understand what's coming, and are able to deliver things a lot faster and build what they need around skills and equipment and things to be able to get infrastructure done in a much faster way.
So do you think that if we actually change the way we manage the assets in the past 10 years, which government probably costs more than it needs, will that actually, we can relocate those funding to actually invest in more capital and more assets for our healthcare system?
Yeah, if we can make sure that we build things in a more, obviously if we can build things in a more standardized way, we're able to make it more cost effective to operate and more cost effective to maintain those assets. And that obviously improves the quality of infrastructure. We've got a very old health infrastructure across the health system in New Zealand. And so this is not a challenge that's going to be resolved overnight, but does require a set of principles to be applied and be applied consistently in order to make sure we get better asset management, better improvement, and also make sure the new infrastructure that is built to a more standardized design around how it can be delivered.
Thank you, Minister.
Jenny has this up.
Thank you, Minister. So obviously there's a lot of health infrastructure that needs fixing up, and new builds that you've put into the budget. Why are you looking so far ahead in terms of land purchase in South Auckland? What's the impetus behind doing that when, that's a wee way into the future when the needs are right now?
Yes, that's a good question. So as you will note in the budget, funding has been set aside to purchase land for a new hospital in South Auckland. The Drury area in South Auckland is expected to house up to the same population as Hamilton over the next next 20 years. There's a huge amount of infrastructure being built in that area, motorway widening, new railway stations going in. I think there's a major a lot of new commercial property going in, a new mall, etc. So there's a huge amount of investment going into that area. We know there's going to be a population of similar size to Hamilton, and that population, South Auckland, North Waikato, has been identified as a priority area for a new hospital that's going to be needed to be built. The cheapest time to buy that land is now, and particularly if we want to have it land close to major infrastructure. So, for example, train stations and motorways. If we want to have land which is accessible, we need to be there now, getting and buying land. So that's what's been funded in the budget. And I believe that's a very good investment to make sure that we are building for the future, preparing for the future that's going to be needed. Obviously, there'll be a lot more work that we required following the purchase of that land. But that land in that part of Auckland is being purchased up very quickly and being proposed developments very quickly. If we want to be in a strategic location, we need to get in there quickly and find that location and buy it.
All right. I'm going to move on because I just need to balance
Yep, sure.
who gets what. So I'll go to Huhana. Oh, yeah, Huhana for your primary.
Thank you. Minister, news is out that you've decided not to reappoint Dr. Rachel Love and Simon Watt as the leadership of the New Zealand Medical Council. There's been an allergic reaction from health leadership across the sector, where you had said publicly that they are pushing an ideological agenda. Health and wellbeing, these regulatory bodies set standards that are evidence-based, and you're alleging that somehow cultural safety and prioritising hauora Māori is some ideological agenda. How can that be when this body has been there and doing the work based on the profession and the standards of care for all New Zealanders?
Yeah, I mean, I think that question's, a bit further outside of the estimates, but I'm happy to answer the question if the chair allows. Effectively,
It impacts patient care.
yeah, sure. Look, I'm happy to answer the question. The answer to your question is that, firstly, this is a ministerial appointments. Ministers make ministerial appointments. That's what ministers do, and those decisions are for ministers to make recommendations to cabinet, and cabinet then makes decisions. That's what's happened in this case. In terms of the issues, we've been clear as a government. We expect healthcare to be based on patients' need, and there's been, and in my view, and in the government's view, there has been for the Medical Council, their recent consultation that they put out, there was a significant reaction to it from many parts of the community, including many in the medical workforce. And the focus that we have as a government is for the Medical Council to be focused on improving access, strengthening the workforce, not dismantling systems, which is what was being outlined in that discussion document or in that proposal.
The standards
when it comes to
being set
core, when it comes
by a
to
professional body, evidence-based.
Hold on,
and
hold on,
ministers
Huhana.
ultimately,
Let
and
the
ministers
minister answer,
ultimately,
please.
ministers under the law ultimately make appointments, and that is for ministers to make.
Yeah, and the standards being set have been considered
point of order,
and are
Ms. Sweden.
evidence-based.
Chair.
And ultimately,
Point of
why
order.
is the
Point of order.
minister?
Point of
Point of
order,
order.
Hamish Campbell.
Can I just raise Speaking's Rulings 144-1
Yes.
when it kind of comes to the relevance and scope of estimates questions. Questions about policy or recent events that are no way discernible linked to the government's proposed spending plan should be ruled as irrelevant.
So it's the centre of the government's agenda.
No, but the point,
It's
no,
central to
Do you want to
delivery
speak to the
of
point
health
of order?
services.
yeah, I'll speak to the point of order.
Dr. Webb.
Chair, that was raised earlier.
Yes.
The minister said, would the chair give me leave? Can I answer the question? The chair said yes. So the question was ruled in order by the chair.
And you're both right. Yes, it's outside of the scope, and the minister did mention that, but he then also did say that he was happy to answer the question. And so he is answering the question. So you can have one more on it and then we'll move on, because I know other members have.
No, yeah.
Oh,
I would like a
Dr. Vera
supplementary
has
on that question.
supplementary as well.
After you.
Yeah, no, Katie Pai, you take the ones up.
Minister, you have been reported that you didn't just make a decision. You made a decision based on the Medical Council's work on cultural safety. Why are you better able to make a decision on how patients and their culture should be respected than the members of the Medical Council?
Our ministers make decisions every day on ministerial
Yeah, well, take some
appointments.
responsibility for one.
I've taken responsibility for this decision. I made this decision. Recommendation was put. We made a decision as a cabinet, and we've been very clear about the reasons why.
Oh,
Right,
no,
we're
sorry.
going to move on. Dr. Campbell had a primary.
Excellent, thank you. Cancer is a very important issue facing New Zealand. What is the government doing to improve access to cancer medications?
Well, there's a range of initiatives underway to improve access to cancer medicines. The last year's budget, there was a significant uplift in funding for Pharmac, which has provided 33 additional new cancer medicines. Pharmac continues as well to go through its process of assessing new medicines and to make sure that its budget is going towards the highest priorities. And we've seen a number of additional medicines also be funded. I think 7 new medicines, cancer medicines, also been funded through that process for breast cancer, lung cancer, large cell lymphoma, chronic lymphotic leukemia, melanoma. So a range of medicines have also been funded for a range of cancers by Pharmac doing the work that it does. We're also seeing a rollout of additional infusion capability across the country, which is not only increasing the capacity of infusion capability in many of our current infusion services, but also expanding access by opening new infusion services. Waitakere Hospital, for instance, population of West Auckland up until now had to travel into Auckland City Hospital in order to be able to access infusion services. That's now changed due to that investment. And I think that's really exciting. So the population of West Auckland now both have access to infusions at Waitakere Hospital, but also at Whānau House in West Auckland. There is a community-based infusion centre that has also been opened in the last couple of months. And so there are further services to be opened, an increase in capacity at Nelson Hospital, community infusion in South Auckland, investment into infusion capability at North Shore Hospital in Christchurch, Dargaville, Kaitaia, Green Lane, further investment into Manukau, Hawera, Ralston. And so right across the country, we're seeing further access to medicines, but also these infusion capacity as well, which I think is making a real difference for patients up and down our country.
Excellent. What progress has been made in expanding eligibility for cancer screening programs?
So there's been 2 key changes that we've made. And the first one has been around breast cancer screening, which that rollout is currently underway, and that's making a big difference. We've also funded in this year's budget the next step to match the bowel screening age with Australia. And so that is to reduce, and that rollout is to reduce the age down to 56 as the next step. Alongside that, Health New Zealand is implementing the Fit for Symptomatic test in all districts this year. That is a really important part of freeing up access to colonoscopy. So that is being rolled out across the country this year into all districts. That's effectively it's a similar type of test. It's a poo test. But it has a different sensitivity, and that is for GPs to be able to refer patients who would otherwise be referred for a colonoscopy to be able to be referred for a Fit for Symptomatic test, which enables more patients to be able to get access to that test as well. And so that's being rolled out, and that will be available to all patients of any age. So if someone has bowel cancer symptoms, their doctor will be able to refer them for a Fit for Symptomatic test, and that's being rolled out across the country this year. And I think that's a really big step forward alongside the age reduction as we work to match Australia.
Supplementary, Dr. Verrill.
Thank you, Mr. Chair. I received a letter about the breast cancer screening age extension that you mentioned from Wendy Anderson of Christchurch on Monday. She said, I had my last breast screen examination in January 22, age 69. 2 years later, I rang thinking I'd be entitled to another, but was told it was only being carried out in Nelson Marlborough region as a pilot study. Today I rang as I'm now 73 and want to be seen prior to the 74-year old age cutoff point, as she puts it, only to be told that women in this group will not be seen until after their 74th birthday and have to do it before their 75th. For me, that will be 5.3 years without screening. She asks, how can you say you're offering screening to this group when the fact is women like me are being left out?
So under the changes that this government has implemented, she'll be eligible for a further scan, other than a further screen at the age of 74, as outlined in that letter. And that is part of the rollout of the age extension, which is currently underway to ensure that we increase the age to 74. And one of the key changes as part of the rollout is, of course, the age is increasing every year. But importantly, the 74-year-old additional scan was also included so that anyone within that age bracket would get one final scan at the age of 74. And so that rollout is now currently underway. And without the investment this government has made, there would not have been scanning available for those women. And so that is now currently underway and is making a real difference up and down our country.
You referenced the fit for symptomatic colon test and its ability to free up colonoscopy space. How much colonoscopy space would the national rollout of that test free up?
Well, I think the estimates is over 30% in terms of surveillance colonoscopies. I can ask for further detail from Dale on that particular question. But as I said, that's being rolled out currently to all districts, I think, by September this year. So that rollout is currently underway so that by the end of this year, all districts will have access to the fit for symptomatic. It's a big change in the system. And as I said, it will free up access to colonoscopies, which will then enable further age reductions in the bowel screening age.
Right.
Did you want to add
Or
more?
have one more
percentage?
sub after?
Yes, that's right, Minister. We are expecting it will free up thousands of colonoscopies. We're also releasing national clinical guidance to all clinicians in districts so that they can understand the evidence base behind the test, but also how to apply the test. Because what we're trying to, because it's a more sensitive cutoff marker, we just want to make sure that people can understand that and also not unnecessarily then send on to colonoscopy. So that is going to take a bit of time to make sure that all of our clinicians fully understand the guidelines that will be issued.
Is there any concern about cancers being missed in this cohort of symptomatic people by using the FIT test rather than colonoscopy? And how frequent would that situation arise?
So that's exactly why we've looked to standardise clinical guidance with evidence base around it. So each test has a sensitivity and specificity related to it, which is where you've gone. And that's exactly right. So that's why we've set the threshold where we think is appropriate to make sure that sensitivity and specificity is right for that test.
So will this change create the situation where any more cancers are missed than is currently the case?
Can I just ask Dr. Sullivan? He knows the exact answer to that.
Helps to be an epidemiologist.
I think we're expecting to see the opposite. In fact, we have a lot of patients waiting on our colonoscopy list at the moment for scopes, and the international evidence is pretty clear about the benefit of fit for symptomatic testing. And so it's pretty clear that when you set that threshold, you pick up a certain number of cancers. We're looking at all our wait lists as well, so making sure those patients who are waiting also get access to the test. So we're actually expecting the opposite, that we'll see more diagnosis of cancer over this bulge as we clear out those wait lists, and then obviously get to a steady state after that.
Will the relevant agencies publish this evidence?
The clinical guidelines.
The clinical guidelines will be published. So the clinical guidelines are currently out for consultation with the colleges at the moment. We're expecting those to be endorsed in the next week or so. And the intention is to release all those early July, along with the rollout of fit symptomatic.
Thank you.
All right, we have under 2 minutes to go. We have primary requests from Dr. Verrill and from Huhana.
You go, Dr. Vera.
Oh,
That's a quick one.
Minister, I have made a chart of your targets and shaded red when they have been met, when they have not been met, and green when they have been met. Would Erica Stanford give this an F?
We're seeing year-on-year improvements against our targets, and I note that every single target went backwards under your watch when you were the minister.
Oh,
And that
no,
was certainly
no,
a fail for
actually,
New Zealanders.
for specialist
the minister-
appointments,
You
the worse
saw-
under you.
You saw a reduction in delivery of services. You saw wait lists balloon. You saw wait times increase in our emergency departments. You saw fewer children being immunised at 2 years of age. That is on you.
Doesn't look like
We are
things are getting
turning
better
around.
quickly.
We are turning around the system. We've reinstated
No,
targets.
you're
We're
not.
seeing
You're
wait
failing.
times reduce, more children being fully immunised. We are seeing progress where you saw failure.
Oh, we saved 20,000 lives during COVID.
All right. On that happy note, we are adjourned. Thank you, Minister.
Thank you.
Thank you, Dr. Hanley. Thank you, members.
Called rugby. We call lots of things. Morning, Minister.
Good morning.
Morning, Ian. Great to have you all with us this morning. We'll hand over to you for some opening comments and then we'll get into it.
Well, good morning, Mr. Chair, and good morning, committee members. Great to be with you this morning. With me at the table today is Ian Rennie, the Secretary of the Treasury, and I believe Chris Bunny, the Deputy Secretary, is just behind me, as well as relevant officials from the Treasury who are here to help with your questions if need be. As the Chair has permitted, I'll make some brief introductory remarks. On budget day, people focus on new spending, which is perfectly understandable. It is important to remember, however, that this is only a portion of total government spending, just as an iceberg has a visible portion above water and a large bulk underneath it. Next year, core Crown expenses in total, that full iceberg will total around 155 billion, over 70% of which will go to health, education, welfare and superannuation. Another 6% will go to servicing the government's debt. And that all adds up to a big number. Core Crown revenue, mostly from taxpayers, will be around 145 billion. So there is a $10 billion difference between those two numbers. That is the deficit, and we will have to borrow to meet it. In comparison, the amounts we focus on in the budget, like net new discretionary spending of $2.1 billion, are relatively small. But that is the point. The government's approach is to keep new budget spending tight, forcing a hard look at the underlying 150 odd billion of spending, 150 odd billion, to see where this money could be better spent. And better spent for this government almost always means spending it on our priority areas of health, education, law and order, defence and infrastructure. Keeping a tight rein on discretionary new spending and reprioritising across government means we are continuing to invest in frontline public services, providing temporary, timely and targeted funding to respond to the fuel crisis, and maintaining a pipeline of infrastructure investments. And at the same time, we are repairing the government's books. That repair is necessary because there has been a long period of operating deficits and growing debt. And that situation will not resolve itself automatically as the economy recovers. Specifically, the government is aiming through its fiscal strategy to reduce core Crown expenses towards 30% of GDP, to return the headline operating balance measure, Overgal X, to surplus by the 28-29 fiscal year, and to put net core Crown debt as a percentage of GDP on a downward trajectory towards 40%. Members are aware that Treasury's recommended net debt ceiling is 50% of GDP, and that seems to have bipartisan support, or at least it used to. We are aiming for 40% because the ceiling should never be the target. History shows that one economic shock on its own can push up debt by 20% of GDP. That is precisely the point of having moderate amounts of debt, so it can increase significantly in a crisis or a shock, but not cripple the country with unmeetable debt servicing costs. But once that buffer is used, it does have to be restored again. So how are we tracking against our fiscal goals? The Treasury's budget forecasts show core Crown expenses falling to 30.3% of GDP by the end of the forecast period, well on the way to the 30% target. Overgal X is forecast to return to surplus in the 28-29 target year, and that is a year earlier than previously expected in the half-year update. And net core Crown debt is forecast to peak at 46.1% of GDP in the 27-28 fiscal year, again lower than at the half-year update, then decline to 44.4% of GDP by the end of the forecast period. In other words, the debt curve finally stops going up and starts going down. We are making progress on the debt mountain. This improvement in the books is reflected in the government's borrowing program. New Zealand Debt Management has lowered its forecast issuance of government bonds by $6 billion over the next 4 years. This is, members, the first downward revision to the bond program since 2021. There have been a lot of headwinds to the government's fiscal strategy over the last 2.5 years, from external economic events over which we have no control. Despite this, the fiscal strategy remains on track. And that's because the government has taken care with public money and made what are tough choices. Since this is election year, the next round of forecasts will be in the PREFU, the pre-election economic and fiscal update. I can announce today that the PREFU will be on Tuesday, the 29th of September. That is in the week after the House rises and is 5.5 weeks before the election. I'm happy to take your questions.
Thank you, Minister. We've got Barbara Edens first.
Good morning, Minister. I do acknowledge this is your third budget, and to Ian, Rennie and the team, totally acknowledge that difficult budget to put together given the uncertainties. Minister, just having a look at between budget 24 and 26, how many more people are on the job seeker benefit or emergency benefit between those two forecast periods?
So the place to look is if you go to the budget economic fiscal update, I think has the table. Certainly I have the table available here. Yeah, thank you, Mr. Rennie. So if we look at the numbers, they are on page 116 of the BFU. And if we look at the actual numbers for the reference year that you gave was 2024, then numbers on job seeker support and emergency benefit were 194,000. As we are here today, the actuals in 2025 were 217 and the forecast for 26 is 227,000.
So 98,000 extra. So what's the fiscal cost of 98,000 people on the job seekers benefit across the period to 2028?
Well, again, if you look at the table above that, the welfare benefit expenses in the BFU, that sets that out. And I think it is clear to everyone that reducing unemployment has not only a fiscal cost, but a significant social cost. And it is the objective of this government that we have as many New Zealanders in work as possible, which is why we are very pleased that in these forecasts, we are forecasting 220,000 jobs being added to the economy over the forecast period. We're forecasting that while unemployment will peak, partly worsened by the fuel crisis, will peak this year, it is forecast to continue to reduce throughout the forecast period. And that is positive for every New Zealander who will have a job, their families who will be supported through that job and independent income, and it is positive for the government books.
So perhaps maybe then for Treasury, what is the fiscal cost?
Well, it's very clearly set out,
Does that
Ms.
include-
Edmonds. You can see that in the table welfare benefit expenses, which has the costs of the various benefits, including New Zealand superannuation, job seeker and emergency benefit. And those costs are set out in the table above. So the numbers are available for you.
Does that include the accommodation, supplements, allowance, winter energy payments, additional working for families?
Yes, that table sets out very specifically the amount expected to go into accommodation assistance, the amount expected to go into working for families tax credits and other tax credits, noting this government has made some changes to some of those entitlements. Specifically, we have increased the maximum accommodation allowance that can be paid to families receiving it. Also, of course, we made a significant decision in our first budget to unwind the indexing of benefits to wages, which had been a decision by the previous government. We chose instead to index them to inflation, which has reduced the cost of those benefits.
So as part of your budget, I think it was last year for Investment Boost, you said that it was going to.
Sorry, is this a new primary?
It's part of the jobs cushion. You said that it was going to increase, I think, 240,000 jobs, and this year it's 220,000. Is that correct?
Over in the VFU last year, we predicted that over that forecast period, which is of course a different forecast period from that in this year's VFU necessarily, we forecast that over that forecast period, 240,000 jobs would be created. And this VFU, as we look ahead over a different forecast period, we're looking at 220,000 jobs being created in the New Zealand economy. And I think that that is positive. It shows that there will be new opportunities for New Zealanders, both those currently in work, looking to get a new job opportunity, and those who are currently out of the workforce. And you do see that the unemployment number correlates, that it reduces over that forecast period.
So what is the increase in the working age population over that same period?
I don't have those numbers right here, but what we do have is a breakdown of those numbers. I'm sure that we can make available to you. You would expect that there would be an increase in the working age population over that period.
And sorry, Mr. Still going, that's right. How many of those jobs are because of the decisions made in budget 2026? So directly related to budget decisions as opposed to private market.
Well, these things are very,
population
as the member
growth.
appreciates, these things are very difficult to disaggregate because the effect of overall employment levels is a combination of what's happening with the underlying population, what's happening with underlying economic growth, and at the margin, there is also the effect of welfare policies. It is the case that where governments don't provide adequate incentives for people to move from welfare into work, then you could expect structurally higher levels of unemployment. It is also the case that policies such as Investment Boost, which in the Treasury and IRD's estimation will increase overall potential growth, that with higher overall growth comes more job creation. It's also the case that the investment in infrastructure projects, in the view of the Infrastructure Commission, for every $1 billion of public investment per year in infrastructure, around 4,500 jobs are created. And it is the case fundamentally that where an economy is growing and businesses have the confidence to invest either in hiring new staff, expanding into a new market internationally, expanding their business here at home, that with that growth comes new job opportunities, which is why as a government, we have focused on a going for growth agenda, because we know that the best thing that we can do to support more job creation is to overall grow the economy faster.
So then why have employment forecasts been revised down since the last budget? by 82,000 fewer people forecast to be employed in 25-26.
There've been a few events in the Middle East which I draw the members' attention to. In
82,000.
particular, we have seen a global oil shock that, in the view of the International Energy Agency, is the most extreme the world has ever experienced. That has led to significant effects for the New Zealand economy. First of all, a downgrading in global growth, including from our trading partners. It has also led to a supply shock in prices, which for New Zealanders they're already experiencing at the pump, and is viewed to increase inflationary pressure, therefore meaning a more contractionary monetary policy stance than may otherwise be the case. New Zealand is not immune to international events, and there have been significant international events since the last budget update.
So the budget also forecast shows that real wage being negative. Why is that?
Well, because of the international fuel crisis, which is expected in the immediate future to lift inflationary pressure significantly. What those forecasts also show is that over the forecast period, real wage growth is expected to accelerate and overall be positive.
So it's 77,000 year 27, 72,000 year 28. Treasury says in their BEFU that it's short-term the impacts from that conflict. How can you reconcile that from your last statement?
Sorry, how can I reconcile what?
From your last statement. So you just said in your last statement, because of the conflict, in
Yes.
27, it's less than 77,000. 28, it's less than 72,000. It's fewer by 72,000. How does that
Are you
reconcile?
talking about job numbers?
Yes.
Because there are always in an economy lag effects between an economic shock and the impact on different indicators. It is an orthodox economic view that when you have a price shock and therefore a growth shock, that the last indicator to recover typically is unemployment. And so Treasury have applied a very orthodox forecasting model in which they expect that as inflation is brought under control and growth recovers, you will then see employment levels recover and unemployment levels recover.
Thank you. We've got a new primary from Dan Bidwell.
Thanks, Mr. Chair. Thanks, Minister, and to your team at the Treasury for coming before us today. I want to turn the attention to New Zealand's debt position. As we know from Table 1, debt's currently 191 billion. As a proportion of the economy, it peaks in 27-28. How worried are you about New Zealand's debt position, and how worried do you think New Zealanders should be about our debt position?
Well, our debt position is materially different from what it has been historically. It tripled in nominal terms following COVID, doubled as a proportion of the economy. And for reference, if you look back, Bill English, Michael Cullen, you can pick a blue or a red finance minister. The orthodox position was to keep debt under 20% of GDP, and it is now far above that. The thing that's very material, I think, for members to understand is the debt servicing cost that comes with that on an annual basis and the opportunity cost that that represents. So I'd draw members' attention to page 115 of the BEFU, which outlines core Crown expenses and shows that this year, debt servicing costs are forecast to be $9 billion. Now, obviously, that far overshadows any discretionary additional spending decisions the government has made in this budget. It's more than 4 times our overall operating allowance. To put that number into context, it is enough to fund in the year's operations of the Defence Force, the Police Force, the Customs Service, the Corrections Service, the Justice System. So it is a significant amount of money, and every dollar spent on servicing debt is a dollar not available be invested in our health system, our education system, and public infrastructure. And so it has been the view of successive governments, and certainly the view of this government, that ensuring that we get debt down to manageable levels is important, not just for our resilience in the world, but also for ensuring that we have manageable debt servicing costs.
Good. Next question is what feedback you're getting from ratings agencies, bond holders, bond issuers, or bond purchasers around the current government's approach on fiscal strategy?
Well, both Moody's ratings and Fitch ratings have looked at New Zealand's debt and deficit positions and have said that it is essential that we keep to the fiscal strategy and track a credible path back to surplus and debt reduction. They've put us on a negative outlook, which is to say they've retained our current credit rating, which is a good one because it has material effects for the cost of borrowing internationally. But they've said that it is incredibly important that we show progress on our fiscal strategy of reducing deficits and debt. If we don't do that, what is likely to occur is that those credit rating agencies would downgrade our credit rating. And of course, many New Zealanders will have experienced what a downgraded credit rating means. What it essentially means is it's harder to borrow and more expensive to borrow. And so for New Zealand, that would be very material. It would mean more of the taxpayer dollars that we collect would have to go into servicing debt rather than investing in the future that we're all trying to create. So maintaining a prudent position in the eyes of the credit rating agencies is important actually for how much it costs to borrow, for the interest rates we pay not only as the government, but also that New Zealand businesses and private borrowers pay. So we do take their estimations of our books very seriously.
And final question is, you've had to make some tough decisions in this budget, but also the previous budgets. Can you give us a sense of if you hadn't have taken those decisions, what would be the potential impact on debt, interest, and potential outlook from rating agencies?
Yeah, look, colleagues will be aware that the approach we have taken across 3 budgets is to supplement our operating allowances with a significant program of reprioritisation and saving. And that has been necessary to keep up with the growing costs that are very real in our health system, our education system, the very real needs to invest in infrastructure for the future. We continue to have an infrastructure deficit in New Zealand, and this government is determined to repair it. And so in order to support those objectives, we have made over 3 budgets $50 billion worth of reprioritisations. And it is simply the case that in the absence of that, you would be adding $50 billion worth of spending to all of the numbers in these books. It would mean that the deficits would be far deeper. It would mean that the debt would be far larger and the debt servicing costs would be much higher. I would wager also that we would be in a position as an economy where inflation would be higher and where interest rates would be higher too. And, you know, I would note that decisions in the past by previous governments not to rein in its spending materially contributed to very high inflation rates, which stayed out of target for 33 months in a row, contributed to one of the steepest increases in the interest rate path that New Zealanders have experienced, and very much led materially to the cost of living challenges that we are still working to unwind today.
Thank you.
Thank you.
revenue impact of the failed ETS auctions would be.
Mm.
And you said, and I quote, "The sale of units through ETS auctions does not have an impact on revenue. The Crown receives cash proceeds from the sale of ETS units when auctions are forecast to clear and subsequently fail to. This results in lower than forecast cash proceeds with a corresponding impact on net for Crown debt." Can I confirm that your understanding as Minister of Finance is therefore that the failure of ETS auctions results in the Crown taking on more debt?
So there's two things happening here. The first is when ETS units sell at auction, yes, that has a cash impact. On the other side, the sale of a unit also creates a liability for the Crown, which is
Understand.
reflected in the balance sheet. So there's a very equal and opposite reaction. While you get a cash positive impact, you get a liability negative impact on the other side. The point that you are making about the cash picture is real. And of course, it is across all areas of government forecasts that there can be differences between what is forecast and what eventuates. And the Treasury always updates that in each of its updates.
So to that effect, we have looked across the failure of all of the ETS auctions in the past term of government, and we've compared forecast NZU cash with receipts with actuals. And what we have come to the conclusion of is that there's an approximate $1.4 billion increase in debt that has been taken on as a result of the failure of the ETS auctions. Does that correspond with your understanding?
Well, I think the simple point that I am working to make to you again is that that has also, on the other side, been balanced out by a commensurate reduction in Crown liability. So you cannot look at one without the other. If those auctions had cleared at that price, the Crown's liability would be higher. So yes, there has been a reduction in cash receipts, but on the other hand, there has been a reduction in Crown liability. I also would note that it's very unclear to me whether the member is saying that the Crown should intervene in the ETS market to somehow set a higher price for the auction, which is the necessary flow on from what she's saying.
Not at all.
And it's our view that actually the operation of the ETS in a predictable manner is quite important. And the Crown has very limited in its ability to affect that price by intervening in the
Just to be
market.
clear, Minister, about said member's position, it is that we should have a credible ETS market, something which many market players, experts have provided commentary on over the past 2 years, stating that government policy has resulted in undermining of confidence in the emissions trading scheme, resulting in the failures of those ETS auctions. That is my position. That is the position of said market. The other point that I would make is that I very much understand the correspondence between liabilities and those cash proceeds. But the point that you were making in your previous answers was that increased debt also comes with increased debt servicing. So therefore, are you not concerned with the increase in debt that has resulted as a result of these failures?
My point is that the liability is reduced on the other side. I think I've made that clearly.
Okay, we've got another supplementary from Barbara.
Yeah, just very simply, how much has net core Crown debt grown on average during the period 2017-23, and what the forecast between 23 and 28?
So I would turn the member to my favourite table in the BFU,
Same.
which I have
favourite
many copies of printed, which is at the very back. And that is the time series of fiscal and economic indicators, which goes through all of those measures, including core Crown debt, and shows that core Crown debt in percentage terms was in 2024, 41.7%. In 2025, the only year for which we have full numbers for this government is 41.9%. It is forecast in 26 to reach 42.4. And look, I'll save the members the delight of me reading out the rest of the row, but it is all set out very clearly there.
Yeah, so my understanding from the table at the back, which is again my favourite too, is that as a percentage of GDP, excluding New Zealand super, it's risen from 33.9% to 4.8% between those two fiscal periods that I asked about.
Sorry, what has risen by that?
23 to 28.
So, but which measure are you talking about?
So, sorry?
Which measure are you talking about?
I'm talking about GDP, as percent of GDP, not net core Crown debt.
Right. So net core Crown debt.
23.
Net core Crown debt in 2023 was 38.7%.
33.9, excluding New Zealand super.
Yes.
So just my question being, given that it's risen from my understanding 33.9% to 44%,
Mhm.
just understanding the assumptions underlying that for that change.
Yeah, so in terms of net core crown debt, the key issue that we are having to deal with is threefold. One, as I set out in my opening remarks, the gap between current spending and revenue. Now, there have been material impacts on that due to the delayed recovery that the New Zealand economy has experienced. Two, significant debt servicing costs, which the government has had to meet, which go far beyond what the previous government was having to meet due to the larger amounts of debt that our government inherited. Three, demographic pressures, which have meant that the cost of New Zealand superannuation is rising by hundreds of millions of dollars each year. A table that I think is quite helpful is if members have the fiscal strategy report with them. We went to some effort to set out on page 22 what has gone into the changes in the deficit forecast between pre-FU 23 and BFU 26. Colleagues will recall it's been well canvassed that there was a significant downward revision following the overly optimistic forecasts provided in pre-FU 2023. But what that table also sets out is that many of the changes that occurred in the deficit position were essentially to do with underlying economic conditions being different than had been forecast. Even if you exclude policy decisions to reduce taxation on working people, tax revenue reduced significantly over that period. But what you can also see is that deliberate government decisions to reduce budget packages and allowances has had a material improvement to the size of the government deficit, which is to say, in the absence of the deliberate decisions by this government, the deficits would have been far larger, the debt position would be far larger.
Okay, we've got still on supplementaries, Dr. David Wilson.
Yes, thank you, Minister, for that explanation. You said a little bit earlier that we can't outgrow this, and we're just talking about net core crown debt currently at around 41.9 and bouncing around the mid-40s right through to 2030. So can you put those two things together for us? And also in terms of that outlook, we're looking at nominal GDP already starting to rise and real GDP as well. So that kind of indicates growth. Can you sort of tell us what you mean when you say we can't outgrow this?
Well, first of all, just let me be very clear that we absolutely want growth and we are forecasting growth in these budget forecasts. Growth will accelerate throughout the forecast period, reaching 2.3% in the next fiscal year and 3.2% beyond that. That's very positive. That growth brings jobs, higher incomes, a real improvement in people's material circumstances. Alongside it, it does help the government books, and that along with greater growth comes greater revenue for the government. Also, reductions in some of the Crown's expenses. So we essentially need to support fewer people on benefits when there's more growth and more employment. At the same time, however, with growth, some expenses continue to grow. So, for example, the case of New Zealand superannuation, that is pegged to the after-tax average wage. So with growth, after-tax average wages will grow faster than would otherwise be the case, and therefore New Zealand superannuation broadly reflects growth across the broader economy. So those expenses won't drop even if we're growing faster. In fact, those expenses will grow faster too. So there are different aspects to it. And when I say that growth alone won't resolve the deficit, what I mean is that we will need to continue to trim back areas of spending in order to bring our books back into balance, that even if you layered over very high levels of growth into these forecasts, you would still have a gap, which is why our government has committed to an ongoing program of reprioritisations, tight allowances, and very careful management of public money.
So you're saying that superannuation as a percentage of GDP will rise?
Superannuation costs as a line item will continue to grow even as the economy grows, and therefore create an opportunity cost that there are less dollars elsewhere to be invested in health, education, other areas.
So the answer to that was yes.
As a percentage of GDP, yes, we're expecting superannuation costs to continue to rise.
Thank you. We've got a new primary from Chloe Swarbrick.
Are you committed to meeting our entire nationally determined contribution under the Paris Agreement domestically?
Well, we remain committed to the Paris Agreement. As the member is well aware, The Zero Carbon Act sets out emission reduction goals, which this government is on track to meet.
Not true.
In an unfortunate event without parliamentary endorsement, the previous Minister for Climate Change, James Shaw, significantly increased New Zealand's commitment under the Paris Agreement to our national development contribution, well beyond what sits in our zero carbon statute. And the cost of that is significant. And now the options for the government to meet that obligation are both through domestic emission reduction efforts, or there is the potential, which some seem enamoured by, of sending billions
Absolutely
of dollars
not. Quite the
offshore.
opposite.
And our preference has been to focus on domestic emission reduction efforts.
If I can, Minister, you'll appreciate I only have so many minutes to ask you these questions, so I'd really appreciate direct answers to these questions. My question was, do you intend to meet the entire NDC domestically? Yes
We
or no?
remain committed to the Paris Agreement.
Which means, as you alluded to in your own answer just then, that we either have to do that through domestic action or through offshore mitigation. Do you accept, therefore, that every time the government cuts domestic climate action, that the offshore mitigation bill increases?
No, I don't think it's that black and white. And I think that we are one of several countries who are not on track to meet the NDC. That doesn't come into effect until 2030. We don't currently have a legal liability to send billions of dollars offshore, and I suspect that there will be many developments globally about how NDCs are met and managed over the coming years.
Are you implying there, Minister, that you expect the Paris Agreement to effectively fall apart? And if so,
No.
what? Okay, so just to be clear then, what developments, can you give us any specificity? What are these supposed developments that might occur? If not the basic mathematics, that if we have a nationally determined contribution, we either have to meet that through domestic action or through offshore mitigation, and those two things correspond. If you decrease one, you increase the other.
Well, what I observe is that there are a number of countries internationally who are not on track to meet the NDC requirements, while also making good progress on reducing their emissions in their home jurisdictions. I think that many of those countries will enter discussions over the next few years about what that means in terms of the Paris Agreement and how we collectively continue efforts globally to reduce emissions, but in a way that also meets the very real, pressing domestic concerns of a number of nations, which is to say, I do not think New Zealand is alone in saying that it would not meet the expectations of New Zealand taxpayers if we were to send billions of dollars offshore to meet the terms of a global agreement. Now, New Zealand is not alone in that. Certainly, there are voters around the world who would feel very uncomfortable about those sorts of choices. And so what I expect is that ongoing diplomatic efforts will continue.
To be very
Pass
clear,
this up, please.
yeah, I guess just to be very clear, Minister, given that you've implied my position many times in your answers there, the Green Party very
I think I'll be read
strongly-
by my words rather than the implications you take from things, because in my experience, the implications you take from things are very different from the implications I take from
I
things.
would like to put my own words in my own mouth.
Sure, you do
which
that
is-
and I'll do the same.
Absolutely.
Great.
So I guess the final point that I would make, or rather the question that I would ask, is do you think that it constitutes good economic management to be making explicit commitments, particularly on the international stage, that you are not budgeting for nor planning to actually meet?
I'm very confident that the Treasury is meeting all of its obligations in terms of the way that liabilities and commitments are represented in the government books. That has been assessed by the Auditor General, who concurs.
Thank you. We've got another supplementary on this from Dr. Deborah Russell.
Thank you, Brian. Minister, thank you for those comments. Just in respect of this then, if we're not going to look at meeting our NDCs through buying offshore mitigation, then we would be needing to do more onshore.
Yep.
Can you point to specific initiatives in this budget which will help to reduce our emissions onshore?
Well, the member is, look, I'll just state it again clearly. This government and this term of parliament is not going to be sending any money offshore to meet Paris obligations.
So
in
my
terms of
question-
emission reduction, as I set out in my answer to Chloe Swarbrick, we are on track through our emission reduction plans to meet our zero carbon targets. And that is through a combination of activities by the government. It is partly a result of the ETS and the price signals that sends through the economy, and it is partly through the emission reduction efforts that are occurring across the economy.
With respect, Minister, the ETS is not sending sufficient signals at the moment, given the price it's at. So what I was asking for was a very specific question as to what new initiatives, if any, that you can point to in this budget that go to reducing our onshore emissions.
Absolutely. Well, the number one thing that I think matters is the way that we are supporting the resource management system to better consent, permit and fast-track renewable energy projects. Specifically, there is a line item in this budget to support a better Resource Management Act system going forward. It has been the case that with the Fast Track Act, we have been able to bring on stream more solar and wind development than occurred under the last government. And what we want to see is a Resource Management Act that is able to do that in normal times, not just with a Fast Track Act. And we are investing in this budget to support that. We also, in this budget, have put forward a gas transition loan scheme, which is to allow for the fact that many firms have faced spiking gas prices as a result, in part, of the previous government's decision to ban the exploration of oil and gas. And so we are providing Crown-backed lending to support those firms to transition, in many cases, to electricity, which will largely be from renewable sources.
So again, with respect, Minister, the previous government had a Fast Track Act that was also getting renewables built and there were renewables consent.
Not as fast as we've done, Deborah.
Well, there's
Well,
nothing
so that's a moot point. Those things were actually.
Well, it's not moot. It's there's real solar panels and real windmills as a result of our Fast Track Act.
That's not true.
It's not moot.
I wonder if I could ask my question. And with respect to gas, that's just using more of a fossil fuel, so it actually adds to emissions. So I'm still looking for something new that your government has done that is reducing emissions.
Well, sorry, I think you've misunderstood. So the gas transition loan scheme is to assist firms who are currently reliant on using gas for their processes to transition to other forms of energy use. Many of them will make the choice to convert their energy to electricity and renewable electricity. So materially, for many of those firms, that will reduce their overall emission profile.
So it's a real shame then that the GIDI was cut, because that was a very specific effort.
No, that was corporate welfare, and I'm very pleased that we got rid of it.
Okay,
Thank you, Minister.
We've got Chloe, we're very keen for another supplementary.
Yeah, it was just to finish that NDC point. So I don't know if this is most appropriate either for the Minister or for Treasury, but you'll both obviously be aware that Treasury published a paper looking at if we were to meet our NDCs, then that commitment will materialise at approximately $5 billion out to 2030. And I have parliamentary written questions from you, Minister.
I'd like to note that that paper is long for a reason, which is that it has to fit in a lot of caveats.
And Minister, I have a parliamentary written question, or rather answer from you, which stated, and many of these answers stating that it was, or you understood it to be Treasury's intention originally to publish this paper alongside the BFU. Can I understand what happened or what changed? Why was this paper not published alongside the budget?
Yeah, so the Treasury provided a copy of that paper to my office ahead of the budget. My office asked questions about the commercial and market sensitivity of it, the readiness for me as the Minister to answer questions about it on budget day. And Treasury responded to that by judging that it would be better to release it another day, but that the most important obligation they faced was to ensure that the most up-to-date assessment of the fiscal risks that that paper informed was reflected in the BFU, which it was. As you're aware, they published the full analysis soon after the budget.
Very interesting.
Thank you. We've got a new primary now from Maxie Vu.
Thank you, Chair, and thank you, Minister. It was briefly asked in some of the supplementary questions around the growing pressure of demographic changes in the future in New Zealand. I think this is it. About the growing pressure on demographic changes in New Zealand, and particularly that comes around with New Zealanders are genuinely living longer, people who need more healthcare services, obviously a growing superannuation cost, and everything else that is needed. Now, I'm receiving a lot of comments from people in the community to say, well, what's in this budget for the younger generation, the younger New Zealanders of today, when what we hear is a tight budget,
and what we read is cutting budget and cutting expenses in the budget. But what is in the budget now that would give us a disciplined spending that will continue to provide for a future that we can actually look into? And what is this government doing for a better disciplined spending to grow the New Zealand future for all New Zealanders?
Look, I think one of the most significant investments that any government can make in its future growth prospects and its young people is through the education system. And this budget commits significant additional funds to the education system. We don't view that it's enough to just write bigger checks. You also have to get better results for that. We've had a real focus on lifting the focus on literacy and numeracy in our primary schools. That's already getting really great results. I think excitingly, what the evidence is showing so far is that the lifts in achievement are actually greatest for those children who are coming from the lowest socioeconomic background. So that is significant for all of our futures. This budget focuses particular resources into the secondary school system, both to redevelop the national qualification and the curriculum that sits alongside it, but also to put a real push on trades training. And I want to give credit to New Zealand First here, who were instrumental in driving this package forward. Trades academies have been proven to be successful in terms of kids who attend them being more likely to stay and work, to find work upon completing qualifications. There's been huge demand for trades academies. They essentially bring together workplace training, the school curriculum, and employers. And we are doubling the number of places in those trades academies through this budget. We're also putting an additional investment into the Youth Guarantee program. That program is essentially there to scoop up the kids who did leave school without the basics that they need to even enter an apprenticeship. You know, they don't have qualifications, they don't have basic literacy and numeracy skills, and the Youth Guarantee wraps extra support around those young people into tertiary preparation courses, foundation learning courses. The other thing, of course, that we've invested in significantly in this budget is the health system. And I'd point you to a specific initiative which is close to my heart, which is about ensuring that mothers, when they give birth, can have access to a 3-day natal stay, postnatal stay. And that's something that we will be rolling out progressively with a priority in the first instance on new mothers.
Thank you. We've got a supplementary from Barbara Edmonds on that.
Thank you. Minister, just to your response and referencing education, I agree with the importance of investment in education. But when you look at inflation is forecast to be 4% this year, yet real terms increase in...
To be fair, can I just for a correction, that's what inflation is forecast to peak at.
Yeah, this year. So operations funding for ECE is at 1.5%. That's potentially a 2.5% cut in real terms. Operation fundings for schools, 2%, a potential 2% cut in real terms. What do you expect ECE centres and schools to cut?
Well, I think if you look back over previous budgets, even during the days when Grant Robertson had the money bazooka out on full force, you wouldn't see a correlation between the increase in operation grants and the inflation rate. That hasn't historically been the case. We don't just provide additional funding to schools through the operations grant. We also provide support through professional development funding, through teacher salary funding, through additional funding that goes through a number of specific appropriations. So I don't think it's appropriate to simply focus on the operations grant number. In the case of early childhood education, the member will be aware that early childhood education centres have a number of different arrangements. Many of them are private businesses and will choose how they meet their costs and what that means for their profitability in their own ways. We have also put a significant additional support into the early childhood education system through the Family Boost program, which rebates parents for the cost of their fees and ensures that we are able to keep the cost of early childhood education affordable for working families.
So, Minister, what is covered under operation funding?
Operation funding is a bulk grant that is made to schools based on their roles and is intended to cover the costs of operating the school.
Like?
Electricity and other costs that they face. Wages are paid separately through a teacher salary grant.
And so what else is under operating funding?
Those are the costs of things like caretakers, sometimes the cost of discretionary items, whether that's school resources, whether that's other materials that are needed to educate children. And schools have considerable flexibility and choices about how they use those grants.
Got another supplementary from Dr. David Wilson.
Yes, just following up on the CPI inflation forecast of 4%. Some commentators say that more of a near-term peak and then forecast next year to go to 1.6%. What are your thoughts on that?
I think it's a very difficult time to be a forecaster, as we've seen even in the past week. As I looked it up today, Brent crude oil has now come below $80, which is a long way south of the peaks, more than $130 that we've experienced in recent weeks. And essentially what forecasters are trying to predict is what's going to happen with the international oil price and therefore what will inflation be. It is the case that a lower oil price means lower prices at the pump and less inflationary pressure in the economy. So it is in all of our interests that international oil price not only come down, but stay down. And that will be the most material input for the overall inflation figures that we see for the New Zealand economy.
So you think we're on track for 1.6 next year?
I will hand over to my forecasters to make judgment on that.
What's their prediction?
Look, I think as of today, we're broadly comfortable with the forecasts that we had in BFU. But I would underscore the point that the Minister made is, I'm sure there will be lots of potholes in the road ahead. We are not by any means, complacent. So while we actually think that is a real outcome in 12 months' time, I think we just have to see how the water flows under the bridge or through the straits.
Through the straits, indeed.
But another quick sup from Barbara.
Just really quick, Ian, is there a way for Treasury to make the forecasting a little bit easier for you? Because obviously you closed them just before Anzac Day this year. Obviously things change very quickly. Is there a way that you can think of to support Treasury and obviously the Minister of Finance around that forecasting where you can get it a little bit closer towards the date of budget, through a supplementary information or something else that you could table?
Well, I just note, and I will let you speak to it, Mr. Secretary, but I would note that it was quite unprecedented that the Treasury this year left the final forecasts as late as they did, that they chose to reopen them in order to have the forecasts reflect the best information available in the market at the time. And so the Treasury, I'd like to give credit to, were very willing to, as much as possible, fast-track their production processes and other processes to reflect the best information available at the time. But I'll let you speak.
Yeah, and I think, if I speak to both the specifics, if we had, by the time we got to budget day, for example, oil prices were a little bit higher than we had assumed in our forecast, but in the big scheme of things, not materially.
Forecasted.
I think the more general point is, whenever you cut off, you're always going to be cutting off before budget day. And that's where I think the scenario analysis becomes important, because there are always things that are happening in the economy. And certainly this committee knows we think our future is a more shock prone world. And for that reason, I think the scenarios are actually really important to actually give a sense of some of those uncertainties.
So as a part of those scenarios, and again, they were from April, obviously when the moratorium started. Is there a potential where if, say, obviously Parliament can do whatever they want, but if there was certain criteria met, that it would allow Treasury to have an additional supplementary forecast just to provide that greater certainty? Because to your point, and to the Minister's credit, there was a lot of shade thrown on Treasury around those forecasts, but you were obviously trying the best that you could at the time. But do you think there's potentially, it would be helpful if there was a mechanism for Treasury to have, when certain criteria are met, an ability to provide supplementary information?
Well, there's nothing to prevent Treasury doing that right now. And in fact, what you saw me do in response to the Middle East crisis was I held updates with the New Zealand media to provide them scenarios of what we thought the increase in the global oil price meant for our forecasts and the economic position. So there's nothing to prevent any Minister of Finance from taking that choice. I don't think that is different.
Fiscal update.
Well, it's exactly that.
Which would prevent for example, a new Minister of Finance saying, oh, they were overly optimistic.
No,
And it
well,
wasn't exactly the words that Treasury used.
But of course, a BFU is different from economic forecasts because a BFU
Budget,
also
economic,
takes into
fiscal
account
updates.
fiscal decision making.
And it's still budget and it's still economic.
Yeah, and so in terms of the Treasury's ability to provide updated economic forecasts, there's nothing to prevent them from doing that at the discretion of the minister. And also note that the New Zealand public has regular opportunities to see revised forecasts from the Reserve Bank, who provide revised forecasts at a very regular interval.
Okay.
So to that point, it's at the discretion of the minister.
Well,
that is the difference.
Well, there are statutory minimums that the Treasury must meet in terms of its EFUs, its half-year updates and its BFUs. And as the Secretary has pointed out, the Treasury has, as a matter of practice in recent times under my watch, provided much deeper scenario analysis of how those forecasts could vary depending on different events, both positive events and negative events, and they provide those in the EFU documents. It's also the case that at any time, the Treasury can be asked to provide an updated estimation of the forward economic picture, and I've shown willingness in recent times to do that.
So the shade that Treasury received then could have been avoided.
I'm going to leave it there. And we've got a new primary from Megan.
Thank you. Just going through the supplementary estimates in terms of this, there seems to be a large, quite a big chunk of the savings are being achieved because of delays in capital spending. There's a large number that are being pushed into different time periods. So just for example, we've got the regional infrastructure fund, that's 257 million, the Kiwi Rail Holdings, 203 million that's being rephased in there. What is the total value across this budget in terms of the supplementary estimates compared to the 25/6? Estimates in terms of rephased spending?
Well, I think I'd just make an overall point, which was made very compellingly in the Infrastructure Commission's report, which I'm very pleased to see we have pretty broad cross-parliamentary support for, that New Zealand has a track record of not well business casing, choosing and delivering public infrastructure projects. And what that has meant over successive years and successive governments is that there has too often been a delay between funding being appropriated for an infrastructure project and that infrastructure project being delivered. A couple of cases in point that come to mind for me. You'll remember the big song and dance about sewage down the walls at Middlemore Hospital. Well, that project ended up commencing under our government. Despite the funding being apportioned under the last, it didn't actually get underway. A second example is that of Dunedin Hospital, where again, various commitments were made under the last government to get that project going, but it became quagmired in the design and development phase. And so a real focus for our government has been, how do we ensure that when we fund, that is a portion in a budget, the capital funding for an infrastructure project, that infrastructure project is actually deliverable. And going into this year's budget, that was a real focus for me in selecting which infrastructure projects we would fund, was querying ministers as to whether they were deliverable and when they would expect actually that spades would be able to get in the ground. So what's material there is it consented? Is the business case ready? Do we think that it is able to be delivered? And so the point that the member's making, I broadly agree with, which is that there has been an ongoing challenge across government, across many agencies, where the government votes money for a particular infrastructure project, but actually the readiness isn't there sufficient that it is delivered in the time that we would have expected. And so that is something we're working very hard in the infrastructure system to fix out.
Appreciate that explanation, Minister, but across all votes in this budget and the supplementary estimates that have been delivered with it, how many capital and major operating projects have been delayed, downscaled, paused or cancelled?
So are you talking about operating projects or capital projects?
The question.
Are you reading something out? Because I'm happy for you to submit it as a written question.
I'm reading the notes I wrote. Since the 25-26 main estimates, if you don't know the number, we can submit it as a written question and you can get it to us.
Sure.
But
It's just
in
that you've
terms of the
conflated
savings-
operating and capital, which are two obviously very
I'll do
different
it in two
things.
separate parts.
Great.
In terms of the capital projects, how much of the savings that are in here as a result of delayed, deferred or downscale projects?
I'm very happy to come back to you in writing.
What about in terms of operational expenditure?
Very happy to come back to you in writing.
Okay, just a couple of other supplementaries, Mr. Chairman. One of the things that I'm really interested in is the very large increase, the $450 million increase to the buffer for unappropriated expenditure that's put into this. It's around a 25% increase.
Yeah.
That's in there. I think the committee would welcome some understanding of why we've got this 25% increase in their unappropriated spending. I mean, we all know unappropriated spending.
I've got an answer for you if I think I understand your question, which is to do with the increase in supply between budgets. And essentially what that relates to is a technical challenge. And I'm looking behind me, the right Treasury person, which is essentially because of our decision to set up the school property entity for delivery of school property infrastructure. What that involves is a transfer in the government books, which requires impressed in supply, even though the Crown's actual fiscal position doesn't change. It does require an impressed in supply change. But I wonder if there's anyone behind me who would like to explain that better.
Because it's not just school property. It's
That
across
is the
a range
key.
of.
It is absolutely the material thing that has changed, the requirements on impressed in
It's
supply.
listed out as across a range of votes.
I'm not sure what.
Okay,
so
I'll
what's,
put them to you as written questions and you can come back to us with the detail on that. The other thing I'm interested in is just understanding what it is, the change in terms of the superannuation. The superannuation change, the way that's being accounted for in the budget.
Yeah, so there's a couple of different things going on there. If I
it's the $103 million decrease.
Sorry, what are you referring to? So if I refer
from the supplementary estimates, that's the New Zealand Super Fund contributions, a decrease of 100.
Okay, so as the member is very aware,
yeah,
the formula for the contributions to the New Zealand Superannuation Fund and the withdrawal timeline is set in law. The government has made no changes to that law, and we have made no discretionary decisions which go beyond that law, other than the decision to ensure that some of the contributions last year went towards the Elevate Fund, specifically under the supervision of the Guardians.
So the reason cited.
So this will all be related to the legislative formula as well.
So that's my question, Minister. So the reason cited in the documents is reflection of funding profile calculation based on legislation. What changed?
So the key things that changed this year, because members will have observed that there was actually a really significant change this year per the legislative formula, which is that last year we were predicting that we would soon be making withdrawals from the New Zealand Superannuation Fund, whereas this year we're forecasting we won't be making withdrawals until 2054. And the reason is twofold. One, demographic, more older New Zealanders than had previously been forecast to be the case. The second is to do with the rate of return, which the Guardians have agreed to. They've essentially downgraded the rate of return on the super fund at the margin, and that is because when they look at the rate of return they have got in recent years, large amounts of that have been driven by significant lifts in US equities, in particular the Magnificent Seven, and they have formed the judgment that that level of return is unlikely to be sustained into the future, and therefore, in line with the choice of many other funds around the world, similar to the super fund, have reduced their return assumptions, and that therefore feeds into the formula, the legislative formula, and impacts their estimations on the size of the fund, and therefore when withdrawals will happen and how many contributions need to occur. It is the case, I'd just reflect members, that the way that the formula works for the super fund is pretty opaque. There's one really smart person at Treasury who can explain it really well, and if colleagues ever wanted a briefing from them, I'd encourage them to take it up, because the fact that it can vary so significantly, that last year we were predicting withdrawals, and this year we're saying it won't be happening till 2054, is pretty dramatic. And it's because small changes at the margin can really significantly impact that profile.
Great. Just the other very technical question around the supplementary estimates too was the actuarial assessment of the Crown's liability to the super fund. There's a 21% decrease in the appropriation there. Can you explain to us why that is?
Does someone from Treasury want to help me out with that? We'll come back to you.
Okay, thank you.
Thank you. We had a quick question, a supplementary on super with Dr. David Wilson.
Yeah, and I no longer need a primary.
Very good.
On superannuation, really intrigued by the formula. Given that we've got a cohort, basically boomers, moving through in the next 30 years. And so contributions to support that cohort not happening till 2054, does it seem like a good idea?
Yeah, look, it's interesting. When the fund was established, I think it was understood that it was meant to be a smoothing mechanism to recognise the fact that today's taxpayers are both supporting superannuitants who are currently in the system, but are also paying taxes now to fund the future costs of superannuation. And it is, I think, worthy of reflection that actually this generation of taxpayers won't be benefiting from the super fund because we won't be making withdrawals until 2054. That reflects the fact that the fund is never intended in the legislation to be exhausted. It's actually a 40-year rolling fund, so it just keeps going into the ether.
Yeah, supplementary. I don't think I was talking about it being depleted at all, just talking about the weight of contributions that would be in line with the demographic changes.
Well, to be fair, the formula that is in the Act is intended to reflect demographic changes as they occur and require greater contributions from the Crown to reflect that and to set withdrawals that the Crown makes in relation to that demographic picture. So that is intrinsic to the formula. But as this year very clearly illustrates, small changes in that demographic profile, small changes in the return profile can significantly impact on the contribution and withdrawal profile.
You want a supplementary?
No, just a quick one.
Okay, we're going to go to Todd Stevens.
So I know, and thank you, Minister. You've probably gone a bit over time, but I want to thank you for being here. Well, we've talked a bit about the forecasts that Treasury had to put together with the Middle East crisis going on. Yeah. But obviously, I'm an optimistic guy. So in the last 48 hours, I think we've seen hopefully some resolution to that. What can New Zealanders expect to see over the next year, do you think, in relation to the New Zealand economy and our prospects going forward, particularly if peace holds in the Middle East?
Yeah, I mean, look, there is just absolutely it is the case that the news in recent days is very good news for every New Zealander, because what we've seen happen already is the international price of oil fall significantly. It was under $80 when I checked today. I start each day checking on the price of Brent crude. And the reason I do that is because it is so material for this economy. Number one, that's what determines the price you pay when you go to fill up, whether you're a household or whether you're a business. Number two, how much people are paying for fuel affects inflation across the economy, which is obviously something that we all want to see staying on target and not going out of band, because when it goes out of band, that's when we get massive upward cost of living pressure. Number three, that inflation trajectory then determines the monetary policy response that the Reserve Bank takes, which is to say when inflation's more under control, they're less likely to increase interest rates, which is so material, not only for New Zealanders with mortgages, but also for businesses thinking about borrowing to invest in the next construction project, the next development, the next expansion. So what I want to see is lower global oil prices, because that means less inflation here at home, it means lower interest rates here at home, and fundamentally it means more growth, particularly because lower oil prices have an impact for the entire global economy. And when the rest of the world is growing faster, that is good for a small exporting country like ours. So I, too, am buoyed by recent developments. It's also the case that what we have seen in recent months is that good news can be very quickly taken away. So I'm not counting my chickens yet, but materially, they've been very positive developments.
Thank you. We've got a supplementary from Tom Rutherford.
Yeah, thank you, Mr. Chair. Budget 2026 contained a $450 million one-off operating contingency for possible further targeted, temporary and timely measures in response to the conflict. Can you just explain why you put this reserve to one side in this year's budget?
The short answer is we believed it was prudent and responsible. As the BFU sets out very clearly, Treasury, while they had one core set of assumptions about what would happen with oil prices and therefore the economy, also were very candid that they saw downside risks in which we would see higher fuel prices, more inflation, more pressure on New Zealand households. Now, what we were conscious of was that was dependent on events outside our control, largely events in the hands of the Ayatollahs and Donald Trump, and that if there were to be negative developments, that could have very material impacts for New Zealanders. And we wanted to be able to have further targeted, temporary, timely responses should they be needed. And we believed that providing some funds and reserve for that was the prudent thing to do, because in the absence of doing that, what we would have essentially have been saying is cross your fingers, let's hope it all goes as planned, and if it doesn't, we'll be whacking it on the credit card, whacking it on the debt, which was the approach taken by the last government, who used any excuse to dial up the spending outside operating allowances. Our tight, disciplined approach has been to say, let's allow for that within those tight operating allowances so that we can both respond as required, but do so within a very clear fiscal strategy that is seeking to get the books back in balance and reduce the debt burden.
Can I stop off that?
And what sort of worsening conditions do you think would need to be met for the contingency funding to be used?
Well, oil prices going higher than we're forecasting and being sustained there for some time. And therefore, New Zealand is facing higher prices, more inflationary pressure and potentially higher interest rates than was being assumed, with that having material effects on households and businesses that we believe could be relieved through appropriate, timely, temporary and targeted measures.
Thank you. Is that the end of your supplementary? We're doing really well. We're just over halfway. I know. I'm just mindful you, Ian and Minister, you haven't had a drink of water, so feel free to
Don't dehydrate.
Chair.
You can blink.
We're going to go to a supplementary from Barbara. and then
Thank you,
you
Mr. Chair. I don't think I've ever had a select committee chair care so much for my hydration.
Bonus points.
We're going to go to a supplementary from Barbara and then a new primary from Chloe in just a moment.
Yeah, thank you, Mr. Chair. Just going back to the original primary from Todd Stevens and around that more economic, that sort of outlook. In the 2 years between Q4 2023, so when you came into government, and Q4 2025, how much has the economy actually grown?
In nominal terms or in real terms?
Real terms?
Again, I point you to our favourite table, Barbara, which is on at the back of the BFU. So if you look at GDP in that table, which is on the very back page, colleagues, that shows that nominal GDP on a,
real terms, back page.
real terms. So in real terms, so if we go to real GDP in
I can help. 2024, it's negative 1.4. 2025, it's negative 2.1.
So we've got the change set out there, and as is known to all of us, we've been through a difficult recovery, which shows that GDP through a production measure increased 1.1 in 24. We had negative 1.1 for 25 and a forecasting 1.2% increase for 26.
So according to Treasury, annual GDP fell by 313 million in real terms. On average, that's negative growth of $428,000, a bit more than that, every day for 2 years. So you have a going for growth agenda, and that's been in since last year, irrespective of the conflict and the shock that is happening at the moment, which Treasury forecasts to be short. What exactly in this budget, therefore, is driving that growth?
Well, in this budget, there's a couple of things that we're sustaining, which I think may enter political dispatches over the next few months. Number one, the investment boost tax credit, which will have a
0.4%.
material, well, you've asked me a question and I'm going to answer it, and then you can ask me a supplementary. The investment boost tax credit, which in the judgment of IRD and Treasury as independent forecasters, will lead to greater investment that would otherwise be the case, greater wage growth than would otherwise be the case, and greater GDP growth than would otherwise be the case. That tax credit is sustained in this budget. This budget also reflects our decisions in our first budget to reduce the taxes charged on working people, and it is my judgment that in the absence of that, we would be experiencing lower economic growth than is represented in these numbers. In terms of what our Going for Growth agenda has us progressing over the forward period, number one, that ongoing focus on skills and education, I think, is material to our growth prospects. Number two, pursuing overseas investment and trade, particularly the India FTA, is a very positive breakthrough, but also our commitment to ensuring that inward bound investment can grow New Zealand jobs and incomes. Number three, ongoing regulatory reform, particularly in this budget, represented a significant investment in enabling a resource management system that has far lower administration for firms, for councils, a far simpler path to consenting and permitting the development and construction that a growing economy depends on. Number four, ensuring that across the board, we are focusing on a science and innovation system that more closely relates public investment to the commercial and growth needs of the economy. And then number five, when I look beyond that overall picture, I think that fundamentally having good fiscal management in place, which sees the Crown not worsening inflation, not worsening things beyond what they would otherwise be, provides confidence for all those seeking to invest in this economy and grow a business in this economy. And if you want an example of that, look across the Tasman, where decisions to expand the reach of capital gains taxes have clearly already sent a message to some businesses that they should be less willing to establish and grow in that economy.
Well,
Sorry, I'll come back to you. Got a quick sup from Dan Bidwell on this.
That was first of sustained.
I'll come back to you.
Hey, thanks, Mr. Chair. We get it. The past it's been a tough recovery. Give us a sense of forward forecasts on GDP growth, how New Zealand compares to other countries around the world in terms of their forecast growth.
Yeah, well, the thing that these forecasts and the budget really show is an accelerating growth picture. So the forecast GDP growth is 1.2% for the 26 fiscal year, so through to July this year, but accelerating in the 12 months beyond that to 2.3%, and then accelerating out to 3.2% in the 28 year. Now, pick your trading partner to pick the comparison, but it is the case that that is a materially faster growth pathway than many of the estimates of the Australian economy.
Great.
Two more questions, then going to new primary.
Just going back to your response, Minister. So investment boost, according to Treasury, is 0.4% over this forecast period. So average that out across the 4 fiscal years, that's 0.1% per annum. Where's the rest of the growth coming if it's supposed to be forecast at 1.2%?
Well, a lot of the growth is coming from private firms and businesses deciding that they're confident enough about tax settings, about the government's fiscal management, about policy and regulatory settings, that they will decide, independent of me, that what they want to do is expand their business, buy some new machinery, expand into a new market internationally, hire some new staff, expand into another city. Now, those decisions are not my decisions. Those are the decisions of independent firms. And it is the case that when they make those decisions, they look outward and they consider, what does the global picture look like? What do I think is going to happen in this economy? And we saw very much that when the tariff war started, that materially affected business confidence. But they also look inward and they also consider, do I think this is going to be a stable environment in which to invest and grow? And so that growth figure represents the view of what opportunity will be in this economy and what growth it is possible to occur.
So how do you reconcile that given unemployment figures are expected to go higher?
Well, as I set out in earlier answers to the members' questions, it is an orthodox economic view that there is an order of events that occurs. Inflation comes down, interest rates come down, growth recovers, unemployment is the last thing to recover. As I say, a huge driver for me and why I want to see economic growth recovering and accelerating is that I know that what comes with that is job creation and lower rates of unemployment. And it is the case that across any orthodox set of economic forecasts will lag economic growth recovery.
Russell.
Thank you, Minister. So you've talked about confidence of businesses to invest given the economic settings and so. And you've also talked about the importance of science and innovation to this economy. So I just find those pretty high level claims hard to stack up with something that's sitting in the supplementary estimates of appropriation. And that's a $25 million reduction in the R&D tax incentive, which is a downwards forecast, saying that we're not going to spend as much on it as we were going to. And that rather suggests that businesses aren't confident at all.
No, quite the opposite. That reflects the fact that we conducted a statutory review of the research and science tax credit. And while we are making some improvements to that in terms of the way that that's paid out, responding to feedback from those who use it, we think will be improvements in it. There were also some anomalies highlighted by IRD about the way some software expenditure was being used for that tax credit, and we've made a small amendment there. But we fully expect that people will continue to access the research and science tax credit. We think it's a very important part of the tax landscape, and firms can continue to have confidence that they'll be able to access it.
Okay, I'll test that explanation with the Minister of Revenue later on. Thank you.
Very good. We have a new primary. Chloe Swarbrick.
Public sector job cuts. Could you walk us through the logic, the assumptions and the calculations that were necessary to land you on that 8,700 figure?
Yeah, so the basic logic is that if you look back over time, again, blue and red governments, we're yet to have a green government, God give me strength. But if you look back over blue and red governments, then proportionate to the population, the core public service has tended to be about 1% of that population. Under the last government, there was an extreme increase in the numbers in the public service from around 43 to 67,000. Sorry, no, I've got that wrong, 43 to 61. And what that meant was that as a proportion of the population, core public service was more like 1.2%. As the member is aware, in our budgets, we have consistently looked to reprioritise baselines. We made a very significant baseline reduction in our first budget. We set caps on contracting and consulting spend. And even despite making those changes, we haven't seen a significant reduction in the number of public servants. In fact, in some areas, it has grown. So our view has been that we need to be quite clear that we want it and the logic to look more like what it has historically. We see no reason why in a modern age with great digital tools available, why we shouldn't be able to have a core public service similar to size it's been in the past. So we therefore projected forward and said, what would 1% of the population look like? We were realistic. We said, well, you wouldn't achieve that overnight. The better way to achieve that would be to give yourself some time to plan for it. So we set that out-year target. And then what we've said is, okay, well, how do you achieve that? Because you can achieve that in small, bare ways, or you could actually provide to the public service the opportunity to take a blank sheet of paper and say, well, how do we reorganise this thing in a way that leads to less duplication, less wasted resource, is more sensible? And it's really clear that 39 government agencies, as we currently have, makes us stand out from other countries in the world. It seems like too many. It actually is frustrating both for the agencies and public servants themselves and for policymakers, because you have a non-joined up back office, you have duplicated functions, you have inefficiency. So in the first instance, we've said to the Secretary for the Treasury, the head of DPMC and the head of PSC, we want you to provide us, based on the input from all of those government chief executives, a view on how we could reorganise this, make it a better, more efficient system. And then from that, we expect that there will be a flow and a reduction in some of the roles that will bring us more back to 1%.
So just to be really clear and to not conflate things there, you're talking about the basic rationale being the extrapolation of the historical size of the public service, not looking at, for example, the application of the efficacy, the capacity of AI tools.
Well, let's go back even a further step, which is we're looking at the government books and saying we can't stay in perpetual deficit. We can't keep growing the debt mountain. But we know we need to keep delivering in every budget more resources to the front line of our public services, more resources for our hospitals, for our primary carers, for our schools, for our early childhood centres. We need to be investing in more infrastructure. How are we going to achieve that if a greater and greater proportion of resource is being sucked up by the back office of the core public service? We don't think those two things are reconcilable. So we've said a logical position is to take the size of the core public service back to where it's been historically as a proportion of the population. That is the key driver. What you're asking then about is what are the enablers of that shift? And one of the enablers is obviously reducing duplication, ensuring more efficiency, adopting digital tools, which will include AI in some instances.
Will those cuts under your government continue to move ahead if there is no guarantee that the capacity of the public service is able to remain the same?
I take a much more optimistic view than you. The capacity of the public service has not diminished since it last ran with 1% of the population. In fact, we have incredibly capable people in the public service who believe that they can deliver more with less, and who have said that actually, if you had less duplication and less of this spaghetti that has arisen, frankly, under successive governments, where we've got all of these different agencies and different reporting functions and different back offices, if we had less of that and we're more able to focus on our core job of delivering services to the public in a logical, lean structure, then that would be a good thing for New Zealanders. And I concur with that view.
Yeah, respectfully, Minister, I'm not being pessimistic. I'm just being realistic.
Well, you're talking about the capacity of the public service having reduced, that somehow they need 1.2% of the population to do what they previously did with 1%. I take a more optimistic view. They, like everyone else, are increasing their productivity, increasing their efficiency, increasing their imaginations.
That's not what I'm saying, just to be clear. What I am saying is trying to, or rather what I'm asking, I'm trying to probe and understand whether your transformation plan, which we still don't really have the details of, will continue. If it is, for example, potentially proven, as we're seeing in much commentary overseas, that AI is not meeting the transformational potential that it has sold to potentially offer.
Well, as I said out in my primary answer, this isn't just about AI. It's actually about reducing duplication, reducing the spaghetti, using digital tools, modernising the structures which the public service operates within.
And you can guarantee that that will not result in a reduction.
As I said,
the public service.
I am very much of the view that the public service, the core public service, is not less able today than it was a decade ago when it managed to run at 1% of the population. I see no impediment to why it can't do that again.
Okay, so on the AI point, because this has been raised a number of times, including at the point of the announcement, who is going to own that artificial intelligence that's running through the public sector?
Well, we have enabled the Public Service Commissioner to become the government's chief digital officer, noting that we think that there needs to be one central point of accountability for both the procurement of digital tools and the frameworks which they rely on.
Respectfully, that wasn't my question was who is going to own that AI? Will we as a country, will the government own that AI and the underlying operating model and the data and algorithms, or will it be contracted out?
Well, in terms of the AI tools that we adopt, obviously all of those tools will have to be subject to meeting the privacy standards, the ethical standards, and the data use standards, which we will set as a government. And the reason I'm pointing to the Chief Digital Officer is that we do expect that responsibility for both setting and ensuring those standards are adhered to will sit with that one single point of accountability.
Thank you. Sorry, Chloe. There's 6 ups in there.
Quick supplementary from me. Look, and thank you for your comments around the public service, and I particularly liked your worry about the spaghetti and duplication. We actually had the Minister of Regulation before us earlier in the week, and he talked about the regulatory landscape report. I'm sure you're familiar with it. I think the 268 regulators in New Zealand. Is that the kind of foundational information you think can inform the government's thinking around simplification and getting rid of the spaghetti of government?
Yeah, look, I think the member makes a good point, and I'm sure that the Minister for Regulation highlighted this during his appearance, that even beyond those 39 departments and agencies, we then have quite a spaghetti of Crown entities. We have an entire local government infrastructure, and that has led to a real spaghetti in the regulatory landscape. I think one of the most significant shifts that we are making as a government is in terms of the resource management regulatory landscape, because at the moment you have dozens of different territorial authorities interpreting the RMA in really different ways, so that even within one region, you can have completely different resource consent requirements in one geographic location than in another. And a large part of the Minister for Resource Management Reform's drive is to have actually national standards, national approaches, and that's why we've made the investment in the budget into that digitisation, so that actually the government can provide tools to all territorial authorities that mean that that's a standardised regulatory process so far as possible. Of course, you need some local overlay because of just the reality that the environment varies in Northland than it does in Southland, but you can massively standardise and streamline those regulatory processes.
Thank you, Barbara.
Thank you, Mr. I'm just talking about that spaghetti, and I understand you're not an electorate MP, but you do have an electorate office. We have, or at least my office has, and I speak to other colleagues, we have a number of cases that come back to us where either one government agency tells the customer or the client to go to another government agency, that other government agency tells them to go to that agency, and then both put their hands up in the air. They say, you're not entitled to anything. They send them to our office, and then we refer them to food banks. How does public service cuts help that situation, given the pressure that these government agencies are under, given the workload and the caseloads that they have, and given the reduction in entitlements that they can help the New Zealand public with?
Well, look, 2 points there. The first is, the member makes a point which is very close to my heart, which is actually our lens as we reorganise the public service should very much be on the New Zealander interacting with it. And at the moment, it is too often the case that it's unclear which door people should go to, which department they should go to. Too often the case that they do, you're right, get bounced between different agencies. Should I be talking to Kāinga Ora? Should I be talking to MSD? Should I be talking to OT? Should I be talking to Health NZ? And it should be the case, actually, that where we're trying to get to is it doesn't matter which door you come through, the service and entitlement is made to you very clearly. And we should reorganise the public service in a way that puts the New Zealander using the service first, rather than the needs of the individual department and their view of where the boundaries lie between them and the other agency. I abhor the duck shoving that goes on. So first of all, I agree with you on that. The second point, which you're making, I think, substantively about food banks, one of the things that we do in this budget is, for the first time, provide baseline ongoing funding for the food infrastructure network, which was an initiative started by the previous government, but that was only ever time limited in funding. And that is the network that provides the food rescue services, the other food infrastructure, so that if you're a local food bank, rather than having to reinvent the wheel and set up your own bespoke arrangements, you can work with that food infrastructure network to access excess food, whether that's through a food rescue service or through a particular entity that's got excess of a particular food product, and you can access that for local use. And we've judged that that food infrastructure network is a helpful thing to have in place, and that's why we've baseline funded it.
So it's just about the food network, started under COVID, given the impacts that were happening at the time. So you're saying that it's now baseline. So is that the only funding that goes towards the funding of food banks?
Well, there's also funding, I think, for the next fiscal year for food banks as well, on top of that baseline funding. But going forward, our position is that the role for government does exist to have that ongoing infrastructure in place to allow food rescue services and the like to continue and to be sustained into the future. And I'm really proud that we've fixed that position, which was the fiscal cliff left to us by the last government.
And have you spoken to food banks about this? Have you visited them recently?
I haven't visited a food bank recently, but certainly in the past I've visited KiwiPulse and a number of food banks throughout the country who are of the view, and I've received correspondence from those, that the food infrastructure network is really important. I know that Minister Upston has engaged significantly with food banks about the importance of that network. And here in Wellington, I know that food rescue services have made it clear to her that ensuring that they have predictability in that funding environment is something that they want to see.
Thanks,
So when did you last visit them?
Sorry, we're going
that's
to
real
stand,
quick.
but you've had 3 subs on that part.
Thanks, Mr. Chair. Just a sub going back to the AI, use of AI. Do you have any use cases, examples of where government has been able to use AI to deliver more for less? And then I guess in the forward-looking program, what are the use case scenarios that you and your government are looking at to again apply a greater productivity lens in government?
Yeah, look, great question. The example that I'd point the member to is Health NZ now have an ongoing commitment to be looking at what AI tools they can do to free nurses, doctors, health practitioners up from administrative tasks so they can focus more time on care for patients. And a recent endeavour that they took on was to use scribes, AI scribes in the emergency waiting room. And that has been really successful. They found that it reduced the amount of time they were spending filling in forms at the computer, updating the information that they were collecting from patients, and had many hours released that they were then able to spend actually with patients providing care, which of course has a flow-on effect of reducing waiting times for patients and improving the care that they receive. Interestingly, the feedback from the nurses, doctors, health practitioners themselves on that AI tool was incredibly positive, that they saw it as improving their service to patients, improving the enjoyability of their work, and saw it as a good thing. So I think what that shows you is that there are quite simple AI tools already available that if we apply them to public service delivery, actually free up our people on the front line to do the thing they come into those jobs to do, which is often to care for people, not to be tied up in endless admin.
Great stuff.
Thank you. Deborah Russell, you're the supplementary.
I do have a sup on this. It just goes back to the discussion around food banks and the like. And I guess, we funded that food infrastructure during COVID, which was an emergency. And there was amazing work went on right across the community to make sure that people got fed. I guess that one of the things I find worrying is that we are now industrialising or having an industrialised setup for food rescue and for food banks. So that instead of food banks being a very much an emergency temporary measure, as they were 30 odd years ago, and churches ran them alike, they've now become part of our social welfare network, and we actually have industrialised them too. So instead of being an emergency measure like COVID, it's now industrialised in. That seems to be a very poor reflection on how we're managing the welfare of New Zealanders.
Well, you know what? Philosophically, I agree with you that actually in New Zealand, our focus should be on having a sufficient welfare support system. And I would argue that we do. We have a very generous welfare support system in the form of the safety net that exists for those New Zealanders who are unemployed, who face hardship, who are ill, who are disabled. We do have in place a benefit system which ensures that they can access income both for themselves and their dependents in times of need. And it has been our judgment that having a network available so that there is some support for people when they require hardship assistance is justified. But I think that actually focus on the core welfare system is appropriate, and which is why we have not given in to calls from the Greens and at times your own colleagues who have said put more money just into food banks. We've said, well, actually there's a role in terms of that core background infrastructure, but overall let's focus actually on allowing New Zealanders to be independent and allowing them to have sufficiency of income. Number one way to ensure sufficiency of income, get people into work, which again takes us back to this discussion. You've got to be growing the economy, creating adequate incentives for people to enter the workforce so that they're not trapped in welfare, and ensuring that the welfare system does its job, which is always meant to be help you on your way, not trap you there forever.
With respect, Minister, I've made a habit ever since I became an MP actually, and realised some of the difficult things going on with unscrupulous lenders, of visiting budget services and money counsellors and the like. And in the visits I've made, not just in the last year or so, they've talked about families, households where there are two adults in work, and those people are now having to visit food banks. It says that work itself may not, there's something wrong. We've got something wrong in the balance of what we're paying people. So if we've got families that are in work having to access food banks, we've got something wrong with the structure of the general expenses in New Zealand.
Yeah, look, I fully acknowledge that there are people who find themselves in very difficult circumstances who are working. And And that is troubling, not just to you, but I think to probably everyone in Parliament. And that will reflect a range of circumstances. Sometimes it will be that something completely outside of that family's control has happened that's created a significant financial setback, whether that's a large expense that they weren't expecting, landing on their lap and then them going into debt to be able to fund that expense, and then that debt cycle emerging, affecting their ability to access credit, affecting their repayments on a weekly or monthly basis. That's something that you'll hear budget services say, that sometimes it's one setback that then sets in chain an ongoing picture that can be very difficult for people. It is also the case, of course, that in recent times in New Zealand, that period of 33 months where inflation was completely outside of the target band, where it reached that high of over 7%, meant that overall the cost base for many working people was accelerating far faster than their wages were. And that has meant that for our government, we've come in on a mission to say, well, the first thing you've got to do is get inflation back under control and then drive real wage growth so that we can close that gap between what was essentially a significant structural lift in the cost of living under the last government post-COVID, and make sure that people feel that they can get ahead again because real wages are growing faster than inflation. And fundamentally, it's my view that if you want working people to be better off, you need a situation where you're making this country more affordable through wage increases that outpace price increases, and through ensuring that people have the opportunity through their own efforts to get ahead. So for me, that's about people being able to access promotions, access new jobs. And again, it's why I come back to GDP growth, not because I love being a particular place in a GDP league table, but because with GDP growth comes more jobs, more real incomes, more opportunities. And I, like you, feel very sympathetic to any family that finds themselves in the position that they're working hard, but they're still finding it really difficult to get ahead.
Of course, at the moment, wage growth is lagging inflation.
Look, as I've said, we have a real significant global price shock occurring because of events in the Middle East. And
no, this was happening before.
Sorry,
Yeah.
we're drifting a bit.
Sorry, I'll go. If I had it,
Megan's got
Megan.
the last up on this.
Thank you. Just going to the supplementary estimates on this issue, I think there's one line in here that tells a very grim story, and that's the changes to the job seeker support and emergency benefit that is in there. Going back to the initial questions that Barbara asked, we've seen nearly 100,000 more people who are not in work. But what we're seeing is there's having to be 127 million, well, $0.6 million additional forecast for people on job seeker support and the emergency benefit. And one of the other increases additional to that 127 million is additional money for people needing higher average payments per person. So I think this just speaks to the suffering that is going on out there. How many of the people that are receiving job seeker and emergency benefits are also receiving hardship assistance or food
Well, clearly
grants?
that's a question for the Minister of Social Development at her estimates hearing. But I
But
find it very
isn't it-
difficult,
sorry,
if I could
Minister.
continue, Mr. Chair, I find it very difficult to reconcile the member's position as reflected in that current question with the constant calls from her and her colleagues that we should increase supplementary support to beneficiaries. So you can't have it both ways. You can't both say, you need to be increasing the rate of benefits, which you argued for when you said that they should be indexed to wages, not inflation. You need to not reduce temporary additional support payments that are available. They should be more generous. And then also say, but when we see evidence that temporary additional support to beneficiaries is being increased, we'll also critique that. So make up your mind.
I'm sorry.
Make up your mind.
I think you misunderstood, Minister.
I think
The
you may be
grimness
misunderstanding
that I am
things.
noting is the number of people that are forced into the position of relying on this. I just wanted a breakdown so we can understand the suffering that is out there of how many people who are receiving this increased expenditure that you're having to account for because of the number of people that are out of work in this country are also receiving additional support or food grants. It's not, I'm critiquing the approach, I'm wanting to understand, and with all due respect, this is your responsibility as Minister of Finance, it's in the supplementary estimate.
So there are two things there. The first is, yes, you are right. The welfare entitlements which we have in place as a government mean that while people are able to access base benefits, They are also able to, in some clearly regulated circumstances, access additional support where they have significant changes in their material position. It's also the case that the supplementary estimates reflect the costs of those payments. And I think it is appropriate, Mr. Chair, that if the member wants to ask more questions about the benefit system and its operation, the numbers underlying those figures, then that is a matter for the social development estimates.
Thank you. We're going to go to a new primary now from Tom Rutherford.
Great. The budget had a capital expenditure package of around 7 billion of new capital spending, offset by about $1.3 billion of savings for a net capital impact package of 5.7 billion. How did you decide on the amount of capital?
Well, look, what we saw in this year's budget was a real commitment by this government to continue our investment in the infrastructure pipeline. There has been discussion across the Parliament and across our business and wider community about the need for New Zealand to have a longer term approach to funding infrastructure. So on becoming government, we set about determining those long-term plans. So in education, we've set a multi-year plan for what investment's required. In health, we've done the same. Across a number of government agencies, we've required a sense of what does the pipeline look like. Then we've set, as I discussed with opposition members earlier, some clearer requirements around the circumstances in which we'll fund infrastructure. So clearer requirements for business cases, for consenting, for deliverability. When we then looked at the overall capital demands coming into this year's budget, we wanted to square up those long-term pipelines with what was deliverable, what had good business cases, and what was still achievable within our debt ceiling. And that is what ultimately determined the shape of the overall capital budget. Some people say, well, you should just invest whatever you want in capital, that it's fine to borrow for capital. There are two real constraints on that, and we've experienced them in recent times. The first is you can get into a situation if you overcommit to capital that you end up just inflating the cost of construction. There's evidence that that occurred under the last government where there were, but also you get delays in construction because actually there's not readiness to deliver that infrastructure. So there are limits there. The other very material limit is around debt. So while capital is neutral for the Obergall-X position, it's also the case that it does add to the debt profile. And so, as you know, we've set that goal of getting the debt curve bending down, and we have to make sure that our capital allocation decisions are consistent with that.
Can you just highlight some of the projects included in the capital expenditure program?
Yeah, look, very much making material progress on our health infrastructure pipeline. So you're seeing a new tower block for Whangarei Hospital, and I'd give tribute there to Dr. Shane Retty, who has argued for that for many, many years. The next stage of work to redevelop our regional provincial hospitals, Tauranga, Palmerston North, Hawke's Bay, as well as other work to continue infrastructure development for health facilities. Significant investment for education, both to enable new classrooms, the redevelopment of multiple schools across the country that are worn out and old and need redevelopment, purchasing of land in high growth areas to allow for new schools to be developed. Then significant investment in transport infrastructure. In particular, we made a decision to directly accelerate and fund roading resilience projects needed in areas that have become highly affected by weather events, where we just don't think it makes sense to keep rebuilding those roads and billing the taxpayer for that. Let's actually strengthen them now, make them more resilient to future weather events. So 400 million invested in those projects across the country, as well as putting the funding commitment to allow the very, very much delayed, much talked about extension to the Waikato Expressway to happen, the Cambridge to Piarere extension. That's one of the most unsafe stretches of state highway in the country, as the member from Tauranga will appreciate. Sorry, Bay of Plenty, but you know, the Tauranga region, I mean. That road on average has some sort of disruption or closure every 10 days, and that is ridiculous on a piece of road that is so important to the country's productivity, and also has literally meant the loss of life for New Zealanders and their families. So we're very proud that we've committed that additional funding to getting that road going. And then, of course, there's also a chunk of capital there for defence. People often highlight the kit that we're buying from offshore, and yes, that's part of the capability, but actually a significant part of this year's investments are also in the facilities that we ask our servicemen and women to live and train in. And these are men and women who literally put their lives on the line for the country, and I think they deserve to live in housing of a basic standard and to train in facilities that are basic and meet their needs. So investment there.
Two of the projects were new police stations in
Yes,
Greymouth.
sorry, I didn't mention the courthouses and the police stations and various other things, yeah.
But with police stations in Greymouth and Whanganui in
Yes.
particular, why was it necessary to upgrade those facilities in those communities?
Yeah, in line with our long-term infrastructure pipeline planning approach, we asked the New Zealand Police to go away and give us a picture of which police stations across the country need to be remediated, need to be replaced, and to have a much more logical pathway for how that's happening rather than a really ad hoc approach. They've done a really good business case on that, and very clearly the next two cabs off the rank and highest need were Greymouth and Whanganui, and therefore based on that business casing and that pipeline work, that's where we've provided additional investment. And frankly, our police deserve it, as do the people who use those police stations.
Quick something, Nancy Lou.
A very, very quick one. Minister, the big numbers, the big amounts for the capital projects are exciting, and it provides a lot of guarantee assurance for the construction community. But what does it translate to day-to-day New Zealanders in terms of certainty for jobs and commitment into growing that career?
Yeah, look, I think the first lens is always, what are the infrastructure needs that we have in order to have both the delivery of good public services and the enablement of a good productive economy. And that's number one. So for me, actually having adequate hospital facilities is pretty core to the delivery of health services, adequate places for our kids to learn and those things. And then the secondary layer on that is actually when we're building that infrastructure and developing that infrastructure, as you say, that provides jobs, incomes, contract opportunities for New Zealand firms and New Zealand households. And so I think for your average Kiwi, what they will see in many, many communities across the country is they will see people in hard hats and high vis with spades in their hands and jobs, building infrastructure for the future. Infrastructure for the future that will improve public service delivery in the future, will strengthen our economy for the future, but is providing real jobs right now. And I had this highlighted to me by someone the other day who lives in the hut, actually, and they were saying, yeah, I really can feel that happening because, of course, they drive past the Melling development regularly. And that's, of course, about flood protection, but also about a better roading network. And when you can see that investment happening in your community, I think it's heartening. The opening of the shared path here in Wellington, again, people can see things are getting better on an infrastructure basis, but there's a long list of needs, so we need to make sure that when we make those investments, we're really careful about how we prioritise them, how we sequence them.
Fantastic, thank you. We'll go to a new primary now from Dr. Deborah Russell.
Oh, thank you.
Mr. Chair, it's 11:04.
It's a shorty.
Sorry?
It's a short one.
We're
We've got 11:15.
11:15.
Oh, 11:15.
So
Okay.
last-
No, it's a long
last-
session, isn't it?
Last 10 minutes.
So it's a really interesting one. There's a capital injection to the Natural Hazards Commission for business case development, which I'm just really interested in. So it's for a.
Thank you for this question. I'm very interested in this too. Delighted.
This is so it's a business case for a public infrastructure risk management scheme for the Crown.
Yeah.
So I'm interested in the thinking on this because it's something that needs to concern us all on an ongoing basis. So the Natural Hazards Commission, Takatuaki, at the moment, it's really for individuals. So it covers that insurance gap for individuals and gets the insurance going. So putting this, I know it's only a business case, but I'm just interested in the thinking around the public infrastructure sitting in there, and also whether you think that might extend, obviously, government infrastructure, but what about local government infrastructure and things like that? So I'm just interested, Minister, I'd love to hear about it.
Yeah, great question. So essentially, the Crown owns a huge amount of assets that are insurable assets, whether that's your roads, your railways, your hospital buildings, your schools. And what we have at the moment is an absolute spaghetti when it comes to how we approach insuring and managing those risks. So in some cases, it will be appropriate for a government agency to say, well, we just put our own money to one side to ensure that we could replace those assets if there was an extreme weather event, an earthquake or something. In other cases, they buy an insurance policy. The level of that insurance varies markedly from one agency to another. The tally also is that we have around 100 different insurance policies across government, which I think shows you that we've got really quite a haphazard approach. And so what we see in other jurisdictions, particularly in Australia, but elsewhere, is that they pool all of that risk financing together into one place to have more of a uniform risk appetite for the Crown, to have a more centralised view of overall assets and risk, and therefore to take an insurance approach accordingly, either through buying external insurance products or having their own internal insurance pool. And so what that business case that we've funded NHC to do is saying to them, okay, go away and have a look at the current arrangements, have a look at how others do it around the world, and come back to us with a business case as to whether or not it is worthy of changing our approach, that we would get net benefit to the taxpayer out of doing that, and give us some views on what that would look like. To the second part of your question, in time, could you expand that to also include local government assets? Yes, you could, but we'll do the first bit first.
Great. I'm really interested, let's see the business case, but I guess I won't at this stage, but so I'm really pleased to see this sort of thinking going on. I guess there's another set of stuff that's going to sit in around there around some of the emergency stuff we do. So I think the stat is that we spend a hell of a lot on recovery from emergencies, but not a lot on actually adapting to it in advance. Is that some work that's going to sit in that space too, or is that going to happen also?
Yeah, look, absolutely, you're right. So the approach, again, of different agencies to that question varies significantly. So, one of the anomalies that gets pointed out to me is that KiwiRail fully insure all of their rail so that they replace it no matter where it is or how used it is, whereas NZTA take a more circumspect approach to how they insure their road. But also you see variability in that approach around emergency works versus taking steps in advance to protect assets from requiring emergency works. And all things being equal, if you have a really good asset register, you have a really good assessment of risk, i.e. how likely are these assets to be impacted by seismic events, weather events, other events. Therefore, what is the benefit to risk ratio of investing now versus paying for an insurance product that invests later? You should be able to make much more logical and rational decisions.
Yeah.
But my thesis has been, because we have such a disparate approach from one agency to another and not a clear risk appetite overall, not even a clear view of the data that should inform these decisions, that we haven't been as able to prioritise those investments as I would like us to be. So having a centralised risk management approach, which the NHC business case is looking at, would allow us to make much clearer whole of government decisions about when we invest preemptively versus when we invest after the fact.
Yeah, it's interesting because obviously it's not going to be one size fits all, because thinking of the case of KiwiRail versus NZTA.
Absolutely, it's not going to be the same, but at least you can have a similar risk appetite.
I mean, a break in the rail network can shut the whole thing down.
Exactly.
A road network you can usually.
Yeah, no, that shouldn't have been taken as a critique of the approach. It's just pointing out there are different approaches.
Yeah. Okay, thank you. That's really interesting.
Quick one from Chloe.
For our country, economy and democracy, Minister, do you believe that extreme inequality is a bad thing?
Yes.
So based on your response to my questioning in December 2024, you said that you believe that your job is to have a significant role in reducing inequality. How exactly have you done that?
The number one thing we've done is improve the performance of our education system. The number one thing any government can do to liberate a child from their family circumstances, which they inherit and have no choice over, is to ensure that when they're at school between the hours of 9 and 3, that they are getting a decent education. We cannot control what every parent does in every home. We cannot control what spending choices parents make. We cannot control what parenting choices they make. But what we can do is ensure that no matter what home you were born in, when you turn out at a school in New Zealand, you get a decent go at getting literacy skills, numeracy skills that are needed for you to contribute to our community, for you to get a job and for you to enter further training. And frankly, in recent years, we've done far too poor a job of that. Too many kids, particularly the kids from the poorest homes, have been left behind by our education system. And I think the number one thing that our government can do to address that is ensuring that we are giving every kid an hour a day of reading, writing and maths, that they are getting access to the structured literacy and numeracy approaches that work, that the teachers that are teaching them are getting the professional development that allows them to take those approaches, and that we are measuring ourselves against whether kids are learning more. And so I think Erica Stanford's education reforms and the success that they are having is one of the biggest things we can do for long-term equality in this country.
Respectfully, Minister, we have the most people unemployed since I was born, and they are staying unemployed for longer. We also have 50,000 more children living in material hardship than 3 years ago. And we also have decisions under your last budget for 129,000 households in social housing to be approximately $24 per week worse off. Do you not accept what all of the international and domestic research shows, that per your point on education being the pathway out of poverty, that it's actually incredibly difficult for children to learn when they are in impoverished circumstances, which is exactly what your budgetary decisions have created?
I believe children, when given the ability to be educated well, have the potential to go well beyond the circumstances into which they are born. And there are examples of that from all over this country, and all over the world. Kids born to the most difficult circumstances that are educated well, and actually often also have a mum or a dad or a caregiver that says that they are capable of anything and supports them to be capable of anything, who overcome their circumstances. And that optimism about the ability of people to shape their own individual lives lies at the heart of my politics. And I believe that the state has a very real role in ensuring that kids can access a good education. If they can't, we are trapping them in the circumstances to which they are born forever. So yeah, I stand by my view. Education really matters, and I have no time for the bigotry of low expectations that persists on the left, that says, well, if you're from a low income home, well, it's just too hard for you. My view is that if we educate kids well, so many young New Zealanders are capable of overcoming the circumstances which they are born into.
Respectfully, my point was you've made those material circumstances.
Well, you've made your point and I've made mine.
So Minister, when was the last time you went to a food bank?
I'm very happy to check my ministerial diary.
When was the last time you went to the State House and sat down with a family and spoke to them about their issues?
Mr. Chair, I think we've now entered the stunt part of the hearing.
Actually, I have one last question, Minister, if I may. I reserve the right to the last question. Aside from getting into surplus a year earlier than August, what key things from budget 26 can New Zealanders take solace in?
Good reading.
Well, I think the fact that having been hit by a number of curveballs, from tariffs through to a crisis in the Middle East, we are still seeing this economy bouncing back strongly because the foundations are in order, that we can expect accelerating growth, inflation coming back in band, that we can expect 220,000 jobs to be created, and that all of that can be achieved while we're also seeing big steps forward in our public infrastructure and public service delivery, and that we can see all of that happen without the addition of a wealth tax, a capital gains tax, or higher taxes on working people. We are making progress as a country, and the worst thing we could do is put that all at risk by taking a huge diversion to a government that would wish to torpedo the surplus, rebuild the debt mountain, and slather you in more taxes.
Thank you for your time, Minister.
Thank you, Minister.
Thank you.
Members, we're going to have a short break until 11:30.
We'd assumed a GDP of about 0.4. I think our latest estimate is about 0.8, which is, if anything, slightly below where a number of the market economists are at. Sorry, for the March quarter. We've also had some fiscal information out for the month of April, which is slightly ahead of our budget forecasts. And obviously the most significant factor is the trend of oil prices in recent weeks, whereas at least as of this morning, the futures curve is anything below what we're assuming in the budget. So as I said in the session with the Minister, we're broadly comfortable still with the trajectory of our forecasts. As I said, we still see very significant risks. The Middle East is not a more stable place than it was a few months ago. We have to see how the peace deal plays out, and we have to see how long it takes for infrastructure in the Gulf to return, supply chains to adjust, and all of those things. So, we are certainly not complacent about the risks around our forecasts. The point I would make in terms of the fiscals, broadly, the story is one that we've talked to the committee about before, that we have a pretty large deficit at the moment. If you look in international terms, it's, as I think Standard & Poor's said in their budget commentary, the only AAA rated country at the moment has a bigger deficit than New Zealand is the United States. Obviously, the current government has a track towards that deficit closing over the forecast period, and the underlying dynamics of that are still in place. One of the things that I've been keen since I've come back into the role is to give anyone who looks at our forecast more information around the risks around any set of forecasts, because there are always lots of risks. And in the last set of forecasts, we updated the quantification of specific fiscal risks. In this update, we've introduced a new sort of statistical and quantification of the risks around our forecasts over the projection period, which I think is really helpful. So we look at the errors in our forecasts over the last 20 years, and if you put them through a normal distribution, what does that imply about the potential range of outcomes over the next 3 or 4 years? So, while we have a surplus in our track over the forecast period, probability is we've got about a 50-60% chance of achieving that on the basis of previous errors. Similarly, there are risks both upside and downside quite significantly around our debt track. So I think the point I'm making is that when you look out 3-4 years, particularly in the context of the shock-prone world that we're increasingly seeing as our base case, whoever is making fiscal decisions is going to have to think about those decisions in the context of an outlook that could change quite materially in coming years. And then finally, as we've talked about in the session with the Minister, I think we've enhanced our disclosures around potential costs of NDC around offshore purchasing with the note that we released recently. So I see that as part of Treasury's job in terms of our, being politically impartial, but giving parties around the table information on which they can give, inform the debate. So I might just leave it there, Mr. Chairman, and open to the committee's questions.
Thank you.
Thank you. And thank you as well for that note on the NDC potential liability crystallising. I know that we'll probably debate about the terminology, but thank you for that work. I just wanted to ask about the LNG facility services. So what kind of assumptions did you make as Treasury in your fiscals with regard to the LNG import facility, noting the budget line that's associated?
Okay. So our forecasts. The forecasts basically include an expense for the facility and a corresponding revenue. So the assumption is that the expense will be recovered through revenue. And basically it's both of those matchups. So overall, it's I suppose fiscally neutral to the operating balance.
Okay. I mean, obviously, we now have, subsequent to earlier this month, Minister Brown stating that it will no longer be funded through a levy, which now leaves it really unclear as to how cost recovery will work. And there seems to be quite a substantive risk that these costs will then be borne by the Crown. How is this possibly being budgeted for? Is this effectively what you were trying to allude to in your fiscal risk piece?
Yeah, and I think that's, what we've included in our forecast has been accompanied with a specific fiscal risk. So again, as the scheme is designed and decisions around the scheme, there could be potential impacts which will differ to what we've factored into our forecast.
So the government intends to sign the contracts for this LNG import facility, but there's no provision for contingency for it in this budget. How can the government press ahead with signing contracts in that case?
Well, I suppose that's a choice for the government around, if there is a fiscal cost that does pan out, there's choices around how that is managed. So, there's choices around funding from the budget, the budget 27 allowance. There's a budget, between budget contingency. So there's kind of choices there to provide funding if the situation occurs where there is a fiscal cost from the facility.
That's correct. I mean, I've got to come back to certainly the government's current intention, though, is that is not going to be, funded from the budget.
Okay. Has there been, therefore, absolutely no indication, no request for advice on the potential reallocation of the $1 billion for the fossil fuel kind of response contingencies for that to be reallocated into the LNG import facility?
No, we've not given any advice on that. No.
Has there been any other instance that you can think of, particularly Ian, in your time in this role, where there has been a government move ahead with contracting a huge piece of infrastructure to the tune of, $1 billion+ without any idea of how it's going to pay for it?
Well, I think way and has a series of milestones there where it will confirm, the funding options, around the time of procurement. So it's not the intention of the government to proceed with this without strapping down how it will be funded.
Okay, I hope that we see that materialise. So we've had 2 significant LNG price spikes in the last 5 years. Has Treasury modelled the economic consequences for our country if we inevitably get more future disruptions that spike our electricity and gas prices under this LNG import facility scenario?
I don't believe that we have. We can confirm that in writing, but I don't believe that we've done modelling around recent modelling around the LNG, and I'm not sure whether MB has. That would be a good question to give.
But you could confirm that relying on imported energy makes maintaining price stability harder?
No, I wouldn't go that far.
Okay. Has the government, are you aware of, or have you been asked to provide any modelling on the government providing any form of financial guarantees, indemnities or similar for the LNG terminal operator? For example, I'm talking about harm to community and port workers, safety or environmental damage that results from the government's decision to legislate over the normal consenting processes.
We haven't been. It's important to remember that MB is the lead agency around the procurement. So some of those issues I would pick up with them, but certainly Treasury hasn't provided advice.
You haven't been asked to run over the figures from MB on any of these issues?
Well, I mean, we are obviously working with MB in terms of the financial implications, but in terms of the detailed issues that you're raising, Chloe, I don't believe that we've been asked for particular advice.
Interesting. Thanks. We've got a supplementary from Megan Woods.
Thank you. So Concept Consulting has some analysis out that shows if the LNG terminal goes ahead, eventually gas consumption will be supplied predominantly from overseas gas rather than New Zealand fields, because it will extend the use case around the infrastructure. And they're saying that will have an adverse effect on New Zealand's balance of payments, increasing it by around 4% of 2025's deficit, relative to the option where consumers transition to renewable electricity and biomass, which makes sense. You're paying other countries for molecules rather than producing electrons here in New Zealand and creating jobs. Has MB asked for any input from you around the balance of payments impacts of progressing with the LNG terminal?
I have not. I don't believe that's the case. We're happy to confirm that in writing, but I don't think that's the case.
Right, we've got a new primary from Barbara Edmonds.
Okay, just looking at the statement of actual contingent liabilities and assets on page 91. There's a note around intersegment eliminations and it refers to uncalled capital, the Ferry Holdings Limited, is that right? Just checking.
Yep. Yeah.
Yeah, can you just take me through what that what the uncalled capital is for in relation to Ferry Holdings? Is it the actual ships themselves, or is it the corresponding infrastructure? Can you provide a breakdown of that, please? If not,
Well, in
I can
terms,
put
in
it
terms of the
writing.
breakdown, we can do that in
In
writing.
I think, like the uncalled capital is basically the amount of shares that could be called from Ferry Holdings. So,
Do you want to come forward? Sorry, just in case someone needs to pick it up.
Yeah.
So, sorry, the amount disclosed in that statement basically reflects to the uncalled shares that Ferry Holdings are able to call, and the Crown provide capital to that. It doesn't reflect the amount which is relating to the ships versus the infrastructure around it. So it's not directly related to that.
Okay, it's just uncalled.
So
shares.
yeah, so it's basically the amount the Crown has, I suppose, committed to provide to Ferry Holdings.
Because it's quite a big figure.
Yes.
It's a significant change.
Yeah.
Yeah. Why so big? I mean,
Well,
it's such a significant shift from 39, -39 to 1.1 billion.
And that's basically related to the timing of when the announcements around the procurement happened. So which we can come back to you with the timing, but I think it was around November where the announcements were made last year.
Thank you.
Supplementary, Chloe?
No, that's it for that
Okay,
one, but I've got more primaries, please.
Thank you. Dr. David Wilson.
Yeah, look, thank you, Ian, for outlining the way that you're looking at risks, projected risks, and looking them through a ranged upside and downside. That's really good to hear. My first question is, do you foresee, given that new way of looking at forecasts, continued volatility? Because you looked back 20 years, correct? And it's not like we haven't had volatility in the last 20 years. Is it more of the same, or is it increased?
Oh, I think our view is that the likelihood is we will see increased volatility, and that comes from a number of sources. What's happened in the Gulf is just one example of the geopolitical volatility that we will live with, and unfortunately, we don't see that changing anytime soon.
So,
there are then other kinds of shocks that can induce volatility. Some of those are enduring. New Zealand, unlike many countries, has the risk of a significant biosecurity shock. We have more risk around seismicity than certainly most developed countries. We have risks around the increased, incidence of various climatic-related risks. Now, some of those might be more locally based, but some of them could be more national. We've talked a little bit, I think, and when the Minister was here, about we certainly see, given the state of equity markets internationally, the risks of financial shocks, and we do see countries are more interconnected. International bond markets are interconnected, so the likelihood of what happens overseas transmitting itself to the New Zealand economy in some way, I think, is it's as high as it's ever been, if not higher.
So supplementary, it's that you would see that solid position in net core Crown debt improving will give us that headroom.
Look, it's one of the. Look, I think it's one of the. I mean, I think one of the lenses that you're increasingly seeing through Treasury advice to the government is the concept of resilience. So we can't wish away these sources of volatility. What we can do is think about how does the New Zealand economy best positioned. Some of this is what I call macro resilience. So it's those settings around monetary and fiscal policy. Some of it will be more what you might call micro resilience, a bit about how do particular markets and economy, are they set up so that they are more resilient to various kinds of of shocks. And I think, you know, the fuel crisis that we've just been through is a sort of an image of that.
So we're forecasting trade surplus or current account surplus 2028, if I remember rightly.
Not a current account surplus. We I
Okay,
think we
just
have
trade.
deficits right through.
That's right. Yeah, you're correct. But that is actually a key part for us, isn't it? Understanding that kind of trade surplus resilience in that picture.
That's right, and that's where the fiscal story is also important. So one of the reasons why we have a current account deficit is it reflects the underlying savings and investment balances in the economy, and the fact that government went from being consistent saver into the economy versus being a consistent dissaver in the economy is one of the reasons why that current account remains in deficit. And that is certainly an issue that rating agencies, for example, you know, look at when they're making their judgment about, you know, our rating.
Thank you.
Dr. Deborah Russell.
Oh, thank you. I want to ask some stuff around the reporting around climate. This is always the best session of the year, actually, when we get to have this sort of discussion about the budget without.
Hell yeah.
I really enjoy it.
Recognise some bad sessions.
Tells you a lot about the state of our democracy.
Yeah, it does. So I'm just looking at the BFU and on page 80, you've got this discussion of the accounting treatment of New Zealand's NDCs. It's kind of interesting because last year, so this discussion, a very similar note, was in the financials for the year to June 25. And last year, the discussion of the budget was why we're not recognising this liability yet. So quite a discussion about the levels of which you might recognise risk. But sitting in last year's BFU is just a minor note about, well, it's not minor, it's a note about a risk, but there's nothing like this discussion sitting in last year's BFU, and it's not sitting in, I had to really track it down to see where it was reported. So this is kind of a little bit novel, pulling this statement of this accounting policy through into this year's BFU. And to me, I guess I'm looking for the thinking behind that as to why you're pulling it into this kind of prominence when, you know, in terms of the actual risk, you've got virtually the same statement in the statement of non-specified risks or something like that sitting up the front. So what's the thinking there about pulling this particular?
Well, I think there's a couple of things, Deborah. If I go back to where I started, is more generally we're seeking to lift the overall quality of, if you like, risk analysis in our documents. So that's actually probably the biggest part of the story. So if you think from that, what are the risks that you would put some attention to? And this is clearly one of them. There clearly are a group of pretty serious individuals, groups out there who have some quite strong views
McGuinness Institute
around, and so I respect those. We respectfully disagree with perhaps the solution, but I think fundamentally we want to be clear about why we think the way we do. And I link that to, it's not in the BFU, but it's in the technical notes that we put around, but NDC is actually, the key point here is around, I think, is not so much the liability issue or not, it's how do we provide all people who are interested in this issue with information that can inform the public debate. And we've done that through the mechanism of the technical note that we released last week.
Yeah.
So I think that's the thinking, as opposed to anything has substantively changed in the way we're thinking about this.
Thinking the technical note, that was the supplementary information. This one, the budget?
No, this is the note that went out on the Treasury website.
Right.
Last week.
Yeah. $5 billion potential.
Oh, that one.
Yeah.
That one.
That note. I know about that. I guess the other thing that I'm finding interesting in this space, and you were here for the discussion we had with the Minister of Finance about whether we meet our NDCs by offshore purchases or whether we do it by onshore action. And our analysis has been that a lot of the onshore action isn't happening. So it's a little bit hard to quantify what's going on here. So they're neither promising to buy offshore, nor are they actually undertaking action to reduce our climate emissions. So that kind of liability is building up as well. You know, and I'm wondering how you might start reflecting that or how you might start thinking about that or start reflecting that in your budget documents and accounting documents.
Well, clearly, I mean, I think, given where we're at the moment, and we're talking a bit about a period that, finishes in 2030, so there's still some way away. We have another parliament to essentially, go through. There will be a series of both, what we stress in the technical note we put out last week is, look, there's still high levels of uncertainty, both in terms of, what will be achieved in terms of domestic mitigation, the issues about costs of any offshore purchasing, the institutional arrangements around that. So there's a lot that we don't know at the moment. And I think over the next few years, you'll begin to see more clarity around that based on both whoever in government and the decisions that they make and what happens in the international community. So I'm pretty sure as we move through the next parliament, you will see an evolution of how those issues are reflected through the suite of documentation that we provide at budget.
So just another couple of questions following along in this climate space. One is, I guess, at the beginning of this parliament, we heard a lot of, well, I'll avoid the use of rhetoric, I'll use the word discussion about fiscal cliffs. So this was time-limited funding, which funding was there on a time-limited basis, and it was claimed that the current government had been left with a real fiscal liability. So, I mean, obviously we don't agree with that analysis because we felt as though we had signalled those things. But equally, by not grappling with this 5 billion or so now, is the current government leaving quite an issue to the next government coming in, which may be them or it may be us, and we're quite worried.
Yeah, well, part of it is, if you think about at least what our note prompted last week is we are having that conversation, right? And different parties have clearly different views, and we'll see how that, plays out. But I think our role at the moment is obviously we faithfully, as we would with any government, reflect their intentions. We have a wider stewardship role around looking at the sorts of risks that any New Zealand government might face. And we have done that in this case because we think it is an issue that whoever is in government after the election will have to grapple with in some form.
Yeah. Okay, I'm shifting to adaptation policy. So it's climate related. So it's this is in last year's BFU on page 77. We had a note about adaptation policy changes because the government had signalled its intent to develop a climate adaptation framework, which could create funding decisions, so on. I hunted, but I couldn't find a similar note in this year's BFU, but that might just be because I didn't search hard enough or Google well enough. Does anyone know where it is? Stuart, have you got? Sorry, it's
Look, let's come back to you on that one.
Yeah.
I don't know the answer, but that will be connected to the way we've tried to streamline the fiscal risks.
Right.
And so.
Yeah. So the unchanged risks weren't in this year's BFU, and I couldn't actually.
They're in the supplementary information.
And I couldn't find this particular one in the supplementary information, but I might have missed it. I did try, but I might have missed it.
Okay. Well, we can anyway. We can pick that up in a
Thank you.
question, Deborah.
We've got a supplementary from Chloe and then Todd on the same.
Yeah, it was just to explore, if I may, Mr. Chair, potentially a few subs, but it is very much like inquisitorial on this point of the NDC. We've had much back and forth on this over the years. And again, thank you very much for the present last week. So I just wanted to confirm the basic calculus, which is that if we are to take it, and I understand that this is where there is some technical nuance with regard to Treasury's unwillingness to recognise this as a constructive liability on the books. But if we are to say, look, government is absolutely committed to making this happen to the effect that it then can materialise effectively as a constructive liability, or however you would want to represent it, the basic calculus, therefore, would become that every reduction in domestic climate action, so increase in our domestic climate changing emissions, would therefore result in an increase in us needing to buy offshore mitigation. that logic still holds? Because it obviously was also underlying your analysis in 2022 with MFE. Yes.
So just, I
Basically,
missed the
just making
front
the
part of
so
your question.
Our nationally determined contribution
Yeah.
in the Paris Agreement requires us to meet a national determined contribution. That's our budget effectively. And we can do that either domestically or internationally. So if it goes down domestically, therefore our obligation goes up internationally if we are to take for granted that the commitment holds.
Yeah, I think it's not quite as straightforward of that, and some of that gets to some of the issues that the minister was talking about at the end of NDC 1, what the agreed arrangements will be across countries within the context of Paris, and that's still a little unclear.
I mean, it feels as though what's being implied there is the potential that other countries, a la what we're already seeing explicitly with the likes of the United States and, you know, other far-right political party leaders across particularly Europe, indicating that they want to see their respective countries pull out of the Paris Agreement. If I'm to read between the lines, are you effectively talking about that, or can you be more explicit?
I think, you know, and certainly, you know, our understanding is what the minister said. You know, this government has, you know, no intentions of moving out of Paris. I think the issue is one about how countries, given that there will be the likelihood a number of advanced economies who will not meet their NDC 1.
How do they coordinate themselves?
How that will play out internationally.
Mhm.
And there are a range of scenarios there. And I think, you know, there is still a lot of uncertainty. And so coming back to the question that you raise, I think that's why at the moment it is it's a little too mechanical to say, well, you do more or less on domestic mitigation and that will flow through, you know, ergo into automatically more or less in terms of offshore purchasing.
Because of the fact on your analysis, the context is capable of changing by virtue of other countries not potentially meeting their obligations and therefore this international agreement falling apart.
Yep. Well, I wouldn't say, well, obviously the falling apart is, you know, there's a scenario there that's not the one I'm focusing on. It's more within the context of Paris among those countries that continue to be part of Paris, how they will, you know, agree to manage it.
And obviously the rationale that you've given in the past as to why you don't consider this to be crystallising as a constructive liability is that the current government doesn't have a plan to effectively meet that, is not budgeting for it. So the minister consistently and the prime minister consistently saying this is a commitment doesn't constitute enough of a commitment for Treasury to need to see it represented as a constructive liability. So what, I know we've again gone back and forth on this, but you know, you've gone away and you've done a huge amount of work in the year. What criteria would enable this to then be construed as a constructive liability? So I guess the point that I'm getting at is I just want us to have sensible economic planning because I don't understand how we can be saying across parties that we have a commitment that we're not budgeting nor planning for, that we risk crystallising in 2030 potentially to the tune of billions of dollars.
So I think, I mean, you want to talk a bit about the various kind of tests that we would be looking at to treat this as a liability. You want to talk about that, Jake?
So I guess under accounting standards, there are tests that need to be met to recognise an expense or a forecast expense in the accounts. At the moment, we review that every time we produce a product and see if those thresholds have been met or not. At the moment, we're saying they still have not been met. With any policy announcement or any statements that the government says, we will relook at that each time we produce one of our documents.
So for sake of argument, what would need to change from a Minister of Finance, a Prime Minister, every minister of this government saying that they're committed to meeting the NDCs, albeit some grudgingly, I'm sure, but saying that we're going to meet it, what has to change? Is it, because in the past you've told me that it's to do with them actually budgeting for it, but therein kind of lies the irony of the thing, right? That they have to budget for it in order for us to then be able to say that that is a liability, whereas right now they're not budgeting for it, so it's not a constructive liability.
So I think there's I can't give you it's exactly this thing or this thing. There will be a number of circumstances and statements made by any government, which we will look at in terms of, does that tip you further along we're actually obligating ourselves to do a specific thing, which would make us review
Yeah, so,
what is
so,
in the
so if we talk a
accounts.
hypothetical where Minister Swarbrick said,
Thank you so much.
New Zealand is committing to, these are our plans for, you know, offshore mitigation. If we don't do the domestic side and we're going to do it through these kinds of mechanisms, right, it's really concrete, it's very unequivocal, it's getting below that sort of very general statement. Those would be the sorts that we would be looking at.
Yeah, but
And I think the other point I want to come back to is, you know, at the end of the day, the party who is actually most important here in terms of liability is not us, it's the Auditor General, right? Now, obviously, we work closely with them, but, you know, it's not only going to be, if the treatment changes in our accounts, it's not just going to be because we change, it will need to be because the Auditor General changes.
I mean, we could bicker ad nauseum about technical accounting standards and externalities, but
Absolutely, which is part of why, I mean, I suppose, you know, why I've tried to reframe this a little bit about because actually the information that is in the public domain around these issues, because I don't think, you know, necessarily having it as a liability, I suppose I'm less convinced it's going to change, you know, behaviour.
Yeah.
What I think is more is the general information around it.
I guess just as my final point on this, if I may, just to be really, really clear, there is a potential per the work that you have obviously done, regardless of whatever the government of the day does, there is, and I hear you in terms of the ambiguity of all of the different variables and what other jurisdictions do, but there is a potential that this liability or whatever we want to call it crystallizes in 2030 to the tune of us having to pay potentially billions of dollars for offshore mitigation. There is a potential that that occurs.
There is a potential. Yeah.
Thank you.
Thank you. And you'll have the opportunity with Minister Watts at 1:30, I'm sure, to take us.
It doesn't really answer those questions.
All right.
Well, not
revenue.
Not in revenue.
I will be asking about the ETS though.
Did you mean constructive liability or
Constructive
contingent?
liabilities.
Constructive
Constructive
obligations.
liabilities.
It's a new term for me. Thank you.
I've got hearing.
I will just, I mean, just to
further-
kind of close this up, because, and just so we're clear, there is no constructive liability around the NDC today. Auditor General agrees with your analysis. That's great. And then I just want to, and again, I don't want to, obviously Dr. Deborah Russell raised some other issues around, and we'll just use the term fiscal cliff, and I understand, but that was quite different because those were actual programs that were in the budget and budgeted for, and so quite a different situation to what we're discussing here.
Yeah, I mean, I think if I could keep going back to, without getting to the political debate, look, there's a whole range of uncertainties that government's going to be dealing with. Now, you know, some of them are in the time-limited funding category. I think one of the things that I have been reasonably consistent with this committee is saying, you know, that the next term of government, there will be some really big decisions taken by whoever is in government that will shape the trajectory around, fiscal path in the 2030s. So the issue we've been talking about with Chloe is one. The renewal of the maritime fleet in the context of DCP is going to be one of the biggest decisions that the New Zealand government takes in the next decade in terms of a fiscal sense. It's really big. There are big issues that we highlight in fiscal risks about the funding of the National Land Transport Fund, where we've gone from essentially a fully funded fund, you know, pre-COVID, to a fund that's now only half funded by Fed and RUC. You know, those are really big, and then obviously we've got the bigger demographic issues like, you know, health, super, etc. You know, the fiscal challenges that any New Zealand government's going to face over the next, you know, 3 to 5 years, and decisions that they take will very much determine what that trajectory looks like as we go into the 2030s. No pressure.
Thank you. And I'll go to now a new primary with Dan Goodwell.
Thanks, Mr. Chair. Thanks, Ian, to you and the team. Just turning to my favourite table in the BFU, which is the Economic Forecast Table 1.2, not necessarily the time series that the Minister likes, but I know there's a lot of assumptions in here, so, you know, range of commentators with different views on some of those assumptions, but I'm just trying to reconcile inflation forecasts for table 1.2.
Yep.
To the inflation forecast in table 4.2, page 81. The CPI, they're different, and I'm just keen to understand why they're different, because I guess I'm really keen to see what is the CPI that you're using to forecast expenses and revenue increases for this coming year and the next few years. I did notice there were difference. I was just keen to see why they're different, if I missed something. And then more importantly, what's the correct CPI that we're using to forecast expenses and revenue?
So they're both based on the same CPI forecast. They expressed the rates of growth of inflation in different ways. So in the table 1.2, it is the way which we typically see the CPI released by Stats New Zealand. That's saying how much higher is a price level in a particular quarter than the same quarter a year ago.
Yeah.
On the latter table, it is an average of prices over that year versus the previous year. So it's just a different way of calculating the growth rate. So yeah, but the same price levels and price numbers underpin both calculations.
But one's an annual percentage, is an average. So they're different ways which you can measure it.
Okay.
One's a sort of point, like 1 point compared to a year ago, and the other is averaging the year versus the previous year.
One's June to June.
Yep.
One's June quarter to June
previous
quarter.
Yeah.
The other, that's the first table.
Yep.
That's
One-
table
that's
1.2.
2, yes.
Yep.
The second table is the average over that June year versus the previous June year.
And so when we're forecasting expenses and revenue for, are we using the average of the
Yes.
year or the?
Yeah,
Okay,
so that's
we are-
that's more relevant when we move to the June year formulation of expenses and revenue.
Okay, no, that's helpful. Thank you. Are you, Peter, are you? No.
Yes, Peter Morse.
Peter, yeah, thank you, Peter. The other thing is just, Minister mentioned around oil prices, and we're looking at that at the moment. So just clarifying for you, central forecast for this coming year, what's track of oil prices? I guess many of us want to know if oil prices are where they are now. Is that good for the government books? You know, are we on track for the central forecast? You know, I guess we're not seeing any real movement in the Strait of Hormuz. It's all just, you know, I guess speculative price declines. If there are still no real movement in the Strait, but the prices are still low, I mean, what's that going to mean for?
Well, I think Peter can comment in a second bit about where we're at in terms of current prices versus to what we've got in beef food. But I think if they what you'll see increasingly in markets is markets will tend to, like they always do, look ahead. So they'll be looking ahead about on the assumption that the Strait does indeed open, you know, production gets underway. That will actually be factored into price. At the same point, we know that there is going to be a time where, you know, traffic through the Strait will continue to be reduced compared to pre-war levels. We know we're in an environment where stocks globally are being run down significantly, and at some point there are limits to how much that can occur. That's why I think you'll continue to see, you know, we're not complacent that prices will naturally kind of follow down neatly. I think you'll see at times those competing pressures reflecting through in both ups and downs in oil prices, even if the trajectory, you know, broadly follows what you're seeing in the oil futures market. Peter, do you want to, in terms of current?
Yeah, obviously oil markets have moved a lot over the last few days. At the time of the BFU, we did note that oil prices were above our assumptions that we'd made when we finalised the forecasts. But things have changed quite dramatically, and so oil prices are now currently, and the futures are currently trading below what we've assumed in the budget update by several dollars at various points. There is the risk, you know, we need to see that be realised in terms of actual prices paid in the future and then flow through to pump prices. But yeah, at the moment, that risk has shifted quite considerably, I guess, over the last few days and with the positive developments.
And just to clarify, so what's the average rate of oil price that we've assumed in the central forecast?
Well, they varied. Obviously, we had them peaking and then falling over time. So they peaked at $138 during the month of April and fell progressively over. We had them falling back to about $74 over time. By the end of the year, being sort of around that $82 mark. Right now, people are predicting sort of prices closer to sort of 70, 77, 76, 75 at the end of the year. So a few dollars below what we'd assume.
Okay, thank you, Peter.
Dr. Megan Woods.
No, I'm actually going to hand one over to Barb.
Right, thank you. Just want to ask a number of questions around pay equity. Since the proactive release that was done in July last year, 2025, have there been any revisions to the advice that's been redacted? If not, can you provide any updates, whether it's written or otherwise?
So we've we keep the discussion and constantly under review about what's in the public interest and what isn't to disclose. But where we've landed, even just as of yesterday, is that it's still appropriate to withhold the Crown, the contingency that has been put aside for Crown-funded pay equity on the grounds of preserving the government's negotiating position. And that's consistent with what we've done for the last number of years across governments in terms of pay negotiations, is making sure that those figures are accounted for in the books, but not in a way that the counterparty to negotiations, i.e. the people bringing the claim, can understand where the government's at in terms of how much money it has available.
Have you had any new claims? No early pre-initiative discussions with any of the pay equity sectors?
Not that I'm aware of, but to the extent that they're Crown funded, they would be, that's a question more for the Public Service Commission than us, but not that's come to our radar.
So you're still withholding the information because it's the way it's previously treated, but you've had no new claims?
Yes, that's correct.
So how many, so going through then again through the contingency, the decision last year, I understood, was to get rid of the funded sector
yes.
pay equity.
Yes.
Subsume it into the public sector pay equity
No. So as I understand it was, there are two parts. So for the Crown as employer,
Yep.
there continues to be a contingency
Yep.
that is reflected in the forecasts. So within the BFU forecasts, for the Crown as employer, that's in our forecasts.
But the
As
specific
part of
number
the
is
allowance?
withheld.
So the specific, sorry?
As part of the budget allowance?
No. It's in the forecasts. It's built into the forecast, but it's not part of the 2.4 or whatever. With respect to essentially non-government employers who were significantly or are significantly funded by the Crown, so ECE, care and support, etc. A decision was taken by the government last year to essentially consider any Crown funding with respect to those settlements to be addressed on a case-by-case basis as part of budget allowances. So to give you an example,
I get that.
is that clear? So that's the distinction. So Crown as employer still in the forecast, and it need to be clear. It's Crown as employer using the current legislative frame as opposed to the pre-2025 frame. But that's in the forecast. It's not in budget allowances, but essentially there's no claims as part of the budget allowance. Okay.
So let's step through that. The budget allowance this year was 2.1, and I think in the next forecast period it's 2.1 or 2.4.
Yeah,
We were both confused over that one. It's a case-by-case basis. There is no tag contingency, and it's basically because they haven't applied, there is actually nothing to support any future government, whether it's this government or when we come in November. No support, no contingency whatsoever for that funded sector pay equity claims.
Yeah, for the funded sector, yes, that's correct.
That's correct.
At all.
No,
that's correct.
Wow, so we'll add that to another fiscal risk.
All right, so we've got a new primary from Chloe.
Cool. So I'm just asking about page 64 of BFU. You're referring to the kind of transformation plan, which we were talking about in the previous hearing, that 8,700 odd public sector jobs that the Minister of Finance has announced will be cut across the public sector. And you say, and I quote, delivering these baseline reductions will require organisational change across the public sector, changes to programs and transformation, how the public sector delivers services. They may take longer than anticipated to implement and or may not eventuate in full. However, for the most part, you have reflected some quite substantial change reductions in cost to the tunes of hundreds of millions of dollars, particularly eventuating in the latter part of the forecast period. Could you run us through the assumptions that you have made about how these cuts will materialise?
Well, I think what we're taking is, well, I think the first point is in terms of the cabinet decision around the baseline reductions, that is reflected through in our forecasts. Because this is a set of reductions that go over essentially 3 years, it's not surprising that at an agency basis, how that is going to be delivered in each year is still not established, because it was only determined as part of this budget. So what the risks is trying to highlight is, because not every detail has been worked through or how each agency is going to do that, there is a risk at some point that either the profile doesn't quite match the funding reduction, or there are some issues that government will have to be considered. My sector, talking to my colleagues across the public service, I'd say there's a range of situations. I think there are some agencies that are quite well placed to have a good sense about how they are going to achieve these reductions, through to agencies where essentially, ministers, they're much less clear in an organisational sense, and ministers are going to be asked to be making some policy choices as well.
Yeah, I mean, as you kind of outline in that very answer, we don't have clarity as to how these savings will actually be achieved, what the actual game plan is. I guess what I'm really trying to get at here is, given that you have represented these ostensible savings in the budget, what methodology are you actually using in order to assess these savings are realistically deliverable before fiscally forecasting them?
Well, what we do, and look, this is not particular to this case, is we reflect in our forecast what Cabinet determines.
Yeah,
Cabinet has determined a set of baseline reductions, just as previous governments have built in baseline reductions, and that's in our forecasts. And I think part of if I step back, there'll be different views across this committee about whether people like the spending profile, but I think one of the things that we think is positive is at least agencies have a funding path to plan to, and that's reflected in the forecast. I think that gives them a good base to plan. What comes with that, though, is whether it was 255 or a different number, is there's some uncertainty about how they will live within whatever cap the government establishes. But from our perspective, we reflect what Cabinet has decided.
Yeah, I hear that Cabinet has made this decision, but you guys obviously are supposed to run the ruler over that. And my understanding, based on your own BFU at page 38, you said that a portion of the required baseline savings, quote, have not been reflected in agency baselines yet, with specific areas of these savings still to be identified. Yep. So you have agencies and departments that are saying, we don't know how we're going to meet this thing, yet you guys are still reflecting that in terms of savings. And again, I'm not having a go at anyone. I'm really trying to understand the assumptions here.
What I'm saying is, I think you're not wrong to say, look, there's uncertainty, in every agency about how they'll do that. What I'm saying is there's a range of levels of confidence about that. But also I'm saying, it's not surprising that if you actually look out and say, here's a funding track over 3 years, of course, you're not going to have the answers to what that's all going to look like in your organisation in 3 years' time. That is going to evolve, and and iterate both on decisions that the agency itself will take, but also what happens in the wider system.
Yeah, I mean, this one though is quite different to most other change programs. We're not just looking at cutting jobs, we're also looking at some quite heroic assumptions from the minister with regard to the efficiency and capacity gains that we could have with AI, which again, you yourself and BFU note are uncertain at page 15. So I guess then how have you actually factored in that very uncertainty around the modelling of being able to maintain the capacity of the public sector despite these 8,700 public sector cuts? And obviously the experience that we're seeing overseas right now with different governments and corporations backing down from the heroic assumptions that they had made about rolling out AI.
Well, I think the AI one is a separate issue. I think how we're handling it is what you're pointing to. What we've said is we've been very explicit about the risk, right? That there's a decision there, there's a risk, future updates will handle this, as progressively we get more information, as governments make decisions through, B27, B28. That's how that will work, right?
Yeah, I hear you in terms of being able to point to just noting a paragraph on the risk, but I guess the point that I'm getting at is that we currently have a Minister of Finance that is pointing to Treasury's forecast baking in the effect of the cuts that she has announced as legitimising her position, which does inherently make this political. And that's why I'm trying to get to the assumptions that have been made by Treasury to that effect, because I don't think that having a paragraph on the ambiguity of the risk gives the kind of counterbalance or the equivalence or the balance effectively and transparency and accountability necessary to also then simultaneously say these are forecasted cuts, these are forecasted spending reductions on the other side of the ledger, if you understand what I'm saying.
Yeah, I mean, I think what I would say is, in any budget, governments take decisions on both spending and savings where over a forecast period there's quite a lot of uncertainty. And so I don't necessarily, you're focusing on this particular area, and I think you're right to say there's a particular set of risks, no disagreement. But that inherently is the nature of, budget at the any New Zealand has the right through cabinet to make policy decisions that have fiscal implications. And it's not our job to, in a sense, second guess and say, oh, you'll never do that, Minister, so we won't put that in, or that will never work out. It's we're transparent about what are the decisions that government does reflect in the forecasts. Any government then has to justify the merits or otherwise of that view, and our job is to ensure that information is as transparent as possible.
I think that's a good segue to Dr. Deborah.
Just
Russell.
one final, if I may.
There's been quite a lot of time.
Okay, I was just hoping for one final to close that out, but.
We're just about out of time.
Yeah, we are, and this is actually it's actually a sub on the previous issue around pay equity and back to the climate one, and it's about when the liabilities get recognised. So I'm just wondering about the pay equity one. So the trigger for recognising a pay equity claim in the budget or the financial, wherever it's going to, would that be the lodging of a claim? Is that enough to trigger a liability?
Well, look, remember the.
Oh, not a liability, a contingent liability.
No. But remember, there are the two streams. So there's the Crown as employer stream.
Yep.
Right.
Yep.
So at any one time through other agencies, we are aware of discussions between those agencies and unions about a pay equity claim. Every time we do a forecast,
that gets taken in. No worries.
That's right, and it's important because that contingency that we disclose it is still significant. The second part is around the funded sector.
Yeah.
And that is that is a case where, I think, certainly the current government has said the way they want to address this is case by case.
Yeah.
And they will want to handle that as one of the many issues that competes for the budget allowance. So it's not, if you like, ring fenced.
Sure, but there's there's, a legal process around pay equity claims and including the pay equity claims from the funded sector.
Yeah, but
So
that's right.
So if someone lodges a claim, do you then have to go through some kind of assessment as the claim before you as it?
No, it's not because essentially in that case, the Crown is not a party to the claim. What Cabinet would have to agree. Let's take a
Still
hypothetical, say ECE teachers, right? So
let's say
most ECE teachers are employed by,
Child centre.
private,
Yeah.
most of them private. So government will have to take a view about, okay, if there is a pay equity claim that's agreed between unions and ECE employers, what is the Crown's view on that? Is the Crown happy to have the cost implications of that flow through into the payments that essentially parents make to ECE centres, or does the Crown take a view, no, we're going to subsidise that? There's then a choice for the Crown about how much to do that, So that I think is the
Yeah, I'm just trying to think where it would sit in those risks and things like that, and it's sort of.
Well, I think in that case, I think it would be reflected in a general sense in the specific fiscal risks.
Yep.
Right.
Okay.
But it wouldn't be. You
wouldn't quantify it because you
No.
couldn't quantify it,
No.
but you might have to reflect it in the.
Yeah.
Yep. Okay. Thank you. It's just at what point it becomes concrete enough to start. Yeah. Yep. Thank you.
Or you start crystallising it in the
Yeah.
books.
I think that brings us to the conclusions of our hearing with the Treasury. Thank you so much for your
thank
time,
you.
and it's been a big session for you.
Yeah. Thank you.
Thanks, everyone.
And members, we're back at 1:30 with Geo and then megawatts. Thank you.
Didn't he get removed from that portfolio? You should probably
Reprioritise.
Honourable Paula Bennett, Mrs McMurty, very good to have you here. We've got you in here for half an hour. I'll leave it to you to make some short opening remarks and then we'll go to questions. Thank you.
Yes, well, look, thank you to the chair and the committee for this opportunity to share all the wonderful news about what has been achieved in Pharmac and also MedSafe over the last year and indeed the last 2.5 years, where enormous progress has been made in the functioning of the organisations and the service that's received by New Zealanders. I think it's fair to say that 2.5 years ago, we inherited Pharmac in a poor state. It did not have certainty of funding. There was a war of words between the chair of the the chief executive, of Pharmac, and various stakeholders who were protesting outside the building. There was very slow performance in assessing medicines despite low volumes of medicines being assessed, an enormous amount of frustration in the entire sector. Today, we have a new chair, a new chief executive, a program of improvement within the culture of Pharmac. We have seen 8 new medicines funded and 28 with widened access in the 25-26 year, following 31 new listings and 52 with widened access in the previous year. Altogether, 360,000 patients have benefited from this new access. We've also set about new ways of thinking about funding Pharmac as we transform the organisation from economising within a fixed budget to becoming an advocate for a larger pharmaceutical budget where savings can be made elsewhere. And I'm happy to talk about that ongoing project. In the case of MedSafe, we've roughly halved the time for consents depending on their complexity. And we've introduced a new initiative being the rule of 2, where if a medicine is approved or consented in the last 4 years in any of a number of other jurisdictions, then it will be consented in New Zealand within 30 days of application. This is a major change that will bring medicines access, frankly, to where it should have been for a long time, up with the rest of the world. So those are just some of the things that have occurred. I'm sure there'll be people who want to ask more specific questions. Very happy to share more of the good news.
Thank you, Minister. Chloe Swarbrick, Primary, and then Aisha.
Kia ora. I just wanted to ask about medical devices. So I've got a few different questions just to try and actually explore what's going on here. Firstly, can you confirm whether Pharmac runs evergreen contracts on medical devices?
Evergreen contracts?
Yeah.
What do you mean by that?
Effectively contracts that auto-renew and are changed only by mutual consent between Pharmac and the medical device company.
Well, if you want to ask about the specifics of contracts, I'll refer you to the chief executive.
We do have a number of contracts that have evergreen but checkpoints for renewal. And that helps us keep prices stable over time. And, you know, we use a mix of some are and some aren't, but we do have those. We have those in pharmaceuticals as well on occasions. It helps us stabilize prices over the longer term.
Really keen to pick that point up, but just to further explore this evergreen point. So when was the last competitive process run for medical devices?
We just ran one right before Christmas on drug-eluting stents.
Mm-hmm.
And yeah.
Okay. So I understand that, is Pharmac aware of any current contracted arrangements that are offering hospitals a lower price in exchange for written commitment to buy less than 10% of their volume from competing suppliers?
I am not aware.
You're not aware of those? Okay. My understanding is that there have been some smaller players that have written to you through that effect, so I can follow up with some further questions. Are you aware of Christchurch, New Zealand, the economic development arm of Christchurch City Council, having run some surveys of medical health tech companies who have said at least half of them found it impossible to navigate the health system procurement processes?
We're not aware of that correspondence. Nonetheless, we frequently engage with people who are frustrated by not having their products bought or feel that the procedures are more bureaucratic than they'd need to be. That's why we have, after 12 years of fighting between Health New Zealand and Pharmac, put in place a fair division of who procures which types of devices. And as a result, the two organisations are now able to streamline their processes. But I'm not surprised that people will be frustrated with what they've experienced over that period.
And I guess, Minister, to that earlier point of the confirmation that there are evergreen contracts that exist for medical devices, that kind of contradicts what I understand was your letter that you wrote along with Simeon Brown to require that the procurement pipeline is refreshed annually. Does it surprise you to hear that there are evergreen contracts for medical devices?
Well, not really, because in any kind of arrangement, you have to decide how much you're going to spend on the transactions, how much bureaucracy you want versus how much you can save through that contestability. So there's certainly a view that there should be markets for everything, and every arrangement at all times should be up for reset. Other times, there are people who say, no, we reject that neoliberal outlook. We would like to see a little bit more certainty over time and you can be more efficient and get more value for it. That's an ongoing debate amongst a variety of people. I'm interested to see the side the members taken.
So just further to explore particularly this point though, Pharmac in correspondence that I've seen, I'm more than happy to share, Pharmac has said that it will only reprioritise procurement for medical devices where savings exceed about $1 million a year. Is that an official Pharmac position?
Well, again, it's up to the chief executive to decide these sorts of criteria.
Totally. Whoever's most appropriate to answer it, it's all good.
I think we're currently going through the transition of separating the work between Pharmac and Health New Zealand. One of the big pieces of work there is to figure out a way to prioritize which areas we want to spend time jointly procuring and going through the procurement processes. So, you know, we do look at a large number of contracts and try to prioritize where we think the most savings will be by doing a large procurement process that is joint between us, and we're relying on Health New Zealand now in the new model of trying to prioritize together which ones we want to work on.
I guess further to that point in particular, I've seen correspondence and I'm interested as to whether it's come across your guys' desk that in one specific documented case, Pharmac has gone back to one of these small medical device suppliers or small businesses and said that a saving that Pharmac had agreed would constitute about $300,000 a year was too small to pursue. Is that something that concerns you guys?
Well, not necessarily, because Pharmac, like any organisation, has limited time, a lot of contracts, and it has to decide which ones to do first. I think if we were to discover that they had a choice of pursuing a contract that would save $1 million or pursuing a contract that would save $300,000, obviously you'd want them to do both. But if they had to choose, you'd want them to do the one that saved $1 million. So it wouldn't be surprising to hear something like that if you start to think through the logic of what an organisation like Pharmac is trying to achieve. Nonetheless, as the chief executive has indicated, we are in the process of a transition after basically Simeon and Brown and I negotiating a peace after a civil war between Pharmac and Health New Zealand that went on for a dozen years. And as they work through their new systems, I'm sure that they'll be able to get to the savings for smaller amounts as well as larger ones.
Just to be clear, in this specific instance, it wasn't a trade-off between a saving of 300K and $1 million. It was just completely shutting down the potential of saving around $300,000.
Well, you don't know that, because it's possible that one vendor has been told that they couldn't prioritise their transaction at that time. Pharmac might have had reasons for not pursuing it that they haven't revealed to you or the person who's given you their email.
Okay, so further to that point then, can I get a commitment from yourself, Minister, or from Pharmac that you'd be willing to look into specifically this case to understand it as a test case of the issues that are being faced by...
Absolutely.
If we've got all the facts.
Can I just ask, have you previously raised this as a constituency MP or in any other capacity?
It's not in my constituency, but I understand it's been raised directly with all three of you.
Okay. Well, if you
including
can,
in direct meetings.
I think there's a number of factors around it. So it would be best that we took that off. Yeah, so I'm not going to make you any obligations right now without knowing all of the facts and knowing exactly where that sits at this point. Because as you say, I do know who it probably is, and we've certainly had meetings in relatively recent times.
What I'd suggest is if you have an issue like this before, again, then you can come to us anytime. Probably easier to work out something at this level of detail constructively rather than to raise here, but up to you.
Again, I think I've proven with you, David, that I'm very much willing to do that constructively.
I'll go to Aisha Vera. Let's wait for a question. Thank you.
Thanks, Mr. Chair. Minister, an opportunity to update us on how your priorities are evolving in the year ahead. You came to office and previously told the committee you wanted Pharmac to improve the funding bids that it makes. You gave the example of whole of society benefits for funding drugs for multiple sclerosis, diabetes and migraines. Why hasn't that type of work been visible yet?
It's a very good question, and I think it's worthy of discussion. I would summarise there's two basic frustrations which I've shared in the media. One is that in order to demonstrate that there is a saving elsewhere, you need to actually know what that saving is. And what we've discovered is that while Pharmac is incredibly fastidious about its costs and prioritisation and so on, the rest of the healthcare system finds it difficult to show what the costs of their services are, and therefore what savings might arise if the investment in a new medicine was to displace that treatment or that procedure and so on. So that's the first challenge that we're facing. The second is to do with timing. So if you take, for example, there's been a lot of discussion about, can GLP-1s reduce obesity? It appears they can. Can that reduce diabetes? I'm sure it can. Can that reduce kidney failure? Can that reduce dialysis? Well, all of those things are true. But the time frame for that sequence of events to happen is nearly a decade. So for a government that is trying to justify a budget uplift in 2026, 2027, to say that this may have savings in 2035, for example, doesn't work well with the way that successive governments have budgeted. So those are the two roadblocks that we've run into, but we remain resolute that we can fix them.
Supplementary. Minister, I put it to you that if you opened a textbook on cost benefit analysis, those limitations would have been in it before the election. This was part of your party's election commitment. Why haven't you been able to deliver operationalising this model in 3 years?
I guess because we like to try hard things. So, yep, you could have said, this is too hard, we're just not going to try. But
You
we
haven't
think
fixed those hard things.
which is what we are doing. I think if you were to say that we shouldn't have tried, we should have stayed with the model that we had, remained one of the lowest funded countries in the world for medicines, then yeah, that was an option. It's not an option that I would accept. Sometimes hard things are worth doing because they're difficult.
Okay, but they haven't been done yet. Supplementary.
Yeah, we've been quite open about that.
ACT Party's policy was for a medicine strategy. I'm aware you've received briefings on a medicine strategy. In the coming year, will a medicine strategy be delivered?
The answer is no. And can I just say that I love talking about the ACT Party, but I know if I do, you'll probably say that I shouldn't be talking about politics in a strict hearing like this.
Why won't a medicine strategy be delivered when it was part of the direction you set as minister at the beginning of your term?
Because we decided that given the range of challenges that we faced, if you look at what we've done, we've absorbed the device issue, we've changed the culture, we've changed the management, the chair, the leadership. We've made unending changes that have been for the benefit of patients in New Zealand. We decided that amongst all of those, writing another document wasn't necessary.
2 years ago here, I asked you about your stated plans for partnerships and you indicated that those partnerships might be partial government funding for a drug under investigation. Have any partnerships been approved by Pharmac, or are there any in the works that mean that initial direction you set will be acted on in the coming year?
Well, given it takes you into the nature of contracts, I'll let the Chief Executive answer if that's okay.
Could you just repeat what the context?
Before your tenure at Pharmac, there was an indication that Pharmac would be entering into partnerships with the private sector. For example, a drug that was still under investigation perhaps would be given partial funding in order to gain access in New Zealand. Are any of those types of partnerships likely to be developed, likely to be agreed in the year ahead?
We don't have any that are at a point where they would be agreeing. We are definitely looking at international best practice and what some other countries are doing with those emerging drugs, and if it can come sooner, but we don't have anything that we'd be planning to in this year that I'm aware of yet. I have to go back to the team for more information. Thanks.
Minister, these are 3 big items about how Pharmac does its work, that it appears you're telling the committee there's been no progress on and we can't expect more progress in the year ahead?
A couple of things about that. Number one, I don't consider a specific type of contracting as a big item when you've just contracted new access to medicines that's given 360,000 people more access to medicine. So let's talk a little bit about the relative size here. I wouldn't say that was big. Similarly, writing a document or a strategy, I don't consider that big. What is big is all of the other
Well,
things.
the ACT Party leader might disagree with you because it was his medicines, his
Let the
policy.
minister answer the question.
Yeah, fair enough. But if I was to, I'd love to, can I be the ACT Party leader for a moment? So if I was to channel him, I think he would say, very, very proud of what the ACT Party has achieved through the medicines portfolio. It's the access to medicines, it's the change in culture, it's the work on the whole of society methodology. All of these things are huge. Did we get it? Did we get a medicine strategy and some partnership contracts? No, but overwhelmingly great news, and we're very happy with the way it's gone.
Carlos, primary.
Thank you, Chair. You mentioned the rule of two just now. I just want to know how many medicine have been approved today through the rule of two pathway.
We haven't done any through the rule of two yet because that will only come into effect next month. The legislation, as I'm sure you're aware, was passed near the end of last year. We've recently done some of the final implementation details, such as setting the fees, which will be cheaper than Australia, significantly cheaper than Australia to consent to medicine, which is great news. And then as of early next month, they'll be able to take the first applications under the rule of two.
Thank you.
Jenny, primary.
Oh, thank you very much. Thank you, Minister. Thank you for being here today. One of the things that we heard previously was in terms of geopolitics and the impacts that tariffs from America could impact on the supply of medicines and the cost of medicines coming into New Zealand. Has any of that played out in real time, and are there any concerns that you hold that that could still be an ongoing effect as we move into this next financial year?
The short answer is that we've managed it very well. It hasn't materially affected New Zealand's access to medicines. It may be that one of my colleagues has more to say about it.
Yeah, I mean, we've been really lucky in that we haven't seen supply issues because of the unrest in the Middle East. But we, and the Chief Executive can speak to it, we've constantly got supply issues. So at any one time, we've got about 100 medicines that we might be looking at that, for whatever reasons, it could be a massive uptake in need globally. It could be that they're changing brand. It could be in manufacturing. It could be, so there's all sorts of stuff that's constantly going on. In my opinion, no one within government does it better than Pharmac as far as they're constantly looking ahead as to what's happening, brand changes, what the options are and things like that. I think one of the concerns that certainly the Chief Executive and the senior leadership team have raised with the board is perhaps an increase in costs because of freight costs, because of manufacturing and things like that. So we're still getting the access that she might add to, but it is more, there could be an increase in costs that we're trying to mitigate when we look at our out-year funding and how we do that.
Yeah, the only thing I would add is that in this budget that we've just had, we have added $13.5 million. Now that money in the first instance can be used to absorb such costs, although we don't, if any suppliers are watching, you didn't hear that. However, I hope that managing those costs will allow us to actually invest in more medicines and also streamline and upgrade some of the operations so we can process medicines faster through Pharmac.
Thank you. Just on that, in terms of this year's budget uplift, good to see New Zealand First National Coalition Agreement was to increase the funding for Pharmac on a regular basis. There has been a considerable amount over the last 3 years of finance, more money going into purchase medicines. You mentioned the 360,000 patients that now are receiving medicines. What do you expect this budget uplift, what will the impact be on patients? And what needs to happen next, getting more medicines off the OFI list? What is the trajectory?
I didn't realise you had that commitment. You should have helped me argue for even more money. It could have been helpful. Damn it. What an opportunity lost. Look, in terms of the 13.5 million, We hope that that will be able to help as many as 50,000 people get additional access in some way. But as I've said, that's contingent on price uplifts could be potentially a problem. And also the fact that, we've just got to work through a difficult year for the whole world before we can be sure about that impact.
And to give you an indication, and I think as to how well Pharmac do, as the Minister identified in his opening remarks, in the last financial year, with no uplift in funding, effectively, we had 36 either widening or new medicines come on board, affecting that many people. So a big part of, which is interesting even with the medical devices questions that we were getting straight off, all we want to do is procure and renegotiate to try and bring down prices so that we can then invest that in other medicines. So what we can potentially do with that 13.5 is, hopefully it's 50,000, but equally we can prove what we can do just by renegotiating, making savings, bundling things better, getting better at our processes as to how we recover, that we then reinvest that obviously into what's as high as we can on the OFI. But our challenge going forward, which I know you identify as emerging technologies and emerging medicines, and when you think about gene therapy and people's expectations of what they should be able to get, and they should. It's kind of mind-boggling that in this day and age we can give the kind of treatments that don't actually make people sicker to then try and get better. Literally, as we can see with the Malaghan Institute and CAR T therapy and things like that. But man, are they expensive, right? Really expensive. So, as a country, and that's the challenges as we move forward, as to how you can afford these amazing new medicines, technology, GLPs, they're fantastic. They're very expensive in that context. So
Thank you. Dr. Verrill, primary.
Thank you, Mr. Chair. These questions are all related to the theme of medicines. Pharmac ran a consultation on removing items. Pharmac ran a consultation on removing items from the options for investment list. Will that work continue in the year under discussion? And if not, why not?
I'll refer that to the Chief Executive. I try not to get involved in their specific decisions.
Thank you for the question. Yes, we had quite a lot of feedback from our patient family working group that we have as part of the reset, as well as other consumer groups over time, and suppliers, that they felt they would like more certainty with knowing things that are lower ranked on the OFI or potentially wouldn't be ranked. And so we went out to consultation publicly on that question. Should we remove some of the lower ranked medicines on the OFI that have a smaller chance of being funded, with the knowledge that you could come back and reapply or re-request? And we heard resoundingly, no, actually, we think we don't really want that. We want to leave things on the list, and the hope that they would be funded and that they would remain eligible for funding. And that's what we've done. So we don't have any intention to change that.
It was really interesting because we thought people were saying we'd rather know and have the certainty, as Natalie said, but actually once you went out there and consulted, and I met with a few of them, and they'd go, well, actually that medicine's now so old and it's been superseded by a far more modern one, and so why don't we take off the old one and then we'll and then he said, and it was a specialist, and he said, and then I thought about it and I thought, well, I'd rather keep that one and have something that's a maybe or a hope than nothing. So it's been, yeah. We did it for the right intentions, but then we listened to the consultation.
So you've heard that people would rather have a hope of having the item funded, even though we know from the statistics, items can spend an awful long time on the options for
Some
investment.
can, yeah. Very long time.
7 years is the average, right?
And that's because some are extraordinary. And, as I think the Chief Executive was being careful, but the likelihood is quite slim for some.
That's true, but also I just point to the number that have come off and been funded in the last few years is greater than at any time in a decade, 2 decades. We've had an enormous amount of cash put into Pharmac and therefore new medicines being funded. So perhaps we live in more hopeful times than previously.
And Mr. Chair, also keeping with the theme of access to medicines, I note the government's recent points about medical lockers. What work is occurring within government to make sure that the implementation of medical lockers, where drugs can be picked up by a person from a locker if they can't make it to the pharmacy during hours, that the implementation of that is safe and people get the appropriate advice about their medicine when they picked it up?
Well, ultimately, that's going to be a professional judgment. So if you are a pharmacist, you have a whole lot of professional obligations in terms of what's the ultimate outcome of people receiving medicines that you dispense. So you would expect that we can actually trust professionals. I don't believe that people that spend their whole life and are passionate about their profession should be cocooned in rules that just make life harder for no reason. I choose to trust professionals.
See if that applies to all government policy.
Supplementary, indeed, so do I.
Even the comedians and
So-
the little ones.
How, is there any discussion with those professionals about how to make this change workable for them with those safety rules in mind?
Well, it's pharmacists that are asking for it. That's the first thing. Second of all, the way that it will be implemented will be through a change to the Medicines Act, which is currently being worked on by Casey Costello. So you can imagine all of the usual lawmaking procedures that go on. There will be consultation on the bill. It will go off to a select committee. I'm sure that if anybody can see a gaping hole or problem with it, then those lawmaking procedures that New Zealanders rely on will come to their aid.
Carlos, primary.
Thank you, Minister. I just want to talk about your last week announcement, talking about pharmacists going to be responsible for the funding for ambulance medicine used by the ambulance. Can you give us a little bit more insight and how this will affect the budget for budget 2026?
Yeah, obviously there's a cost to that, but at the same time, there are other agencies that were previously paying, so that will now be funded through Pharmac, and I think it makes sense to have the organisation that is just really good at assessing and buying medicines, doing that for the ambulance service.
Yeah, so that's something I don't get it from your announcement is you believe that the medicine will be cheaper because they changed the funding model from Health New Zealand and ACC to Pharmac. So how does that work?
Well, we're just better.
Yeah,
but no, I mean, in all seriousness, I mean, Pharmac buys $1.8 billion worth of medicine every year. So when someone comes along and says we buy 1.8 billion, you tend to get a better deal than if you're St. John or whoever, as much respect as we have for them.
And they were sort of buying across the board and it was not as clean. And we just saw that we had the expertise that we could bring in. There is some cost to Pharmac, but in the scheme of it, fairly minimal when it comes to the advantages that we can give to make sure. And it's the small stocks that they need, as you can imagine, within ambulances, working with the hospitals, because when they do need to restock, sometimes that's where it is. So we can streamline that for it. It actually makes it cheaper for our ambulance services, but equally, and we've also widened the access that they're able to give one a medicine within the ambulance that they couldn't before. So I think that stuff all makes a difference. And I'm, as a board and giving some direction, we're quite excited about other areas. There are other areas where they hold medicines and how they access them and at what cost. Actually, there's medical outlets in some of our corrections facilities, for example. It's sort of looking across the board as to how we might be able to, looking at some of our doctors' surgeries, particularly in rural areas, as to what they might actually keep on site in smaller quantities, if that's going to help access for people, which is the whole aim of it at the end of the day.
All right. Thank you. We're on time.
Is that it?
I've got two more questions for you if you have them.
Yeah,
So-
you go for it.
Lucky last.
So yeah, last two, just very briefly. Appreciate
Get
the
one,
commitment
get one.
to working constructively to try and resolve these issues that have been raised.
Yeah,
And
just let
of
us
course,
know.
these have been raised in the past, but nonetheless, just two quick questions. The first is, are you aware, and this perhaps better directed to Pharmac, how many people currently work within Pharmac on medical device procurement?
I'd have to come back with the exact number.
Okay, my understanding is about 16. Does that sound?
That sounds
ballpark?
close.
Okay. The second, and this is potentially for the minister it is really for the minister, just to your point earlier, Minister Seymour, about brokering the peace between Te Whatuora, Health New Zealand and Pharmac. You'll probably be aware that in 2022, there was a review which came to the conclusion that actually the procurement processes for medical devices perhaps best sat within Health New Zealand. Why do you disagree with that position?
Because there's different types of devices. So there are some that are very adjacent to the clinician. And if it's something that they need to buy in large volume, where basically there are going to be a huge number of, I don't know, gloves or perhaps a bed or a device that clinicians use, then the people that employ the clinicians should be involved in that and the people that are closest to using them. On the other hand, there are other types of devices where the costs and benefits are open to scrutiny, and the organisation that has the best ability to evaluate costs and benefits is Pharmac. And so as a result, we now have, I think if memory serves, about 56 different categories of medical devices. Roughly half of those now sit with Health New Zealand, roughly half now sit with Pharmac, and they've been allocated according to whether they are more of a bulk volume close to clinician Health New Zealand thing, or more of a technical complex benefits require tough cost benefit analysis and therefore more of a Pharmac thing.
All right. Thank you, Minister. Thank you, Tony.
Thank you. Thanks.
Thank you.
Oh, good. There.
Welcome, Minister Costello, Chief Executive Dale Bramley, Stella Hart, everybody else involved. Very good to have you here. We have you here for 30 minutes, Minister, so there's time for some brief introductory remarks and then we'll hand it over to questions from members. Thank you.
Thank you, Mr Chair, and to the committee. I would like to touch on just a couple of points around the budget 2026 portfolio areas that I hold. In my emergency services responsibilities, 35 million over 4 years has been invested to strengthen road ambulance services. This investment is to deliver immediate improvements for patients and frontline staff and meeting growing demand. It supports 2 ambulance hubs to be established in Auckland, with 1 confirmed in South Auckland. It also supports an electronic patient clinical record system, additional training support for ambulance communication centre staff, and additional clinical welfare checks for patients. This budget investment is in addition to a funding increase from Health New Zealand and ACC, which is being negotiated for road ambulances to meet demand and cost pressures. It also sits alongside investments in stronger air ambulance services. 7 helicopters are already in service and 9 are scheduled to enter into service between now and mid-2027. I want to turn now to maternal health. Budget 2026 provides 34.4 million over 4 years to support mothers and babies in the critical first days after birth. We're investing in the resourcing needed to enable mothers to choose to receive up to 3 days of inpatient postnatal care after giving birth. This supports our government's focus on giving babies the best possible start in life and providing mothers with choice over how and where they receive support after giving birth. This funding will increase inpatient postnatal care bed capacity and the workforce and support implementation of the 3-day stay postnatal stay amendment bill, which Minister Brown is responsible for. Finally, in regard to aged care, you'll be aware that the last year the government established an independent aged care ministerial advisory group to provide expert advice on long-term reform of the aged care system. We're expecting the group's report in the coming weeks, which will help inform future decisions. In the interim, the government continues to make investments to sustain services and ensure older people can access timely care. The latest 4% funding uplift announced this morning will provide the aged residential care sector with an extra $79 million this year. Thank you, and happy to take questions.
Thank you, Minister. Dr. Vera.
Thank you, Mr. Chair. Thank you, Minister. Can you explain your claim that the St John's Ambulance now receives 90% of its operational funding from the government?
So that is the funding received is a mix of ACC and health funding, plus the co-payments. So where I've been quoted in that is including the co-payment portion of that. So in terms of the funding that they received. So that is differentiating what is there.
Is it correct that St John's receives 90% of its operational funding from government sources?
So I'm not sure what specifically you're quoting. The references that I have made around funding is to do with the funding they receive from ACC, from Health New Zealand and the co-payment.
And is it your view that that adds up to 90%?
I'd have to check the figures. I'm not sure if anyone can provide me the exact numbers around.
I probably have them with me, but we could find them.
Yeah, we could get the specific numbers.
93% government funding plus part.
Yeah, 93%.
Plus part charges. So how much is government funding without the part charges?
I'm sorry, I'd have to go back. In terms of percentage of their cost, and this is where it's difficult to work through that funding ratio because it is reliant on what the ambulance services themselves have as operating costs. So it does vary.
On this information from officials, and New Zealanders know that the cost of an ambulance has gone up from approximately $100 to $135 under this government. Is it correct that the government is providing 90% of St John's funding?
I can talk specifically to what we fund in terms of the amount, but the percentage of their operating costs, I'd have to come back and clarify that.
Why were you certain when you spoke to Radio New Zealand that well over 90% of St John's funding was provided by government on the 22nd of May?
I can't refer to the specific quote. What the information I was relying on was I don't know the interview, so I'd have to go back and refer to the specifics of that comment. But what I was referring to is the official advice that says 93% is now covered by co-payments and the contribution from ACC and Health New Zealand.
Before this budget, St John's indicated to me they would need an extra 145 million per year in order to be 90% funded by government. How can the 8.75 million per year in this budget possibly bridge that gap?
I'm sorry that you're quoting the St John's commentary. What I am saying is what the official advice has been around what their costs are and what we have been funding. So their current contract negotiations are in play, and then the additional funding was separate to their contract.
Is it the government's position that St John's should be have received 90% of its funding from the government?
No, that's not the government's position. That's what the status was, that 93% from ACC, Health New Zealand and co-payment was from their operating costs was the figures that we were confirmed was being provided.
Thank you, Mr. Chair. What do you think the funding level from government for St John's should be?
I think that we should fund as far as possible within the government constraints, but that is part of the negotiation. I'm not going to state a government position. That is, we want to ensure that these services are provided and that they are delivering quality of service, and this is what we're investing in: technology, into staffing, into training.
Have you asked the New Zealand First Party what their position is on this issue?
Well, we have a coalition agreement commitment around funding for New Zealand for ambulance services.
And do you believe it's been met?
I believe we have increased the funding for ambulance services as per our coalition agreement.
Primary.
Thank you, Mr. Chair, and kia ora, Minister. I wanted to explore with you around vaping and the growth of vaping in our population, and how, from a cessation perspective, the infrastructure that we have is built around quit smoking, and hearing from community around how to access vape to quit services are limited. Wanting to understand, what is the process in terms of how we can speed up access for those who want to, so you smoke, you access the vape support to quit. Then it is an issue now where there are people just going straight to vapes. And so there isn't NRT necessarily approved for the quit to vape services. Is there any development going on right now in terms of the way that we can improve access, understanding that Pharmac hasn't met with MedSafe yet to be able to fund the NRT for quit to vape?
Yeah, the access of other products. So I think the important part is that, this is about, the nicotine addiction component. So yes, Health New Zealand is definitely open to working through programs to support the quit vape activity. And I met with all of the quit smoking providers over the last 2 or 3 weeks to talk about those initiatives. We are still focused on getting those smokers to stop. It has been encouraging when we look at the data, particularly from ASH and in terms of the vape sales that are occurring, that vaping is reducing. That has been encouraging. I think the data we have around the estimated sales for vapes in 2024 was 280 million. In 2022, it was 404 million. So we have seen a reduction in vape sales, and ASH's survey is also recognising that vaping numbers have been decreasing over the last 3 years. But yes, it is an important conversation that we, providing supports. Some of the quit smoking providers are already doing that and providing some support in that space, but having a dedicated program will be the next phase.
Yeah, there was the Arohamai, there was the Vape to Quit initiative that was launched last year, and it was specifically for face-to-face support, which is awesome. There are more and more whānau that would seek to access Vape to Quit support online or digitally. Is there any provision to support other providers like, the tried and proven Quit line to come on board with that service?
Yeah, I think the caution retail in that is that we want to ensure that they are engaged with a quit smoking support. How that support is provided, I think there is some flexibility around how we can do that without having to have face-to-face meetings. But it is that, we did want to make sure that it is part of a quit smoking program, that we're not just supplying vape. So I think the way those services are delivered, and that was, part of meeting with the quit smoking providers, was to talk through how can we expand that capacity and capability. It has been really successful in terms of the high number of quits from those that are, CO verified quits in that space through that program. So I think, that expanding that may be useful, but again, we want to make sure they are actually engaged with services to ensure that they are being CO verified, and that isn't just a way of getting dual access to systems. So I think there is some work we can do in that space.
Just to build on that, thinking of a particular population that is vulnerable and has high smoking, but also vaping uptake. Tangata whaiora have spoken about how, can there be some focus around support into the mental health community for bespoke services to support them to quit to vape. So we've gone from tobacco, it's now the issue around vapes, how to support these vulnerable populations for quit.
Absolutely. And I think that's part of those, targeting those that we know are high smoking users. There have been some successful engagements with correction services, so ensuring that we're capturing people, as they're leaving the corrections environment, to be supported to continue to not smoke. But I think all of those initiatives, and it's in some areas it's kind of being a little bit more bold about what level of support we can provide. But that was definitely part of the conversations around accessing those that have the highest need.
And this might be, this will be a final question on this line to allow for other subs. It's my understanding that services who operate in the quit smoking realm, if they don't carry the vapes prescribed within service contracts, that they will no longer be delivering smoking cessation services?
Yeah, so that is part of the package or the suite of options, because if we are saying that these are the tools and options available for a quit smoking service, then all of our quit smoking services need to be providing those options.
And so we could, in essence, see some long-standing smoking cessation providers lose contracts and loss of that institutional knowledge.
Yeah, and this is the process that we are dealing with a changing environment in terms of those smoking needs. So we need to ensure that our providers are delivering the services, and all of this is performance managed around how many quits they are achieving, what is the engagement they're having, what is the success of the program. So I think it's reasonable to have a performance monitoring process within those provider relationships.
Do you think it makes the
Hey,
provider
I'm going to
the
move to
trainer
Aisha Verrill. Yeah, thank you.
Thanks, Mr. Chair. What evidence does this vape kits program have that the quits are in addition to the quits number of people quitting that was being achieved before the vape kits were added?
I'd have to get specific data, but I think the numbers that we had around the vape quit program was, just checking the numbers. So during the January to July 2025 pilot, participating providers supplied kits to 2,150 clients. 79% of the clients who received a vape kit achieved a CO validated quit, accounting for 37% of all the CO validated quits recorded by participating providers during that period. So it equated to about 37% of the total quits.
Yeah, thank you. I'm aware you have a very well qualified public health physician sitting on your left, and I wonder if he might want to take a go at my question, which is about quits in addition to the people who were quitting before the vaping was introduced to this program.
So the standard rate, once you're referred to stop smoking services validation after a period, is around 60 to 70%. So for those who got offered the vaping kit, the rate of quitting and validating of that is actually slightly higher, to the 70 to 80% range.
Thank you. And when will this evaluation be published?
I don't have that information.
We haven't. We're currently just working in partnership with the ministry to establish an evaluation.
Well, it'd be good to see that happen.
Carlos,
So just talk about helping people to quit smoking. Do you think that it would be great if we can put on some kind of a disclaimer or some of the pictures or health issues pictures or the packaging of vaping product will help people to quit vaping?
Sorry, what sort of pictures would you be imagining?
Or on a cigarette package, they always got some kind of a health disclaimer. They say, smoking will cause cancer, and then they kind of have some kind of graphics to tell people what will the lungs look like. Do you think there will be a good same approach on vape product as well, to put that kind of pictures on those vaping product?
So the picture would have to relate to what harm vaping is causing.
Like lung and all this other
So at this stage, there isn't the evidence to demonstrate what that harm looks like. And I think, to clarify, at no point has anybody said vaping is good for you. But what we are focused on is ensuring that vaping is made available to those who smoke, to enable them to quit smoking on a less harmful product basis. So the deterrent away from vaping is a separate scenario.
Well, I mean, there's an argument whether vaping causes, health problem or not. But I think it would be good if we just put another extra sentence there that vaping may cause some kind of health issues, to remind people there is a risk.
The very clear message we have repeated and consistently repeat, that is, if you don't smoke, don't vape.
Yes.
If you smoke, vaping may assist you. The confusion around the messaging around vaping harm has resulted in people now taking up smoking in order to quit vaping. And that is the confused message, suggesting that there is significant harm from vaping, when we know smoking is the product that is causing people to die. And so therefore, that is the messaging we want to do and overcomplicating the messaging around vaping. In future states, once we have our smoke-free generation, there may be consideration in that space, but it's not something we're looking at the moment.
Thank you, Mr. Chair. My supplementary is for the Director General. What is the Ministry's view of the emerging evidence of vaping harms that have come through in the last 2 years?
The Ministry's view is there is emerging evidence, but that the emerging evidence still supports the fact that smokers should switch to vaping.
And which harms are you referring to in the emerging evidence?
So there is emerging evidence around damage to lungs and
Cancer?
And emerging, but the evidence still supports that smoking is worse for you.
And is it totally proven that nicotine-containing vapes are addictive?
Nicotine is an addictive substance.
Joanna.
I just wanted to touch on some of what's already been discussed, but we know, and there's been statements made of over 200,000 people have quit, each year sort of thing. Do we have specific numbers of those that are attributed to vaping in terms of data that might come out of either the Ministry or Te Whatuora?
The only data we have in terms of the graphics, which I have shared quite extensively, is around that we saw the smoking rates declining up until 2018 at a relatively slow rate. And then between 2018 and 2023, we saw a massive decline. And that the only difference in that space was that vaping became available. So we did see, and it has been public health policy since 2018, that vaping is a product that has been used to help people quit smoking.
Just wanting to ask about workforce in terms of our enforcement officers. Has there been an increase in the workforce across the motu in terms of what we're doing to ensure that our vendors are adhering to law and legislation?
Yeah, really encouraging. There has been an increase over the 2 years. So since the beginning of 2024, we've grown the team. So we are at full strength in the compliance space. But importantly, there has been really good reporting around, significant increase, and I can get those details to you around the infringement and enforcement activity that's happened, and also the compliance, assessing the compliance for most retailers has been quite high. I think from memory it was in that 90% range of most of the retailers are compliant. But that is again the work that we've done to set up using the compliance team as well as customs and police to actually target the illicit tobacco market is also part of that program of work.
All right, we're going to one more start from Carlos, then we go to Jenny's primary.
I remember last year when we are sitting here talking about vape, and we just recently passed the legislation, and you mentioned it was only the first stage to target vaping. So how does it look like on the second stage? Or what was the area we got to target on the second stage?
So I think there's a range of things that we've got to target in that space. As the total environment at the moment, we have probably more regulatory controls on vapes than we do over tobacco. So there is some work in that space. The other component is actually having a regulatory regime that is consistent. So, there is a lot of work we can do in that space. So I am bringing a cabinet paper forward in the coming weeks to look at that other stage of the regulatory regime.
So very briefly, if I can, Mr. Chair.
Go on.
Minister, can you confirm that what you're signalling there is a direction to liberalise vapes?
No, absolutely not. What I'm signalling there is the ability to have some consistency around the level of control. We have greater visibility over the retail of vapes than we do over tobacco.
So you're going to increase the level of, which one is it? Increase the level of control over tobacco or reduce?
Yes, over tobacco.
Okay, primary, Jenny Marcroft.
Thank you very much. Switching topics now, Minister. Looking at aged care and the announcement today of, I think, $79 million. Can you let the committee know how investment into aged care will free up hospital beds, and what will this mean for those patients that get stuck on a Friday and can't get returned to residential care?
So part of the contract is, on top of a contract uplift, is actually to do some of that funding towards the resourcing to allow aged care to be funded to have weekend admissions, Friday nights, over the weekend, because there is a different type of personnel that is needed. So listening to the sector and through their contract negotiations, that has been part of the consideration around ensuring that there is, workforce investment, capacity investment from that space. And it is just one portion. As you're aware, we're imminently going to receive the Ministerial Advisory Group report onto aged care in terms of system reform, but that is the first part of that. So the contract negotiation has been really positively engaged, and I think that we've come with a good outcome around that investment and how it can support delivery of services.
Now, you mentioned your Ministerial Advisory Group report, which is due out shortly. Can you give the committee any indication of what might be in that report? Is there anything high level that you can?
I've been really clear to ensure that the Ministerial Advisory Group is independent of government, so we're not directed. We are, the terms of reference were very, detailed around, the sustainability of the system, the investment in protecting the supply of standard beds. So those are the components in it. We should have the report next month. And, we will continue to engage to ensure that that is publicly available and work through making some ministerial decisions, taking a cabinet paper to cabinet in this term of government around some key policy decisions.
Thank you. And just final supplementary on this. Obviously, this committee was involved in a serious piece of work around our inquiry into aged care, and particularly with a focus on dementia and neurocognitive disorders. Has that report been useful for you as a minister in this area, and also too for the Ministerial Advisory Group?
Yeah, I would say it was a very useful, and the key recommendations were very consistent with the initial discussions with the group around what is needing to be addressed, what should be prioritised. So it was definitely one of the foundation sort of documents that we provided for them for their reading bag, along with the aged care funding model review, which was also part of that, those considerations. So it was a very useful report, and it has been part of their considerations.
Hard-working committee. Sup.
Thank you. I've got a couple of sups in lieu of my primary. Minister, the aged care sector says there's no more beds today than what there was before the budget. So, and they're 95% full with an estimated 12,000 beds still needed. So what from budget 6, if anything, goes towards new capacity? So is there any new capacity, or is this just funding existing beds to make these?
Yeah, the reality is that it is about sustaining the existing beds. We know that we've had closures. We still have a lot of work to do in that space, and we recognise that's why the importance of the aged care group there is. But I think there's also opportunities we have around investing in the access to in-home care, primary care support. So all of those components will be part of ensuring that we have a sustainable system moving forward. But no, the big focus at the moment in the investment from both last year and this year, so I think we've about 149 million in total over last budget and this budget, is to sustain the existing capacity. Encouragingly, it's talking to the providers, shifting environment, so workforce isn't the primary issue now. It is maintaining the facilities and the capacity. So there is real opportunities, but encouragingly, the providers that are dealing with investment in technology and systems is also that there is really good. But we recognise that the level of uplift needed to grow capacity is going to be significant.
Which raises two very quick questions then. So what from budget 2026 was dedicated towards that home care service? And in relation to the announcement this morning, how many, do you have any idea of how many providers are actually currently able to take weekend
I
weekend
don't have the specific
admissions?
data, but I know that the officials have been working directly with the aged care or the peak body, the Aged Care Association, around that capacity and who that impacts. In terms of the in-home care, that contract is still under negotiation. That will be announced in due course once that contract negotiation is resolved.
Because without any specific ring fence money for aged care workers' retention, pay and training and all that sort of stuff. And you say that workforce isn't necessarily the main factor at the moment, but looking at the data that we have available, it doesn't feel like there's many providers that will be in a position to be able to actually take those weekend admissions without extra capacity.
Yeah,
Does that worry you?
The conversations that I've had both with the peak body and the providers that I've met with, there is capacity to deal with it. It is, that is why this funding has been important to them. But I'd have to come back to you with specific data around those numbers.
Right.
I'm good. I had one question. It's
Go for it.
rough supplementary based on aged care. Alzheimer's New Zealand says that budget 2026 fails to meet the growing dementia challenge, and that dementia Mati Wari Wari action plan remains unfunded and unimplemented. Is there anything specific that you'd like to say to what is a really growing concern amongst New Zealanders, not just Alzheimer's New Zealand, that we do more towards something that's only going to become a bigger concern? When is the government going to?
Yeah, so as you're aware, there's I think 7 programs running at the moment, the trials that are being run, so they will be reported back around that. There is generally I think opportunity within the Ministerial Advisory Group to deal with some of those growing capacity around dementia facilities, in-home care.
Back in a couple of weeks, are you expecting?
Yeah, so
that will be part of
that's
that?
what I'm. So it is part of that overall capability, and I think there is real opportunities within that space to have earlier intervention, which I think is one of the key actions. They're seeking early diagnosis and early intervention. So I think the aged care system is a continuum of care across primary, in-home care, other community supports. And I think collectively we've got an opportunity to actually deliver a lot of those things, which is early diagnosis, I think is a critical component. And the carer strategy also, the work that Mr. Simmons doing around supporting carers in that space as well. So I think there's 3 or 4 programs of work that kind of link into improving the outcomes, and we will continue to engage. But specific actions, I would really want to have the Ministerial Advisory Group come forward. But we are looking at the capacity around the total capacity around psychogeriatric and dementia care facilities as part of the capacity growing that we need within the space.
Thank you. We're at time.
Thank you very much.
Appreciate everyone's efforts today. Thank you, committee. We are suspended till 3.
Great. Thank you. At 3 o'clock.
Yeah, 3 o'clock, 3. That's what I said, we got longer.
Sorry, Mr. Chair, I wasn't privy to your discussions. I'm talking about my own information here. But the Mason Clinic funding is in TAG contingency, as you know, but it enables, it funds enabling work rather than new beds. So can you talk us through any kind of additional, it's a real gap when we talk about mental health. At the moment, we are essentially incarcerating people that the health system should be seeing because the health system isn't seeing them. And I just want to hear your thoughts on that and what Budget 2026 hasn't done anything to address that gap. But I want to know where your thoughts are landing on what you will do next to address that gap.
Yeah, look, thank you for that question. And it is an important question around how we ensure better forensic mental health support. If you look at Budget 25, we invested $51 million into opening up 10 new forensic beds and 8 step-down beds in the Waikato. But it's also about building out the continuum. So that was funding more prison in-reach FTE as well as court liaison. We've continued that program of work in Budget 26 with an extra $36 million.
Is that new capacity though, new beds?
Yes, so that will be 4 new beds as well as new step-down beds, new prison in-reach services and new court liaison services as well. Where I would say though is the crossover around intellectual disability and forensic, which comes under the responsibility of Louise Upston with Whaikaha. But Health New Zealand is contracted to deliver those beds. There is real pressure across the whole of our forensic system, including ID as well. And that's why we've got a program business case in front of Cabinet to look at the long-term planning of ID forensic services. We know there is a good mix of not only Health New Zealand services, but also our NGO and community services who provide that level of care as well.
But at the moment, there's at least 30 to 50 people at any one point in time in a prison system who, but for the failings of the health system, wouldn't be there. Do you agree that that's a problem? And are you committed to finding a solution?
I'll just need clarification because you're sort of going back between intellectual disability and forensic. So you're talking forensic mental health services. Well, that's the reality of the waiting list that we inherited when we came into office in late 2023. So that's why we did the work in our first year and in Budget 25 announced $51 million. But I'd just point to you, $51 million in Budget 25 for 10 new forensic inpatient beds and 8 new step-down beds in the community. They are quite expensive beds to fund, but we are committed to doing that. So not only have we funded more beds in Budget 25, continued to fund more beds in Budget 26, myself and Mark Mitchell, Minister for Corrections, have got an active piece of work underway with both corrections and health to look at how we better manage that wait list to ensure we've got the right prison in-reach services as well as court liaison as well, and ensuring that we do build out beds in our forensic services.
So just finally, can I just confirm that Budget 2026, the Mason Clinic TAG contingency, which we can't see the amount, is for enabling work?
Yes, so that is CapEx,
Not for new beds.
and then we've got, it will be for new beds, and then we've got $36 million in OpEx. And I just see if Dale or Audrey want to add anything to that and the detail of that. Okay.
Watch the space.
Sure.
Just a supplementary to that, thank you all for being here. We of course want to do some prevention before it gets to that that level of care. Can you point to where in the budget you have got initiatives and programs around the prevention of people getting to that forensic mental health level?
You'll have to probably explain what you mean by that. Are you
So-
talking about in prison mental health support? If you're talking about mental health support in prison, that's a budget that Mark Mitchell holds.
So I'm talking about before they get to the prison system. So that prevention funding for mental health, can you point to where in the budget you are focusing on the prevention?
Yeah.
Getting there.
So if I start at a high level and step through it, and then sort of you can ask me follow-up questions if I haven't got specifically to your point. When we came into office, the mental health and addiction ring fence was 2.4 billion. After the increase in uplift with budget 26, that will go close to 3 billion. Part of my mental health targets, setting New Zealand's first mental health targets, 3 of them are around access, 1 workforce and 1 prevention and early intervention. So we have set a target that 25% of the mental health and addiction ring fence goes into prevention and early intervention. Some might say, well, I work in a specialist service, which is part of your question, I think, in the community with adults. How can I be seen as prevention and early intervention? But actually, when you take a philosophical approach, is actually even at a specialist level, by intervening a lot earlier and ensuring that we engage people potentially with lifelong and enduring mental health issues, then we can keep them stable. They can better support themselves with their mental health issues and stay out of the criminal justice system. Court liaisons is a good example of a program like that.
Yeah, can I have one more?
Supplementary.
Thank you.
Right.
Thank you, Minister. And yes, we are really pleased to see that increase in funding in the vote. When we are looking at prevention, can you tell us how much of that is going to be in like different areas? So for example, with prevention, how much will be in youth or with seniors or in men's mental health?
Yeah, I mean, that would probably take some considerable work to get into
Post-hearing
a
question.
health system across the country
Yeah.
that spends $3 billion, how you would tag that for either male versus female, because of course, when you look at the investment into our primary care mental health services, it's actually universal. So we wouldn't measure it by that. But your point is valid about young people. That's why we do have specific young people's programs within primary care. It's why we do resource programs like Gumboot Friday to ensure that we have available appropriate youth mental health support. But in fairness, if you look at the report released yesterday by the Mental Health and Wellbeing Commission that talked about still the pressures of access around young people. What's really interesting in that, when you look at the Ministry of Youth Development survey, only 3.9%, 3.7% of young people said they couldn't access support because there wasn't an available appointment. Only 3.7. In fact, over a third reported they didn't know where to go or they were too embarrassed to ask for help. So it shows we've still got to push through barriers of stigma and discrimination. I get a good overview of our mental health system. There is still capacity in our youth services, but what it says to me, it's the type of services they might perceive as medicalised or adult, and we do need more youth-specific mental health services that are more engaging for our young people.
Your primary?
Yes, please. Thank you. It just follows on very nicely from this. So just recently, the UNICEF statistics came out. It's a report out of 37 countries, and New Zealand was ranked 37 out of 37 for youth mental wellbeing. And I know that there has been that increase in funding. Can you tell us how much of that will go towards YOS, the youth one-stop shops? We know that we were both at the opening of the new event centre at the wonderful Christchurch Youth Hub, and we know that there has been work done across Parliament with under one umbrella. So, and there's recommendations in there around how to best support our young people with these YOSs. Can you tell us what is being done in this budget further to what you've just outlined around picking up these tamariki who might have had support but aren't getting the further support that they're actually needing, so that they're not,
we just want to look after our young people
Yeah,
and
look,
those
it's
youth
a valid
one-stop
question.
shops.
Got a lot to do in that space, and I acknowledge it's an area that we've got to work collectively on. And what I would raise is that I'm a big supporter of the YOS model, and actively at the moment through a policy lens, we're going through an evaluation of youth one-stop shop. My hope that will inform future funding decisions around how we can grow that model as well. You asked for specific questions. I mean, I'd refer to the recent investment out of the Hawara Māori appropriation, where we're significantly investing into youth crisis support, especially in the Northland area, new kaimahi roles based after a coroner's recommendations. But I would say also is that when we look at young people in the sense of teenage years, we quite often say, what can we do in early intervention and prevention at that age? What we do know is we actually need to get into those young people and their families in the first 2,000 days if we're really true to prevention and early intervention. So that's why we've announced the $20 million out of budget 2026 to look at how we scale up not only our specialist maternal mental health services, our peer support lived experience, but also more prevention through community and NGO services, and a significant funding into the new bereavement pathway to support those parents who have sadly been bereaved by baby loss.
Thank you, Minister. I've just got two supplementaries.
That's all right.
One around the YOSs and then one jump into the pre and perinatal mental health because you spoke about it there. So with the youth one-stop shops, we're hearing around the country that they've got the teams there for work readiness. So the funding is tagged to work readiness, but that there is a lack of funding for counselling for the need that is being shown there, and that there isn't sort of a streamline that goes from a YOS in Rotorua compared to Christchurch. So with the work readiness teams, it seems like those are well funded, but it's the counsellors that they are saying to us don't have enough funding. So within that $20 million, how will that be allocated? Work readiness, it's great. We want young people to be out there, you know, doing these things, but the counselling is where at the youth one-stop shops is also important.
Yeah, look, I can't announce any funding for youth one-stop shops today, but around the pressure of youth counselling, what I also point out to is actually there is capacity within the Gumboot Friday contract of seeing 15,000 young people a year. And when you look at the Youth Access and Choice program, there is definitely capacity within that. So that's part of joining up the system. So when people do have demand that they can't sustain, that they look to available services to support those young people in a time of need.
Thank you, Minister. And just one more supplementary with the prenatal health. And thank you for looking at that and putting budget vote into the pre and postnatal health for the first 2,000 days of young whānau's lives. Because what we're hearing is that there are touch points throughout, say, a pregnant parent's life and pregnant parent's pregnancy, and that they are not getting the care, and then they get into crisis level, and then that is when all of the services come around. So what is going to be happening in those first touch points where people aren't getting to crisis level and having to be put into institutionalized with a newborn, you know, which isn't ideal.
No, that's right. And that's why we do want to invest more into prevention and early intervention, specifically in the first 2,000 days. So it's not only bolstering our specialist services, so mums and dads will have more timely access, so they don't have to wait till they get in crisis. But also within that, there is $1 million community fund to support our community and NGO and iwi providers as well. So we're ensuring that we do build out along that continuum, because we do know the more resource we can get upstream, then we can prevent people needing crisis services, but more expensive crisis services. So it's better for the taxpayer and actually better for the individual themselves.
All right,
Minister.
thank you. We've got primaries from Carlos and then Vince
Thank
Tracy.
you. Thank you, Chair. Minister, last year as mental health packages, we actually spent a lot of funding on or to operate or at least open at least 6 crisis recovery cafe. So how is it work? Can you give us a little bit update? You know, how many people have been using the services and what is your future plan? On this initiative.
Yeah, it's part of the mental health plan that
Thank you. We've got primaries from Carlos and then Vince
Thank
Tracy.
you. Thank you, Chair. Minister, last year as mental health packages, we actually spent a lot of funding on or to operate or at least open at least 6 crisis recovery cafe. So how is it work? Can you give us a little bit update? You know, how many people have been using the services and what is your future plan on this initiative?
Yeah, it's part of the mental health plan that not only do we want faster access to support, but more frontline workers in a better crisis response. What we do know with the use of our peer support lived experience workforce, that's a workforce that's ready to go. We can stand them up quite quickly, and it's a workforce that shows it gets real results. When I opened the new peer support lived experience service in Wellington ED, one of their workers said it was quite timely that she was now there as a worker because she had been to ED herself in a time of crisis. I think the ability to have someone alongside of you who's been there before will make a real difference. Not only that, when you think about the peers in ED and also the crisis recovery cafes that are peer-led as well, we're rolling out peer support lived experience workers in eating disorder services, now in maternal mental health service as well. They'll be all joined up. What we do know with the crisis recovery cafes, quite often they are going to pick people up from ED. If you think about it, when you're in a crisis, the last place you want is a brightly lit, noisy place with a lot of people. And so what they're getting in a crisis recovery cafe is a non-clinical service, something that is more suited to their needs, getting the support they need. And I think that'll be a real game changer.
So I'll be expecting more crisis response cafe being open in the next 12 months?
Yes, very much so. Recently been down in Christchurch, where we opened the first crisis recovery cafe there, Dunedin after that, and we're looking to roll them out across the country.
Thank you.
Tracy, then Jenny.
Facilities, and let's start with Hill Morton, something we're both familiar with, and for some time we've been hearing about the plight of staff at Hill Morton. The new facility is now not expected to open until late 2027, I believe, but correct me if I'm wrong. Will all of the 80 beds be staffed and funded from day one?
Yeah, we'll look to transition into that. If you look at the experience of Palmerston North, even the Mason Clinic, it does take time to transfer patients. Of course, when you think about the models of care for the staff, it's ensure that they are prepared and they go through training for a new facility as well. So for me, it's not necessarily the speed we do something, it is the safety we do that as well. Of course, we will need beds open that match the number of patients that will transfer into that. And we're committed to ensuring that we have a better level of facilities. I do want to acknowledge the last Labor government that started off that significant investment into new mental health facilities as well. I mean, they are quite literally, I think, a game changer when you think of the very tired state that people in mental health inpatient facilities had to endure when they were there to get well. And thankfully now they go to new facilities that are therapeutic. So we're really committed to that. We know there's real pressure across the system, but it's ensuring that we get the right beds in the right place.
Okay, so in regards to other builds, are there any other builds or upgrades that have also been delayed? And have you got any indication via this budget 2026 process about when those kind of opening dates will be?
Yeah, none that I'm aware of, but I'll open it up whether Dale or Audrey's got anything to offer there.
No, not aware of any.
So you're not aware of any other delays?
Hmm.
Okay. You also, we haven't really touched on addiction services and the 3-week referral date. No,
Yes.
to be seen within
3-week target. Yes.
3-week target.
Yes.
So at the moment, only around about 3/4, I see, of addiction referrals are being seen within that 3-week timeframe, which can be worse than other mental health referrals. So what in budget 2026 do you think is going to address that gap?
Yeah, well, sometimes it's not actually more money. And one of the reasons I set the first mental health and addiction targets in New Zealand was to have an expected level of service that I thought Kiwis wanted from their mental health and addiction service, but also that in a level of accountability. And the reality is now that the level of discussions that we're having with executive regional directors responsible for each of the 4 regions around the mental health targets, I even met with them on Monday, is now we can push into the 20 health districts. We can look at data, Māori, Pacifica, Asian, rural and urban and age groups. So yes, our expected level of service is 80%. Nationally for 1 week, we are at 84% and specialist at 82%. But I've always been very clear, I'm not happy with the national average. And when you look at the 20 health districts, there is variation. And you are quite rightly pointing out the variation for addictions as well. So part of the responsibility now for the executive regional directors is quarterly they prepare action plans and improvement plans that show how quarter on quarter they are going to increase the wait time so they meet those targets. And that's what I'm holding Health New Zealand to account for.
And you're still quite satisfied with wait times being the way to operationalise effectiveness and efficiency?
Well, I'm no target fundamentalist, but actually what it does is put a line in the sand that allows me to have a conversation with executive regional directors to say, if you look at an area we're at the moment, Capital Coast, how are you going to improve to ensure you get the targets? So for us under this government, it's about pushing back local decision-making to the front line around service delivery, budgets and workforce. And I think it's actually going to be a real game changer around postcode lottery, because for the first time, we can drill into specific communities and measure them against a national standard. Then my expectation is Health New Zealand works with not only their own services, but NGO and community and iwi services to ensure the services there that speeds up that access to that national standard.
Thank you, Minister. My question's around what's happening in the rural communities in terms of mental health support. Can you give us an overview of the work you've been doing in that area in light of, we've just come back of field days and some of us may have gone to the Rural Support Trust evening event, which was raising money, but also showcasing or highlighting a particularly grim story from a woman and her family and the impacts of suicide.
Yes, very much so. And we do know the pressures and need on our rural community and our farming community specifically, and the pressures faced on farm as well. And like you, just to acknowledge the great work of our Rural Support Trust, quite often volunteers. And that's why the government was keen to commit $3 million to support Rural Support Trust. They can do great navigation work into our primary and specialist services. And the good thing, just following on from that last discussion, is having the targets and the ability to pull out rurality and urban. That's the first time under the Geographical Classification of Health, the GCH, we can do that, which allows us in districts and regions to look at performance for rural communities that isn't masked by better performing urban areas as well. And that'll be a game changer. But what's quite interesting is rural and Māori quite often outperform other areas in those targets as well. So sometimes it does challenge to say, actually, we're doing a good job in some areas. And when I talk to executive regional directors, they can learn from each other about the areas that are performing well and also the areas that are not performing as well. But there is real challenges when you think about the geographical isolation that people do experience on farm. And that's why the question before about, you know, do you stand by your targets around efficiency in the best way? Well, the reason I think they are a good way of delivering performance is it's not for me to get on the shop floor. But by setting a clear guidance and expectation, when I go around the country, especially in rural communities, they're talking about things like telepsychiatry, singular intake systems. So they can come up with their solutions about how they ensure people in their communities get that care. Might be a hybrid in person online or more online through Starlink. So it's great innovation out there.
Right, just final, you mentioned in the budget $28 million for 150 FTE relating to a new role called psychology assistant. Can you just give us a brief look at what that role is? What will they do? And is it a graduate role through the education?
Yeah, look, we're really excited. The problem definition in New Zealand is that the reason why we weren't keeping up with workforce is we didn't have a plan. So we published New Zealand's first mental health and addiction workforce plan in our first year in 2024 and tagged $44 million to it as well. We've also committed to doubling the amount of clinical psychologists in their internship training, taking it from 40 to 80. We're currently sitting at 74 against a target of 70, and also increasing psychiatry by 50%, taking first year intake from 33 to 48. But what the data showed is that psychology is one of the most studied courses at university. But when people weren't getting one of those clinical psychology internships, they were disappearing from the field. Right. So we created a 1 year postgraduate, and AUT and University of Canterbury will be the first to open in the start of July. We also know there's considerable interest from other universities. And that's why we thought it was only right for those students going into class in July that we give them the commitment that there is fully funded roles there for psychology assistant, scaling up to 150. So when they graduate, they are going in. Also, I want to be clear, because there was some criticism that we thought we were going to cannibalise clinical psychology roles within Health New Zealand to fund these. And that's why Budget 26 commitment shows we're sustaining clinical psychology funding, if not increasing it, and then new funding for psychology assistants.
Thank you, Minister. We are at time. Appreciate everyone.
Thank you very much.
Today.
Thanks, Steve.
Much and a very good afternoon, committee colleagues. Good to see you all. I've joined by Commissioner Peter Mercy and Head of Policy David Carrigan here this afternoon, and looking forward to the opportunity to engage in some questions. For the past 2 years, the government has been focused on fixing the basics and building the future, supporting economic growth and creating the conditions for businesses to succeed. We've taken a number of actions to support that growth, particularly in the revenue portfolio, and also importantly to ease the cost of living pressures. Some of those examples include Investment Boost, which is encouraging businesses to invest and grow, delivering tax relief by adjusting the income tax thresholds and working for families, Family Boost, helping families with early childhood education costs. We've made changes and strengthened KiwiSaver by gradually increasing default employer and employee contribution rates. And we've restored interest deductibility, helping increase rental supply and choice for tenants. Budget 26 delivers a suite of tax changes to strengthen the tax system and support investment and make compliance easier. A couple of headlines: research and development tax incentive is being improved by providing support to businesses sooner, expanding eligibility and refining settings to better target high value activity. We'll make it easier for businesses to operate by simplifying the fringe benefit tax rules for motor vehicles. Shareholder loans are being strengthened to protect tax integrity, and we're continuing to make New Zealand an attractive destination for skilled migrants, building on earlier changes to the Foreign Investment Fund regime to reduce compliance costs and support retention of talent. We've introduced a cap on donation tax credits to support fairness and the integrity in the tax system. It's important to note that this doesn't limit anyone's ability to donate, including those who give more than $100,000 a year. Advice from IRD and Treasury shows that 99.9% of donors will not be impacted by these changes. This sits alongside other changes to support charitable and not-for-profit sector, including lifting the tax-free threshold, keeping membership fees non-taxable, and enabling in-year donation credits. Mr. Chair, lastly, Budget 26 provides $15 million more per year to strengthen Inland Revenue's debt compliance work, focused on unpaid GST and PAYE, which makes up just under 60% of tax debt and is growing faster than other categories. This investment's expected to get a return of $45 million annually, a 3-to-1 return to the Crown. I'd like to take the opportunity to thank the great work by IRD and officials in this regard. Our tax debt is an area of challenge, and it has increased significantly under the post-COVID period, but our investment in compliance is now keeping that down. The measures that I've discussed reflect a disciplined approach to managing the tax system, supporting growth and targeting help to those who need it most, while maintaining strong control and focus on government spending. With that, Mr. Chair, I'll be happy to take questions.
Thank you. We're going to kick off with Dr. Deborah Russell.
Thank you, Mr. Chair. Thank you, Minister. I want to talk through some of the changes that you announced in the budget. I don't especially wish to talk about the non-resident contractors tax exemption for aircraft. Yes, we talked about that during the budget tax debate, and the same thing with the working for families changes. We went through those as well, and the company loans to shareholders. So we talked through those quite extensively during the committee stage of the debate, which went on for a while. But I do want to talk through the others. It's so the changes to the donation tax credit. Just one question on that, then I want to go to some of the other changes there. You said 99.9% or something like that, or whatever, the donors are not affected by this. But what about of donations?
In regard to the total value aspect, well, obviously the changes that we've announced come in from the 1st of April 2027, so we don't have data in the context of what will exact, but based on the hypothetical of the past, we are aware, as I said, there's about 350 donors that are, based on the modelling that the officials have done, would be impacted. Again, the implication around putting a number on that is difficult, but I'm happy if
So I think
David
you
wants
said
to.
in the RIS, was it 19 million a year or something like that?
So the fiscal cost to the Crown of the change is in the region of 52 to 53 million, around that number over the forecast period. and it
So
goes
that
up.
implies 150 million of donations.
From memory, it goes like 13.5 million in the first year, going up to 19 or so.
Yeah.
Happy to be corrected on the numbers, but I'm
That's right.
pretty sure.
Okay,
off
so
the-
that's about the amount that we're talking about over the, about 150 of donations over the forecast period.
Yeah, correct.
Okay, that's all. That's fine. That's just clarifying that. It's probably sitting in the RIS and I just need to take notice of it. But there were some other changes you announced that day which didn't come through in the budget night legislation. And so I really want to know when they're going to appear. So it's the membership subscriptions and levies for not-for-profits, the change in the threshold there. When can we expect, and the other changes announced there, when can we expect that legislation to come?
Yeah, so the Cabinet hasn't made final decisions in regards to the September tax bill at this point, but it would be fair to say that it is my intent that we would want the changes that we have included as part of that to be included as part of the September tax bill that we will be bringing to the House
So
at
Mr.
that point.
You'd announced it from 1 April 2027, so that would be nice.
Yes.
There are a couple of them are from 1 April 2028. Look, the same question, I'm really interested in the fringe benefit tax changes. I looked at the changes you're making around vehicles, and they look pretty sensible to me. So I know there's the compliance cost of the record keeping there is not very nice. So I was pleased to see those changes. So again, we're expecting that from 1 April 2027. Is that correct? So I would.
Yeah, that's correct. Yeah.
Yeah, so the legislation will hopefully be in the September tax bill. Otherwise, we've got trouble on that one.
Yes, that's correct.
Yeah. But the other one I'm really interested in that one is the change. You didn't talk a lot about it during the budget announcement. It was mostly focused on the compliance cost stuff, but it's around the cost base for electric vehicles compared to the standard default rate. Can you explain to me what advantage that gives to electric vehicles or what happens there?
Yeah, so I can give you a high level overview and then I'm happy for officials to give a bit more of a detailed explanation. But what we're doing in the vehicle space is making an effective premise of close enough is good enough. And there's a huge, as you'll be aware of the complexities with FBT, there's a lot of compliance on people to meet the obligations. In regards to the electric vehicle portion in particular, and I think some of the commentary that we've seen in the market more broadly is acknowledging that actually as a result of this change, there will be a benefit that flows through in the way in which organisations and businesses will be able to benefit from taking up electric vehicles over, in effect, fossil fuel type vehicles, which is obviously positive because fleets are the largest driver of EV vehicles, and the flow through of an increased fleet, which are electrified, has an ability to provide benefits through to the second-hand market as it flows through. In regards to the tax specifics on that.
So I'll be honest, I'll need to get back with the actual detail. I suspect
Look, the standard rate is 22.8%, and this is the cost base. You're shifting it to 17% for EVs. So it's that differential between the 22 and the 17 and the justification for that?
it would have been based on the useful life of an electric vehicle and the cost per year, but I can come back with some detail. And I'm sorry,
No, it's okay.
I can't answer in detail.
I was just, because putting your other hat on, Minister, which we'll talk to you about tomorrow, the climate hat. I mean, one of the things I keep on hearing from managers of fleets and the like, and commercial vehicle fleets, is actually they're interested in EVs, but the cost is a barrier, the FBT cost. So that's not part of the thinking around this differential. It's just based on, you'll get back to me, David.
Yeah, I'll come back. Sorry, I'm apologising.
No, it's okay. Sorry to.
No, it's all good. It's all good.
I think one of the areas, and tax isn't always it can in some areas have a beneficial impact in regards to behaviour, but the context here is really looking at first and foremost the compliance costs that the FBT regime places upon business, and particularly small business, and the fact that it hasn't been updated for as long as I've been alive, and since its inception as well. So actually, that's not factually correct, Chair. I'm sorry, I am older than the FBT, about 5 years, so now I'm giving a cost of my age. But the short answer is it is complex, and we've signalled where we want to make further changes as well. The reality is you'll be aware is the fiscal costs on that are pretty significant on unrealised benefits. And really, it's a capacity to be able to, deal with that fiscal trade-off. But motor vehicles was reasonably inexpensive and has quite high payback in terms of compliance cost reduction.
No, completely comfortable with that. So,
Can I just ask a sup on that, Deborah? Just on the FBT specifically, what sort of feedback have you had on the close enough is good enough announcement, through the, I guess, trades and small business community?
Yeah, I'll give what I've heard, and then I'm happy to, if Peter wants to just give some feedback around what IR have heard from an operational. But it's definitely a case, FBT is regularly raised with me as Minister as an area of compliance cost and burden. And one of the three expectations that I've set as a Minister of Revenue of the department is first and foremost, attract and retain capital, attract and retain talent, and reduce compliance costs on taxpayers. And on the underpinning platform around that is utilising modernisation, technology enablement to deliver this services that IR do, acknowledging the operational independence between the Minister and the Commissioner. Feedback's been very positive around that direction of travel. The other thing that we've done differently, and again, opposition members will be aware, using a generic tax policy process, so not working through with stakeholders in industry, getting feedback, consulting on that. Tax at one level should be no surprises in the context of the policy position. And I think we are in a position now, as from a tax policy point of view, that the industry and the IRD are working together constructively around the points of difference, and we're doing things which have been well considered and have good degrees of input as well, which is positive from a tax point of view, because certainty around policy is a key enablement.
Thanks, Deborah.
okay, thank you. Another one that you announced on budget day was in the fact. Poor David, he's sitting there going, "Oh my God!" As the foreign investment fund changes, so extending the RAM method to all taxpayers. Again, that wasn't in the budget night legislation, but it's going to apply from 1 April 2026. So I'm trusting that's going to be in the September tax bill.
Yeah, that's correct. And I think just to remind, this initiative will expand the access to the revenue account method, which we made some changes last budget, particularly dealing with those that are domiciled, particularly in the US, coming into New Zealand. What we got feedback through, again, quite a lot of consultation around this, is from New Zealand-based investors, founders, startup tech businesses, which are therefore expanding their operations offshore, that the basis to be able to calculate their tax is a benefit. Again, there's a very high degree of compliance costs in calculating FIF. And if you stand back around why we do this, the FIF regime was brought in as an anti-avoidance mechanism to ensure that people weren't able to utilise offshore investments over and above benefit of what a New Zealand domestic investor could achieve. And so, whenever we're doing policy in this area, we're weighing up the tax integrity considerations of protecting the revenue base for New Zealand, but equally acknowledging, most people nowadays will have potentially a Sharesies account or other account. Potentially they may be trading offshore shares, and that's okay, because that's the way things are. But we don't want the burden of compliance to overwhelm the area of the tax integrity and the collection of revenue and getting that balance right. Some of the changes that we've made.
Okay, cool. So last area of question for someone else, if that's okay. The research and development tax incentive. Now, this is a little bit tricky, because yesterday in the supplementary estimates hearing, I asked why there was a $25 million reduction in supplementary estimates in the amount of expenditure on the R&D tax incentive. And the explanation we were given by Treasury, or by whoever turned up, was Treasury, wasn't it? Was that that there had been firms were doing less R&D, and in an uncertain climate, that was a bit of a problem, and that was one of the indicators there. Today, this morning, in the hearing with the Minister of Finance, the Minister of Finance gave us a different explanation, which was that there was a change in the method of accounting for software with respect to the R&D tax credit. And we've also got some stuff coming through in the budget night
I can answer
announcements.
that.
So who was correct, or is it a bit of both? And can you just take us through what this R&D tax incentive?
Yeah, well, how about I take you through the policy position, and I'll leave it for you to do the compare and contrast. But the research and development tax incentive aspect relates to internal software. The number that you quoted, around 25 million, is actually the change that we made reduces the research and development tax incentive cap on non-administrative internal software development expenditure from currently, which is 25 million, to 3 million per business per year. So we've changed that threshold. The fiscal impact of that policy change is in the region of 99 million over the forecasted period. And the change does deliver a fiscal savings, and it also maintains accessibility for small and medium enterprises to get a research and development tax credit, a bit with a smaller cap.
Okay, so Treasury was wrong and the Minister was right.
Well, I not one to. I'm just giving you the facts from a revenue point of view. I wouldn't hear their transcript. But the software rules for research and development tax incentive, as you will be aware, are complex and are burdensome to administer. And so when we were considering, and officials were advising ministers around policy here, those were some of the considerations that were put into play. There was other considerations, which I'm happy if the minister, if the officials want to comment on.
So with, as the minister says, software is tricky. If you think about software that firms develop, it's always been the case that if it's purely administrative software, like a payroll system that's specific to that firm, that should never qualify for an R&D tax credit because the firm's getting all the benefit out of it. So they've got reasons to invest in that anyway. However, there is internal software that firms can make and produce that is a bit more customer facing. So it's not purely routine. And that before this change would have qualified for a full R&D tax credit. It was really difficult to tell the difference. And there was a fiscal risk that if the cap was too high, that people would be relabeling what is actually administrative software, non-administrative software. So that was the rationale for reducing the cap from 25 million to 3. It actually only impacts between 20 and 30 businesses. Some of them in the financial services sector. So for the vast majority of businesses, they will still be claiming exactly the same credit.
Yep. And again, the September tax bill, I take it that will...
Subject to cabinet decision making. It is
actually, it was previously the August tax bill, wasn't it? Something.
Sorry?
But that's okay. It was previously the August tax bill. So yeah, okay.
Oh, well.
Just, I'm hoping it's in the House before the September 24th, Minister. See how
I appreciate your appetite for it, and I will see what I can do.
Thank you very much.
Got a new question from Dan Bidwell.
Thanks, Mr. Chair. Thanks for coming before us, Minister. We've noticed in the budget you've got an allocation for greater compliance activities, I think about 60 million over the forecast period. Can you get a sense from you, I guess, in the past IRD has had some recent success with compliance. How are we going to build on that in this coming year and the forecast period?
Yeah, absolutely. Thanks for that. And I'll pass over to Peter to provide a bit more context, because as Minister of Revenue, is probably one of my proudest areas of delivery by the department in the past 2.5 years. And in effect, what you're seeing here is a post-COVID period IRD resetting its focus around the collection of tax that's owed to the Crown in order to fund public services. And every dollar that we don't collect that is owed to the Crown, we have to source from another source, or we have to borrow. So there's a real big incentive. Tax debt as of March of this year is sitting at $9.4 billion. I'm excluding the social taxes. And when in June of 23, that number was 5.8 billion. So a 62% change. In 2024, the increase in debt curve basically peaked, and it has started to go down. And so What we saw between last year and this year is the total tax debt has gone from 9.3 billion last year to 9.4 billion this year. So you've seen, in effect, for the first time in a long period of time, the flattening of the trajectory of the debt curve, a bending of that curve, actually looking at some of the recent data coming through. And that is a result of the IRD, in effect, getting back to basics around enforcement and compliance, and the funding that has been allocated to that has obviously helped that. But as anyone would appreciate, it takes time to rebuild capability and experience. And I was lucky to be with IRD in before 2000, and so in that period, a lot has changed, but some things haven't. But one is very much the case that institutional awareness and understanding of investigators and that compliance and the softer skills of how to collect and debt, combined with the way in which technology is now available, which really plays into the opportunity it has been. So I think it's been a really key aspect. Student loan debt for offshore is also a key area. The department are now utilising multiple tools. And of course, though, the department's first avenue always is to prevent someone going into debt in the first place. And the tools and mechanisms around arrangements and payments and stuff has been a key area of focus. Equally, though, one area that's a major focus is organised crime. And the department worked very closely with police and customs and other agencies in the area because, as you will appreciate or may not, you will appreciate, because I know you do, that organised crime and the funding of organised crime, the department has tools and ability to be able to disrupt that, and that is the core focus as part of that aspect. Not to disrupt organised crime, but to disrupt taxpayers that are evading or not paying tax and not meeting the law. I'm just saying that surprisingly, those type of entities generally do like to evade and avoid. So it's been, I don't know, Peter, just from your assessment.
Just to add a couple of statistics to that. So at the moment, 90% of all tax is paid on time. Importantly, I think over the last 12 months, we've seen an improvement actually in the GST and PAYE payments that are made on time. So that's gone up from 94.1% to 94.8%. So it suggests that some of the campaigns we're running up the front end are actually stopping people from getting into debt. That helps explain that 2% growth in the gross debt book we see. Also, the size of debt that's less than 6 months old is also reduced. So that's sitting at about 4.4 billion of that $9 billion. That compares to 5 billion a year ago. So that's a combination of the work we're doing up front, encouraging people. But the more active element of compliance, we've been, as you know, over the last 3 years, we've received additional funding for that. That activity is both in revenue generating the side of it. So over the last, for the 3 years ended March, from July 24 to March 26, 2 years, sorry, we had a target of 1.9 billion. So that included the amount we were expecting to generate. And we've brought in about 2.7 billion. So quite a bit more. Debt, our target was 7 billion and we've brought in 7.2. And with overseas student loan borrowers, the target there was just under 400 million and it's now 476. So there's a whole range of activities that have gone into generating that, but generally positive response and support from the public, I think, for that more active engagement.
Positive news. Thanks, Peter and Minister. I guess not everybody likes the taxman chasing up debt. So do you both have any advice for either businesses or individuals that are in these circumstances and what they should be doing? Because we get anecdotal feedback all the time saying, oh, geez, I'm getting chased up by IRD about this. And so I guess, what advice can you give to them on how to manage their debt with IRD appropriately?
Well, I think first and foremost, and I'm sure across the political divide, people would agree that the men and women that work for IRD are considered some of the best public servants in the context of their capability, experience, and the role in which they do. And the IRD is one of those departments that has had that legacy for a good period of time, and the Commissioner and I regularly discuss to ensure that we're not resting on our laurels of that position. And also the fact that it has access to some of the most sensitive taxpayer data of any department, and the importance, I think, and again, from a bipartisan, of protecting that data set on behalf of New Zealand taxpayers. So, the key aspect from my point of view as Minister is to ensure that for those taxpayers that are deliberately looking to evade and not meet the legal requirements that they are around paying tax, that the department has the means and mechanisms to ensure that they are meeting the law and undertaking the enforcement activities that are required. The operational independence of the department then progresses and executes that agenda, but increasing compliance activity, reducing compliance burden on taxpayer, because again, reducing the compliance burden such as fringe benefit tax, which we talked about before, may mean that it's simpler to comply, and therefore people don't inadvertently get into a position of tax debt because of mechanisms outside of their control. Increasing de minimis rules, such as we've done as well across the board, have a benefit from a tax integrity point of view of reduction in risk exposure for tax debt, but equally reduce compliance costs. So they're both intertwined. I think one of the areas that's most interesting, and the department might want to comment, is just with the advent of technology, with AI, the way in which taxpayers and New Zealanders are utilising tools such as that to get information. The IRD in particular is very aware of the need to modernise and to be in a position where it is able to work and interact with New Zealanders in a way in which supports the technology that they're using. We used to talk about intermediaries quite a lot in tax, which was sort of like a tax accountant working with IRD on behalf of clients. You can fast forward 3 years, even in some point current state today, a lot of interaction with the department is through AI agents on behalf of taxpayers. And so the whole model is changing. IRD are absolutely aware and I have active programs to modernise, but I think it is just a good example of where technology deployment is coming into play, and IR in particular probably the front line of some of that technology deployment. And when you're protecting the revenue base of the Crown, there's obviously risks and benefits around that, because one of the benefits of the New Zealand tax system is that it is reasonably simplistic in the context of other jurisdictions, think US, even Australia now, with respect to their changes. And simplicity has a low compliance burden, but equally it is something that we need to, it's an attractiveness for us in terms of investment and retention of talent. So.
Thank you.
Sorry.
No, I was just going to add one other point too, that I think in answer to your question in particular, I think if we will often try and contact businesses or people if we think they're behind in some way. The best thing they can do is contact us. And if they do believe that there is an issue, a voluntary disclosure, again, is the best way to, I guess, position the conversation. So, we're not deliberately trying to catch people out. We want to help people get it right. I think that's the catchphrase. And we're trying all sorts of things. We have recently put in place an agentless calling process where we'll have an outbound call that's essentially automatically generated with a targeted message saying, look, it looks like you might be behind on X. Pop on and have a look at your My IR account. We ran a pilot of that in December and we had a 30% response rate. So we're looking to roll that out because it's just a nice, easy prompt to say, look, there might be something on, just go in and check.
Good, thank you.
We've got a
I
supplementary.
just want to stop on this because it's really interesting stuff as to all that, but I'm just looking at the actual budget document. And in terms of services to manage debt and unfiled returns. So the budget and actual but last year was 147 million. But in the coming year, it's 127 million. So this is all fantastic work you're doing, but the budget has been reduced by $20 million. Do you think that's going to have an impact, or what are you doing to work with that decrease?
Yeah, I'll start off and we'll get into it. I mean, as part of the expectation letter that I've sent to the Commissioner is a heavy focus on uptake and increasing and accelerating the uptake in the use of technology in order to undertake the operational service delivery that the department does. Obviously, transformation, as we all know, was done a while ago. That seems a long time ago now, and we're in a different generation of technology, particularly when we talk about AI in that context. So a major focus in expectation from the Minister of the Department around uptake of technology and also making it easier for other technology intermediaries that deal with IR to make it easier to work with IR. So the department's got quite an active program around intermediaries as well, which is important.
But it's nevertheless, it's a 13% reduction in funding.
And so part of that is also about and you would have seen during the past year, we actually made changes within the appropriation between debt, and that's really us managing our resources to get the best outcome. So we've got a bunch of targets, whether it's around revenue generation, debt reduction, and so on. So during the year, depending on how that's going, we might end up putting more resource into one part than another. So I wouldn't read too much into the line itself in terms of the amount of effort that will ultimately go in, because it depends on what we find as we start to do that work. We will ultimately move resource around, which might have a consequential impact on the appropriation, the line within the appropriation.
Okay, but I mean, even if we look at that multi-category expense, it's a reduction from 786 million to 771 million. So
yeah.
I mean, I appreciate all the departments are making baseline savings, but
Yeah, so some of that reflects time-limited funding. So, for example, we were given some time-limited funding to do some work around when Family Boost was put into place, and so we knew that was going to tail off. So some of that is also reflected in the bottom line that's coming out.
Yeah,
coming out as well. So it's a combination of ups and downs.
The other fact, as you'll be aware, is that actually when the department improves the compliance up front, then we actually see that the debt, you've seen this with the debt curve reducing. So, more upfront investment that we do, say last year, plays through to less people getting into debt this year, and therefore less activity required in order to chase that debt. So there is a correlation between the timing of intervention and the flow through of that in terms of taxpayer behaviour, particularly around unfiled returns and around debt that needs to be chased up, and therefore the resource implications around that. But I'm not saying you do, but there is the overlay of technology, and maybe the Commissioner could give a flavour of what's happening in the call centres around, the way in which technology is being used because time to answer the call is obviously a key issue with IR historically, but maybe just some context.
We love Dave Dobbin. Sorry.
Love Dave Dobbin. As I mentioned, the agent was calling as one use we're putting technology to. Another one is in our call centres, we've adopted a post-call summarisation tool, which is part of the Genesis suite of products. And what we found in the pilot and what has proved as we've rolled it out is that A, our staff find it really useful, and B, we've identified basically a 17% reduction in the amount of time spent on the post-call summary. So that's that post-call summary is really important because it captures the key points that we came across through the conversation and the key actions that are required. I can't remember the exact number of minutes, but it's gone from something like an average of 11 down to 9 or something like that. But it's a 17% improvement. So those sorts of technologies are really good ways of being able to free up our staff to do what is most valuable, which is in that case talking, picking up the next call or responding to the next email.
Thanks, Sam.
Just to sub on that for primary, whenever I can, Mr. Chair. Just on that point in particular, you'll probably be aware with how much most people in the world hate chatbots and talking to the AI or generated voices on the phone. Can I just guarantee that that's not something that's in the immediate future for IR?
So I talked about our agentless phone calls. That is essentially sounds like a recorded message, but it's basically saying, look, this is a recorded message that's just reminding you might want to pop on and check. But when someone phones us, no, we have real people on the end of the phone.
And there's no intention through the kind of transformation plans that are being prompted.
I don't know what the future holds, but no, we don't have a program in place at the moment looking to replace our phone call responses with something else.
Okay, we'll take that as hopefully that's not in the foreseeable future. Further to that point, and the application of AI and I guess the real privacy potential implications and the kind of data sovereignty point. I was exploring this with Treasury and with the Minister of Finance earlier. I guess what guarantees can you give us that this data will stay in the country? What kind of rule are you running over?
So we take, and obviously tax secrecy is primacy for us. So when we look at any AI product, the first thing we do is we'll test it within our sandbox. And part of that testing includes what data it's going to draw and where that data will go. The AI that we deploy is within our sandbox. So the stuff that we have within the organisation that is drawing on organisation data stays within the organisation and cannot go out. So, for example, we have deployed Copilot across most of the organisation, but there are two boxes you can go in. One goes to the World Wide Web and you can ask it general questions. What's the tax rate in the UK? But the moment you want to use any data that is held by inland revenue, you have to come inside the tent and you can't then go out again with that piece of information. So we take that really seriously, and anything that we are looking to put in production must have gone through both a security check and a governance check to make sure that the data is secure and our people are trained on how to use it.
And just to confirm, is that all happening in-house or is that through the Parliamentary Services Commissioner? Where is the line? What is the...
Yeah, so that work we do in-house. There are times when we will work with a third-party provider. So obviously when we make changes to the tax system to start, we need to we do testing, and the design of those testing scenarios can be quite intensive. So and that's a product that we've outsourced that, but we've worked with that outsourced provider to adopt AI. So AI now writes the first run of those test scenarios, which a human then checks. That's improved the efficiency by almost 90%. That doesn't draw on inland revenue data. So for those things that we are deploying internally, we will test and determine internally, and then share that knowledge with other agencies. I referred to the call summarisation product. We've been talking to ACC because they're on the same platform and use the same tool. But we will also work with third-party providers on products that will help us as well and will help customers.
Just a new line of primary questioning through the chair. Minister, do the so-called tax minimisation practices of the big tech companies who are currently making hundreds of millions of dollars off the back of New Zealanders, do those tax minimisation practices concern you?
So the role of the Minister of Revenue is to ensure that the tax policy that is set in regards to taxpayers in New Zealand is aligned with expectations and is doing the job, which is the collection of revenue and protecting the underlying tax base. In regards to the way in which the department deals with the enforcement activities of different types of customers, including large significant enterprises such as you're referring to, that is an operational matter. I'm happy for the Commissioner maybe just to give context around what activities are underway in that significant enterprise area around perceived avoidance and evasion, which is, I think, what your question is.
Yeah, so certainly we take anything to do with avoidance and evasion very seriously. I think what you're referring to is more where firms are domiciled offshore. And look, we're actively working with international counterparts, the likes of the OECD work around, as a complete system, how do we tackle that challenge? Because it's very difficult for any individual sovereign state to resolve that. And that's certainly what we're seeing around the world. So we will work to ensure that companies that operate within New Zealand, meet New Zealand's legal requirements, but there are some issues which are best dealt with at that multilateral level, and we'll continue to sort of
So I
work on
guess,
that
yeah,
from a
those
policy
practices that
perspective.
you are referring to are that currently kind of local subsidiaries of these massive multinational companies are paying service or license fees to their own offshore subsidiaries. Can I just confirm, Minister, is this something that concerns you?
What concerns me is that irrespective of whether you're an individual taxpayer doing an Airbnb from home or you're a multinational company, you should, at any area of that spectrum, be meeting your tax obligations in accordance with the law. And if anyone along that spectrum are not meeting their legal obligations and are evading and avoiding law, then they should and will be getting a call and a visit and interaction with the department, because that's an erosion of the tax base in New Zealand. So if there are instances where taxpayers are doing that, to your point, then I would be concerned about that, but I am more equally confident, based on the assurances that the department give me, that their program of compliance activity covers all spectrums from significant enterprises down to individuals and everything in between. The area around the way in which companies do move profits between jurisdictions is one in which is complex, however, is well understood in the context of how those firms do so. And I think it'd be fair to say that those entities that are operating in an international area will be very aware of what the rules are. The challenge, I think, here is that the points of difference between, say, the New Zealand system and other jurisdictions, and particularly where we don't have a double tax agreement in play, that's where we can get some aspects of challenge. And likewise, other jurisdictions are equally trying to protect their revenue base. And you see this with other jurisdictions. That's why the OECD, a bit like climate change COP, but it's a tax version of that, is a negotiation, but it's a consensus position around tax and where it lies, and everyone's fighting for protecting their base. But New Zealand sits at that table alongside our colleagues, particularly Australia and Canada and other like-mindeds, and fights for what we believe is right.
I mean, there's been a very compelling case made by the likes of Tax Justice Aotearoa that it's not only entirely consistent with, but actually would be as stipulated in the New Zealand-US double taxation agreement for us to, for example, apply the 5% withholding rate to what could be considered royalties in the sense of those servicing fees and licensing fees. Has that at all been something that's been investigated by the IRD?
I think that starts to become an operational question about how and where we can identify something as a royalty as opposed to other forms of payment. So, as the minister's already implied, we will enforce the law, but aspects like those sorts of questions are questions that are very specific to individual cases, and we're driven by, if you like, the interpretation of the law as it relates to that individual circumstance.
There is in the situations where a New Zealand subsidiary is paying a license fee or a service fee back to its parent, that everything else being equal, that fee will be deductible to the subsidiary, which will reduce their profits. The real question for us, aside from working out whether it's a royalty or not, because that is a legitimate question, the real question for us is the price that's being charged an arm's length price? Is it one that a third party would pay in the market? And that's a transfer pricing question. And we've got we're pretty good at transfer pricing here in New Zealand. We've got quite good expertise. So our people would be looking to see whether that service fee was a market price, an arm's length price.
Which is
and it's always a conversation between us and the taxpayer.
Can I just clarify? I mean, the point I think you're getting to is from my point of view and from government's point of view, I don't care who you are or what you are or where you are in the context of that. There is no safe harbour if you're not complying with the law in regards to tax, big or small. Everyone is within the net, and my expectation is one of which we enforce the law equally no matter where you sit. So there's no safe harbour for any players in this conversation, and the department exercises its integrity in the way in which it undertakes enforcement, from organised crime to individuals to whatever, in a way in which is aligned to its objectives, which is collection of revenue for the Crown, doing so in a way in which is economic and feasible in that context and other ranges. But there's no safe harbour for anyone in this game. And part of the reset around compliance funding is to reset that actually, if you're not meeting your obligations, then you shouldn't think that it's a free lunch in the context of that. You will be getting contacted by IR, and your expectations is you should be compliant with all. And 90, +% of New Zealanders comply. We're talking about that slither that don't, and those ones are the focus of where government have set expectations of the department.
We've got
Just
last up then.
Yeah, I mean, just I guess to reflect back what I'm hearing, and to that point, I'm trying to pass through, the arm's length pricing that becomes incredibly difficult in the context of vertical integration and oligopoly behaviour. But anyway, I guess, Minister, what I'm hearing from officials is particularly the point that there is some level of ambiguity, and there is a lot of kind of technical work that has to be done to discern whether this constitutes revenue or royalty or whatever we want to call it. And there are plenty of times when government has come in and made the requisite political decision to provide that clarity, which is why I asked you initially the point, because this is a matter of policy, priority and policy. If you are to genuinely believe that point that you were making before about the equivalence between the little guy and the big guy, why have you not contemplated giving direction to IRD or progressing policy work or legislative change to make it clear that you will either apply that 5% withholding rate to the practices of these big tech companies or look at alternatives?
Yeah, so the operational independence between the Minister of Revenue and the IRD is very clear, is that the policy decision around tax policy and the drafting of that legislation, the policy decisions, lies with the Minister, and the operational delivery of that tax legislation to taxpayers is the obligation of the IRD. I can't direct IRD to focus on this group of people over that group. That is not within the bounds. But what I can do is, where we are made aware of potentially areas of gaps in the legislation that may not be aligned with the expectations or objectives of a government, then we will do it. And we do a large number of remedial changes in every tax bill around, based on feedback that we get from stakeholders across the country. So I guess the message here is if there's an area of perceived weakness within the legislation in regards to a specific area, then that's something that should be and would be welcomed by IR from a policy point of view to take a look at. And we do so with a wide range of stakeholders.
My point was whether you, as the Minister, will do it.
Sup from David, and then Tom on the same issue. So
may I come back to that?
Okay.
So I've been made aware of what you might call an anti-competitive practice. And just, we're all in supposition now, but we have two related things. One is loan to shareholders, as the other is donations to charitable purposes. And you can start to draw the threads together here. So we can loan to Company A, loans to shareholder B, who then donates money to charitable purpose, who then provides finance to Company A. Along the way, there's a refund, and at one point in that, the charitable purpose does not pay any tax. And essentially, you're undercapitalising the business practice so that you can keep your margins slim. So it's come to my notice. I'm not sure how we address this, and I'm not sure whether or not you can address that, but I'd be interested to know how you would.
I love the fact that we're sort of workshopping different tax structuring ideas, which are either right or wrong. It's probably not the
pretty
basis
serious
of
for the people that are involved.
There is a mechanism. One, I can't speak on behalf of whether I are aware or not of these type of things, which we wouldn't necessarily be talking about here. But the first and foremost is as and where we're aware of an instance or a practice that is not in accordance with the law, or people have questions of whether it's lawful or not, IRD do have very clear mechanisms and channels in order to receive such information, and will consider that. And likewise, any member of parliament can write to the Minister of Revenue on behalf of the constituent or such around a matter, and I would pass that correspondence on to the department. So I'd suggest, Dr. Wilson, that probably would be the most appropriate avenue for that scenario, just to give you comfort that maybe either that's under consideration, is aware of, or if that's not the case, then what pathway forward is. But let's stand back and look at it. This is about fairness, and we do not want to position where people are not complying with the law and taking actions in regards to that which aren't aligned with that. That's not right. That's not fair, and we want to make sure we're dealing with it.
Thank you. Supplementary, Todd Stevens.
Mine, and probably this is for Peter or David, just to go back to this multinationals and whether they're technology companies or other multinationals, and you touched on transfer pricing, but it's probably worth just teasing that a little bit, because those companies take their obligations pretty seriously, and you touched on it, but it's probably worth expanding on. They actually having a dialogue with you quite often to make sure they are meeting the obligations. They're not just off doing stuff in isolation, not having those discussions, right? And you touched on taxpayers having a dialogue.
We are pretty active in that space. So, yeah.
Can we just give a bit of context around some of the stakeholder mechanisms that you have in place to deal with different groups of taxpayers to get feedback and concerns more formally?
Yeah, so we have regular meetings with the corporate taxpayers group where they raise issues on behalf of their members. We also talk a lot to the CANS, Tax Justice Network. We talk quarterly, I think, and various stakeholders have basically got a line into us. So we're doing a lot of engagement, and that's just from a sort of policy perspective. They'll identify, for example, remedial changes that they want. We'll consider those. We'll get intelligence, like Dr. Wilson mentioned, and we'll look at that, see whether there's something going wrong with the tax system. And we have, as you know, we have at least 2 bills a year where we fix up a lot of this stuff as part of remedial changes. So that's kind of a little bit of a flavour of how we do it.
I think as Peter said and the Minister said, regardless if you're a big taxpayer or a little taxpayer, you're actually having individual conversations with taxpayers about their obligations to make sure that they are doing that. Yeah,
and it's important to reinforce again that the vast majority, virtually all taxpayers in New Zealand, big or small, comply with their legal obligations. We are talking about a small sliver that do not, and those are the ones that enforcement and compliance activities is focused upon.
We've got a final step from Barbara on this.
So given we're just sort of talking about offshore multinationals and who obviously raise revenue in the country, Minister, last year you discharged the digital tax bill. And at the time, you said because you were comfortable with the progress by the OECD and other countries. Can you give us an update on how those discussions are happening, and has there been any progress since last year?
Yeah, I'm happy to do so. And I think, remember, we're aware that process and progress at an OECD level is at a pace at which is not always the pace at which we would all want or desire. It has its own cadence, which is generally slower. And that's because of the fact that getting a consensus decision amongst 195 countries is challenging and complex at best. But David, I don't know if you want to give us the latest on the OECD conversations around Pillar 2 and Pillar 3.
So Pillar 2, which is the global minimum tax, that is made reasonably good progress. Many countries have adopted that. And the idea there is that it basically provides an incentive for countries to ensure that their company tax has an effective rate of at least 15%. So that's been adopted. There's been the US, there were discussions with the US on that, and there is an exception that's been made to the US because they've already got domestic rules that essentially roughly do the same thing. So the OECD got comfortable that their rules were in line.
Digital service tax.
So on the pillar one, which is the basically the issue of often big tech companies not having permanent establishments in the countries in which they operate, and as a result, those market countries potentially raise less tax revenue. It is fair to say that pillar one, the multilateral approach, has stalled. I think that's pretty public knowledge. Hopefully, it will kick off again. A multilateral solution here is always going to be better than each country doing its own thing. If each country does its own thing, you end up with a cottage industry of taxes. You get double taxation happening and a lot of disputes. So we still are of the view that the multilateral solution is better, but I'm being honest. The pillar one multilateral discussions have stalled.
Thank you.
Have we put pillar two in place here, David?
Sorry?
Have we put pillar two here? It is in
we
place.
did.
Yeah, I was just going to say, one of the areas just off the back of that, Barbara, is that the department acknowledging the multilateral is the ideal solution, are equally stepping up efforts to work with like-minded, as you think Australia and Canada, who we generally form a pretty strong consensus around. And so in the background, in addition to that, there's also a second line of active dialogue around how do like-mindeds do that. And that's something that we've talked about, because no progress isn't necessarily satisfactory, but we've equally got to be realistic about how quickly these international things. So is there things and actions we can take? And IRD has always been and continue as well respected on that stage. And so that work's underway as well.
Yeah.
Thank you. All right, we've got Nancy Liu.
Thank you, Chair. Thank you, Minister, for appearing before us. I have two questions that are interrelated with each other. So my takeaway from Budget 2026 is that you, as the Minister for Revenue, is focused on providing simpler tax system for everyday New Zealanders, particularly, for example, our 95% of the small businesses. So it's easier, it's less technical tax, and reducing the compliance cost and make it easier for people to get along into growing and hiring and serving customers. So my question is, what are some of you talked about the FBT, but what are some of the other compliance reducing cost that you're implementing, and any further opportunities that you can make the tax system simpler and easier for our day-to-day New Zealanders? And then I have a second question. Thank you.
Yeah, no problem. So look, Budget 26 had a range of initiatives in the tax space, which are primarily focused on the objectives that I outlined at the start. And we've talked about a few of them today, but a couple that we haven't touched on, which I think is useful to raise, is that we did also make some changes around financial arrangement rules and amendments to support new migrants. Again, it links back to that core pillar of attracting talent and attracting capital. We did some changes in terms of increase to the in-work tax credit in response to the Middle East situation, which was timely. We've talked about the non-resident contractor tax modernisation. It'd be fair to say we receive a lot of feedback from businesses across the board of the compliance costs and the challenges around that. We made some changes in regards to aircraft, which anecdotally, from feedback from Air New Zealand in the public space has been positive, which is good because that's a challenging area, but equally the compliance cost of that tax was creating cost that exceeded benefit. I think thin capitalisation changes for foreign-owned New Zealand banking groups was equally an area. So what we did there was align some of the regulatory changes that the Reserve Bank did with the tax treatment. So we've got consistency in that area. That's actually a revenue gain to the government as a result of that change. But again, it just was in effect a gap of mismatch of the two models. And I guess we haven't touched on too much, but we have done a lot of changes around the working for families. We talked a lot about that through select committee when we passed the bill, but just information sharing is around customs as well with the working for families. Just acknowledging that the better that government agencies can talk to each other, the less administrative burden they have to place on New Zealand taxpayers and consumers, and therefore, that's a positive both in terms of cost and compliance, but also just their ability to get the right information to the right people.
Thank you, Minister. You talked earlier about the Australia tax system and what's happening in Australia. And so I just have to ask, have you thought about introducing new taxes like the capital gains tax or the wealth tax, something in New Zealand to increase tax revenue? Or do you think that the tax system that we have right now and the funding that we have in New Zealand is capable of providing public service for New Zealanders without additional taxes?
Yeah, thanks for the
Who wrote that for
question,
you, Nancy?
Nancy. I mean,
It's my question.
I don't often like to disappoint you, but I am going to in this case, and I will clarify and confirm that we won't be looking to introduce any of those taxes. I think what's been interesting in the Australian context is that, and there are learnings from that in this context, and the Sharesies example of young people having a Sharesies, and the Sharesies is in New Zealand, but I'm just using that as a proxy, and the obligations and implications of around, potentially capital gains tax being applied to, young people who have got, overseas couple of Rocket Lab shares or whatever, starts to go crikey. And I think that was the kickback around that. Again, it shows, and I just stand back, the New Zealand way in which we do tax policy in New Zealand is very different to Australia. They have a lot of policies that they announce but aren't legislated for years, right?
Yeah.
Whereas here, we do a lot of upfront work around policy, and then we pass the law and it's effective straight away. So the certainty and the investment certainty is a key pillar, and I guess this is cross-political spectrum, is a key pillar of tax policy in that area. And I think our focus and as a government is the three areas that I've outlined: attracting and retaining capital, and reducing the compliance burden on taxpayers. And all of those three elements support and underpin the fiscal management approach and the underlying focus on economic growth as well. And those are obviously key government priorities. So the tax system does have some influence in that area. It's one lever. But one of the aspects that we've acknowledged is that the more we can simplify our tax system, the easier it is to apply and to interact with, the more attractive we are as a place to live, work, raise a family and retire, and that's what we want.
Thank you, Minister.
Supplementary, Chloe Swallow.
Minister, could you tell us the difference between a tax and a levy?
Well, the department don't
Differentiate.
we don't deal with levies in this context. I'm not sure if that's questions in scope.
Not in scope, I'm asking.
We deal
is
with
that-
tax at the IRD, so the taxes are outlined within the tax legislation. Levies are generally covered by customs, which is another ministerial cost.
Thank you. We've got a new primary from Tom Rutherford.
Great, thank you, Mr. Chair. I want to ask about the Foreign Investment Fund. I'm keen to firstly get a greater understanding of the changes that were announced in the rules as part of this year's budget for New Zealand investors.
Yeah, absolutely. So we made a number of changes around Foreign Investment Fund, and for those that aren't watching Argentina play football at the moment and listening into this, I'm sure this will be a key area of focus. But the changes effectively make the changes that we've made in effect have led to a perception that in effect domestic investment is less attractive than international investment. And the key aspect here is that we want New Zealand residents who are able to invest overseas to be able to do so without incurring unnecessary compliance burden as a result of that. The changes that we've made basically one aspect of them relates to the de minimis rule, which is the amount of investment that a New Zealand tax resident can make in an overseas jurisdiction. So we've increased that from 50,000 up to 100,000. And it'd be fair to say that particularly returning Kiwis or Kiwis that are operating, will build up portfolios potentially over time. You spend 5 years overseas, it's not uncommon to have an investment fund. But the compliance costs of annually doing a tax return to account for the maybe $1,000, $2,000 or $3,000 of revenue related to that could be twice that in compliance costs for tax advisors to do that. That's simply an unnecessary compliance cost and an uneconomic burden on the department equally as well. So those are some of the things that we've changed. We've also outlined that we're going to make some amendments around making sure that the tax barriers related to the fifth rules that may deter people with skills and capital that we do want in New Zealand are not of a burden that says actually New Zealand's too much of a tax compliance headache for us to move there versus another choice. Middle East conflict's a good example where, as a result of that, New Zealand is seen as more of an attractive place to reside because of other factors, and we have to protect that, but equally we need to make sure that we are attractive. The flip side is the area that's concerned is actually for New Zealand, for Kiwis that have built a business here in New Zealand and often in the area of technology, startups and innovation, and we know there's, a wide range. When the business gets of significant size and scale, particularly it operates in jurisdictions such as the US where it has a presence there, the tax rules can become a deterrence for actually remaining tax resident in New Zealand. And that's a concern for us because we don't want to lose that talent and we don't want to lose that tax revenue that's part of the New Zealand tax system to another jurisdiction. And often other countries are trying to attract those individuals with different settings. We're not going to outpay or outbeat, certain jurisdictions around, what they offer. But what we can do is ensure that our tax policy settings in regards to that are at least competitive and are considered, appropriate. And in areas of the Foreign Investment Fund, which is a top complex and technical area of tax, even for tax professionals to administer, we've engaged with the industry deeply. We've been meeting with the industry over nearly 2 years, getting feedback, getting understanding, and made what I think is pragmatic and tactical policy or pragmatic policy changes to reduce that burden.
In response to it. Well, it's firstly not a patsy and it's not.
I mean, the minister does it very well, but it is time filling and
Also not time filling.
Serious questions, Deborah.
I asked those questions.
I've
got a question.
Let him finish his supplementary, please.
Thank you. Minister, what about the changes that were made last year for migrants and how do the changes?
Oh, for goodness sakes.
Excuse me, I don't make commentary when you ask
That's
questions.
because I ask good questions, Tom.
Well, that's when you're asking the chair.
We've only got half an hour to go.
I'll ask David just to give you a
Sure.
quick update on where that's at.
The changes we made not this budget, but the one before, they were essentially directed at migrants generally, but a lot to do with migrants coming from the US. And what was happening was the US taxes its citizens on a citizenship basis.
Members, please, we've got 25 minutes to go. I'm coming back to you soon. You've had twice the time allocation. Can you please bear with us a little?
Show some respect.
So,
Yes. Yes.
so what was happening for the US migrants coming to New Zealand was there were situations where the US would still tax them because they tax on a citizenship basis, and we would tax them because they're a resident of New Zealand. And the double tax agreement didn't solve the problem. So you had double taxation, and that was putting off US migrants coming to live in New Zealand. So what we did in the last budget, not this one, the one before, was we changed the method that they can calculate their tax, which allowed them to get a credit in the US against their US tax liability. So and that was, we consulted on that with the private sector. So that was the main change we did, not in this budget, but the one before.
Thank you.
Thank you. Quick supplementary, Dr.
Oh, sorry, no.
Okay, we're going
Thanks, Dr. Wilson.
come back to you.
Okay, so a new question. So the standard estimates questionnaire, question 14, IR identifies that some of the significant risks relating to your vote. One of them is capability and capacity of the workforce. And then when you go to question 15, you also say you don't have a specific fiscal risk, but you do say that the general fiscal risk for IR relates to your baseline reductions. So if you look at your baseline reductions from budget last year, that was the 2%, so that was totaling 63.2 million. IR said that it wouldn't have no impact to service delivery from that initial 2% savings. You now are required to see savings of 197.1 million, which is the 10% from 27, 28, 28, 29. What are you, what does your early planning look like in relation to that, given that you've identified those two particular risks, one to capability, two is to reductions? How are you dealing with that? And can you commit to that there'll be no changes to service delivery as a result of those reductions?
Yeah, Barbara, can you just clarify question 14 and 15? Because I'm just looking
Standard
at,
estimates questionnaire.
yes, so question 14 is programs and projects delayed in 26, 27 financial year.
Not the supplementary, the
Oh,
standard,
yes,
so the
yes,
first
yeah,
lot that went
no,
out.
great. Okay, I'll get Peter to cover that. No problem.
Yeah, so it's very early. We haven't done the planning for those future.
10%.
Yeah, we haven't done the planning for that. We're about to start doing that. So I mean, I can't give you a sense for what the choices are yet as we work our way through that. But that's the next phase of work for us.
So when would you start working on it, given it's quite a significant reduction?
Yeah, yes,
In
so-
your baseline and the risks that you've identified?
Yeah, so we'll start as a senior team, we'll start having those conversations in the next 3 or 4 weeks, but it will take a bit of time to work through because I think the key thing will be working out what our choices are. There'll be some investment options we have which might, have positive outcomes. There's obviously some conversations we'll need to have with the Minister and the Minister of Finance about what those all look like. So there'll be a bunch of scenarios, but exactly how that all lands, it's too early to say at the moment.
So then maybe specifically for the Minister. Minister, do you expect them to keep the level of service delivery despite reductions in baseline?
Well,
Will there be any frontline service cuts?
Look, my expectations of the department are outlined in my letter of expectations to the department, which outlines the areas of priority. The way in which those expectations are operationalised is operationally independent from the Minister. But as I've outlined, the priorities around reducing compliance costs on taxpayers, utilisation, modernisation of technology, and the delivery of enforcement and compliance activities is all core areas of departmental delivery, which is in my expectation letter.
That's fine.
Thank you. Chloe Swarbrick.
Kia ora. So you alluded to earlier the point around meeting with, I think, Tax Justice Aotearoa every quarter. That's correct. So my understanding is that their big tech little tax report came out in August 2025. That would mean that you've met with them 2, 3, possibly even 4 times since that report came out.
At least twice, I think.
Okay. I also annoyed you about this last hearing that we had. So I guess just to return back to that line of questioning earlier, like, are you guys saying that you actually haven't done any work on the withholding tax rate being applied to those service and licensing fees since then, including with having had those meetings with Tax Justice Aotearoa, who I know have been arguing for this?
So one of the mechanisms that is clearly signalled is we do publish a tax and social policy work program, which outlines the ministerial areas of focus for the department around policy and action around that. So I think it's a little bit unreasonable to cite the department undertakes policy work in the areas of which is outlined up through that program. We do meet, and I also equally meet with a wide range of these stakeholders. Generally, I'm happy to come back to you around dates and that around the specific group because I don't remember the specific conversations with them. But to be fair to say that we do so in good faith around policy, and as a result of the work that we've done around remedial changes, I think maybe the department could give us how many remedials were there at the beginning of this term versus what they are now, but it's about 80 now, and we've pushed through a lot of remedial changes in that time.
Yeah, respectfully, Minister, this was the point that I was getting to earlier, because I see that there's kind of this consistent passing of the buck, and I don't at all blame officials for this, where you were saying that it's kind of an operational decision as to whether they investigate the application of this withholding tax rate under the law. But then you're also making the point, which was my entire point, that you actually have the ability to policy and to change the law. So I come back, if you can very plainly please answer my question. Do you think that it is unfair that the big tax companies are currently engaged in behaviour that most normal people, and what expert evidence demonstrates, is quite probable tax minimisation, if not avoidance behaviour?
Yeah, so I don't have a view on whether it's fair or unfair. What I have a view on is it compliant with the law or not? And is the law aligned with the expectations that it is being set, and is that being enforced appropriately? You're talking about an area of specific policy regarding a specific taxpayer group. I don't have a specific view either way around that. The department's outlined to you that they are undertaking enforcement activity as part of what they do in their operational sense. We receive feedback from a wide range of stakeholders on policy ideas. We don't progress all of those, obviously, because of constraints of time, but we are working our way through a large area of tax reform policy. Happy to come back to you specifically around that point, around where we are at around consideration or not of that point. And it's priority. It's just I don't have that information in front of me.
Respectfully, Minister, you said it before and I literally wrote it down. So you've just contradicted yourself that this is or is not about fairness. You said earlier, quote, this is about fairness, end quote. So how do you think that it could or should be perceived by New Zealanders that right now we have the IRD chasing those who have loans for small businesses who are in arrears, or student loan holders, as opposed to multinational tech companies?
The IRD has an obligation to undertake compliance activities where activities are not in accordance with the New Zealand law. And the point that you are raising
is that you
is a
set the
question
law.
of policy and the policy position in regards to that, and whether we've made a decision to change the policy and therefore change the law, which then in effect would enable the IRD to undertake an activity or not. We're not at that point. I'm signalling to you that from a point of process, I am happy to come back around that specific area of policy and give you some feedback. Happy to work with you around that and get some context and understanding. There's no issue around that. It's just the IRD are enforcing the current law, and it is what it is.
Okay, we're going to go to David Wilson.
Slightly easier question than the last one. Really pleased to see the increase in KiwiSaver that you're handling through all of the accounts and so on, and great that you actually do the calculation for me. Thank you. And for possibly Barbara's dad. But the one thing that I'm really interested in is, are we seeing tradies, sole traders and small business owners, connecting with KiwiSaver, or are they just kind of not?
Yeah, I'll give you a high level and then the department will give you some context. I mean, increasing contribution rates is an important area of policy focus for this government. I think it's an important area of positioning from a bipartisan point of view that KiwiSaver is a mechanism and a strong mechanism that has been well supported in the context of increasing personal savings. The increase in the contribution rates, employer and employee, to better align with the Australian numbers has been an area, and doing so in a mechanism that is over time is equally been an area of focus. We do know that there are areas of gap in the context of the KiwiSaver and those that contribute. Sole traders and business owners are definitely an area. We equally can see that young people are also in statistics an area which are seeing not as high a degree of input versus others, and that's probably for a whole range of reasons, but it is one group. And the other aspect is women at retirement age in the context of retirement savings versus men because of the maternity leave considerations in that. So those are probably the three areas of, if you look at where KiwiSaver is at, our focus is on contribution rates to increase the size of the KiwiSave fund, but equally acknowledge that the single biggest fiscal liability that the Crown balance sheet faces in the future for, and I'll take a bit of liberty, my generation and below, is the sustainability of the New Zealand Super Fund into the future and the ability to continue to fund it alongside health costs. And so, we're not head in the sand to that reality. I think it is an area of political discussion that we do need to have and acknowledge and work through together, because it will require a degree of, or will require bipartisan support in any of that aspect, as it always had. But the good thing is the change isn't for today. We need to signal a transition of change to a point in the future which reduces that liability. 7 people at the moment for every 1 retiree. By the time we get to 2050, it'll be 2 employees for every 1 retiree. 17 cents of every tax dollar today goes to pension repayments. It's going to be tracking up to 30 cents, and every dollar collected in tax goes to pension. You don't need to be a rocket scientist to work out there's going to be a gap there, and we have to deal with it.
Okay, so supplementary there. My point really is around the tradies or the sole traders and the small business owners, because they're earning revenue. And that's the key one, is how do we actually turn that lot around?
And look, we might have to come back to you with some numbers. I'm not sure what's happening with the trend. I think the other thing with sole traders and small businesses is often they will see that as their superannuation. They'll be looking to build up a business and sell it. So it's quite a complicated story in there, but I don't have the information to hand exactly.
Yeah, so you haven't seen a trend.
No.
There's a good report by Henry and Retirement Commission on that.
Yeah.
All right, thank you. We're down to the last 9 minutes, 10 minutes. Members, Dr. Deborah Russell.
Thank you. Minister, last year, the centrepiece of the budget last year was the accelerated depreciation of the immediate write-off, 20%. And we been waiting to get data on how well it's been taken up. We've seen the survey, but are we starting to get any data in as to whether or not businesses are taking it up?
Yeah, so we'll have a position by about 1st of April of next year, where we'll start to have a more definitive data set. We're obviously getting, as you'll be aware of the filing and the return filing, that there are some returns starting to come through, but the brunt of the information and the collection of information won't be available until next year. Equally, there has been changes in regards to, on the IR10, around taxpayers will be required to put more information into the returns so we can get better information in regards to this area of deduction that will be done. The department has done some surveys, but as you'll appreciate, surveys are an indicative signal, but not definitive based on the tax information collected through the tax return. So we are in that phase, to be honest.
Sure. I appreciate that. It takes time for the actual hard data to come in. Sorry, what have you put on the IR10? What's the?
It's an extra box.
An extra box.
Basically, asking, I think it asks taxpayers, how much have you claimed investment boost? Right. Or what assets have you claimed, and how much has investment boost been claimed?
So we will start to be getting that information in now for those that are early filers, but it's literally just started. Yeah. So because they have until March next year to come, to file, we won't actually have the full data set until the end of that period. So we'll start to see something soon.
Some very small businesses will be filing in July. So
what area from a policy point of view more broadly is the capital deployment across the broader economy, and what are the mechanisms around that capital deployment, and how aspects of tax policies, particularly depreciation, plays into that. That data point is that's why we will have a much better view of that next year. It'll be quite interesting to see.
Great data when we get it. I was just thinking, are you picking up any stuff coming through the tax agents or anything like that if they're asking questions about it, or are they mostly on top about it?
Well, there's a lot of happy farmers at field days that were quite popular, but that's maybe correlated to
the foreign terror payer.
I'm just I met with a number of tax agents when I was in Pyra a couple of weeks ago, actually, and it's anecdotal, right? So you've got to be careful around that, but. First and foremost, the ability to get the upfront depreciation on year one on a capital asset, a tractor which might be coming up to $500,000 on the very big ones, it's not insignificant. And so it's definitely what we've heard, again, anecdotally, is that the decision to bring forward capital investment has definitely been impacted by the ability to claim an investment boost. Maybe the plan was always to do that, but maybe it wasn't 2 to 3 years away, and they've brought that forward to this year. So that is positive from a productivity point of view, but also from a general economic growth point of view. The investment boost was always to be targeted at that capital investment play versus, say, a scenario where you reduce the corporate tax rate. A lot of anecdotal feedback says New Zealand's corporate tax rate is higher than the OECD average, all of that. As we all know, you've got to take a blended rate of in effect, the investment boost overlay on our corporate rate. And when you take that into account, we actually are very much in the median point in the OECD around our corporate tax rate.
Yeah, a quick sub. So the real measure of success for investment boost is not necessarily the bringing forward of capital spend, because then you'll just have a peak and then it'll drop off. Yep. The actual real criteria for investment boost being a success is the additionality. What is the mechanism that you have to measure the additionality of spending as a result of investment boost? Given it won't be till April, but is there a mechanism that IRD is doing as post-evaluation?
The reality is I don't think there's any easy way to do what you're suggesting. I mean, ideally from an assessment perspective, that's ideally what you would do. You would either have a control group or you'd have some base measure, but we don't have the luxury of either of those two. So it'll actually be very difficult, but I think international evidence does demonstrate that partial expensing does result ultimately in faster GDP growth. So with a combination of what we'll gather through the IR10s and looking at the broader macroeconomic changes, which you'd expect to see that over a period of a number of years. Those two will suggest an outcome, but it'll be almost impossible to measure the additionality because we don't know what the counterfactual would have been.
Because Treasury obviously estimate to be 0.1% per annum over the next forecast period.
Yeah.
And the rest of it is fiscal drag and inflation.
So I think the international evidence was something along the lines of over 20 years it results in an increase in the capital stock of something like 1.6%. That's over 20 years. The bulk of that apparently occurs in the first 5. But actually measuring that is very difficult because it's not like we capture information about investment intentions from all of the parties for the next 5 or 10 years. So we don't know, we can't tell you explicitly how it's changed. All we can do is measure what's happening and try and infer from that what differences it making.
One of the deliberate points around when the policy was designed was for it to be applicable in effect in a broad base. It applies to everything with very few exceptions. And the counterfactual to that policy from a simplicity point of view is equally as, well, do you have a point of comparative basis of an aspect or a part of the economy that's not under that model?
Yeah, exactly.
And that is just the trade-off element here. But we do know in other jurisdictions have heavily utilised this as a mechanism, particularly through COVID. You are right, absolutely, that the purpose of this is around increasing capital investment into businesses to drive underlying productivity in our economy. And the greater productivity, which is a major challenge for us, is something that in part can be aided by increasing in capital investment. The acceleration of that capital investment, even with years in time, while a timing difference in a tax sense, is equally an important point of view from an economic point of view as well. So I don't see that as a negative, bringing forward expenditure because we get that immediate productivity gain as soon as that asset is deployed. And what we are seeing, and just going to the energy or the climate space, just to finish off, is that battery, grid scale battery operation up that was just opened recently by Contact, again in public domain, was a good example of a large scale capital project, which was on the capital plan for outer year, but as a result of the remodelling of the fiscals on investment boost was something that they advised us brought it forward in terms of that capital deployment. And while that's a capital benefit, it equally has quite significant other economic benefits such as storage, grid security, and broader implications on energy as well. So, that's the point. If you build a new hydro dam or a new solar farm, you're also going to be eligible for investment boost. And that's something that we are doing to positively incentivise any New Zealand business to deploy capital in a way which helps our economy.
Thank you, Minister. We have met time. I'd like to thank you for your time.
I've just got one tiny little sup on that.
Sorry, Megan, we have
I
met
have to
time.
be quiet the whole
Very well.
time.
Thank you, Peter and David as well. Thank you.
Thank you.
Because we started early.
Yeah, we don't,
Started early.
we actually could insist we go to advertised time.
Thanks, mate.
We started 6 minutes.
Doesn't matter.
Long day.